for pathology. I hope you guys have revised it, or if not, have kept it in your to-do list. That was approximately a 3.5 hour session, which we are going to replicate today for another 3.5 hours, but this time it's microbiology and rest of everything remains the same. That you will get the PDF after the class is over, and it's going to be a session where we will focus on both MCQs and theory and try our best to revise as much as we can. So yeah, I think everyone has joined in. So for other, no, rapid revision reignite PDF that you're asking, sorry, that I cannot circulate because this was something as an app subscriber feature. So it is only available on the app, and that I cannot give right now. Okay, so we are done. And like last class, any queries other than the microbiology LRR, that I will take at the end of 3.5 hours. Students who have queries can stay back and the others can leave. Not gonna waste any more time because truly I have a lot to complete today. I've got 120 slides. I will keep giving you a check after every 1 hour as to how many we've finished and how many are more to go. But we are going to go in the same order. A little bit of bias, that is because I want you to revise in the same order in which you've studied, so that it's a full revision from start to end, cover to cover. So general, micro, then fungus, parasite, bacteria, virus. That's the order in which we will go. And I think we are good to go, right? Any other queries? I promise I'll take them at the end other than LRR microbio, right? Okay, so then we will start with, and for those who are asking, sorry, before I start, the rest of the things also remain the same. For micro, you are supposed to do rapid revision. After that, you are supposed to do the rapid revision reignite, which was the TND session. That, of course, is only for the subscribers. And then you, in the end, last 10 days when nothing else can be done, that is when you come down to only LRR. So that's the entire plan which I told you for path also, and same goes for micro. Let's go. Question number 1, you know where we are going to start from. The first 5 questions are very predictable, but you have to revise them. The first question over here is a 32-year-old construction site worker coming with fever and blood in the sputum. So you know that's the first thing coming to my mind will be TB in our country. If it wouldn't have been a case of TB with blood in the sputum and fever, I would have also thought of lung cancer. But this is microbiology. So I know we are dealing with ZN stain. ZN stain protocol, as all of you correctly told me, has to be. See, first 5 questions predictable, right? So when I talk about ZN stain or Ziehl-Neelsen stain, they will always ask you the protocol in which it is performed, and that is class has asked mnemonic. So quickly revise and tell me all other questions with it. Number 1, we have carbonyl fusion. What is carbonyl fusion going to give? It is going to give a red color to the organism. That is carbonyl fusion. The next thing that we add is going to be heat. Heat is going to act like a mordant or a fixation, right? After that, we will remove the color. How do we remove the color? With acid alcohol. Which acid are we using? H2SO4, right? Once you have removed the color, now you want to give a color to the background, this blue color, and what will you give it with? That will be methylene blue. Very good. So this is also settled. Now you will ask me next that, ma'am, which acid you told me? H2SO4. So they will next ask me what are the different concentrations of H2SO4 for every organism. You know, this comes either as a match the following, or sometimes it comes as a simple one-liner. Listen to this very, very carefully. Number 1, when I say Mycobacterium TB, T20, so between 20 to 25% H2SO4 is used. For lepra, all of you, I can see answers coming. Perfect. Lepra, 5 alphabets, ma'am, 5% H2SO4 is going to be used. Now this 5% H2SO4, when it is used, it is now known as a special stain, not just ZN stain. It is now known as fight for stain. So remember, fight 5%, fight 5. That's how we learn it. Coming to the expected question, for Nocardia and Legionella, it is 1% H2SO4, and when I use 1% H2SO4 Nocardia, it is known as the modified ZN stain. So you know, in another maybe 1 or 2 hours approximately, when we reach bacteria Nocardia, I will give you questions of Nocardia and I will ask you what is the special stain for Nocardia. Option A will be ZN stain, option B will be modified ZN stain, and please mark modified ZN stain for Nocardia because modification means you've used 1% H2SO4. That could be a question coming up in your exam. Coming to the last, for spores and sperms, we use the least amount of H2SO4, 0.25, 0.5, somewhere around that. And I think everything over here is settled. I'm not highlighting all your names because you're giving correct answers. Anywhere I feel you've given a grossly incorrect answer, I won't call out your name, don't worry, but I will correct you. Only then I'll highlight your comment that, okay, yeah, there is something wrong which you need to work on. Okay, moving on to the next, the sequence of this is done. So after Zn stain, the next stain that I'm going to ask you will be gram staining, but they will never ask you, okay, what is the procedure of gram staining? They will always say that there will be some build up in the history, in the stories, little bit of storytelling hoga uske andar. So what is it? They've said there's a microbiology resident, they're wasting your time. Now the real crux is that they will ask you that there are cultures of E. coli and Staphylococcus aureus, and read this line very carefully. After completing the gram staining, full gram stain is done. Now tell me, Staph aureus is gram positive. Gram positive is always purple in color, and E. coli is gram negative. Gram negative turns out to be reddish or pinkish in color, so option B becomes the best answer. Now, how else could have this question come? So obviously we are dealing with what? Come in and stain. I believe everyone knows that. What is come in and stain? Ma'am, first thing you will be adding will be crystal violet, and that is why gram positive is getting a purple color, because you've added crystal violet. After that you have added iodine. This you must have seen in your previous year questions. Now this is what? This is a mordant. So now if I ask you what is the mordant that you have in gram stain, the hammer, the fixer, that is iodine. What is the mordant that you had in Zn stain? That was the heating that you did. So both these things become very important when you're asking questions. Okay, crystal violet, iodine. Now again take out the stain decolorizer. So you're using alcohol or acetone. If you've taken out the color, then you add another color, and then you're adding safranin. Safranin is a red color stain. That is why gram negative is reddish pinkish in color. So now they asked you after completing. So at the end, gram positive is purple, gram negative is pink. Okay, but if I would have said you're a resident and you are wanting to differentiate between these two, what is the color that you will get at the end of adding iodine? At the end of iodine, there is only one color, that is crystal violet. So at this stage, what would you have marked? At the end of iodine, over here you would have said both the organisms are going to appear purple. It's very important that you read the question, that at what step. Don't just be blind in the exam. Gram staining, to chalo purple red. Don't do that. Read where exactly has the examiner stopped. So can you tell me which is the most crucial step? I will highlight that in bold. Which is the most crucial step in a gram stain? Critical step, crucial step. It is the step of decolorization, means adding alcohol or acetone. This is also something which I've added in the rapid revision videos. It becomes important for you. Perfect answers. Moving on to the next question. Here you have a light microscope, and what function does the condenser serve? For some reason, in the light microscope, they are obsessed with one part of it, that is the condenser. For those who quickly wanting to revise, this is how a light microscope looks like. If I ask you where is the condenser, this over here is the light bulb, so I will make light over here. Light will go where, ma'am? Light will go over here. That is the stage. I'll write chota chota stage. Stage is where I've kept the slide, the specimen. So light has to go on the stage. So this over here is going to be the condenser. So where is condenser present? It is question number 1. I'm not writing, you know this so many times. Now they ask you where is condenser? Is it above the stage, on the stage, below the stage? You will say, ma'am, I know it. Condenser is below the stage. Next question, they will ask you what is the work of condenser? It will focus the light where? It will focus the light over here. It's like spotlight. This is our hero, our slide, our specimen, and we have to focus the light on the hero, spotlight on the hero. So condenser will focus it on the stage. So focusing the light on a sample, that is one thing. If I ask you, I've not got your question, but if I ask you a very run of the mill ghisa pita question, that what is the maximum magnification that a light microscopy can give you, and then you know the answer to this is 1000x. That's why I didn't put it up as an MCQ. What else will come as an MCQ is the next question that you have. If you are an intern and you're wanting to study cells and microorganisms, you are using a light microscope, you have to put the sequence. See, in this question they will not give you this diagram. ये मतलब this works on your visual memory. Have you seen a light microscope? So you will start looking at the options and you'll be like, हो जाएगा. But where will you make a mistake? What has the examiner asked me? From where to where? Give me the correct arrangement. From the eyes to the light source, means from the eyes to the light source you have to arrange. So what will come first? Which is the first lens in which you peep, you look into from the eyes? The eyepiece. So this over here I will write as eyepiece lens over here. After that, the next thing that comes, ma'am, this over here is going to be these lenses near the object are the objective lenses. And finally what comes in the end? In the end comes the condenser. So option C. Please note, you could have gone other way round also. This is also a correct arrangement, na? Ke pehle there is condenser, then there is going to be the objective lens, then there is eyepiece lens. This is also correct arrangement, but see what the examiner has asked you, from where to where. So in the exam, na, sometimes you will, that is what you say, na ma'am, I come close to 2 options, but I can't rule out. That is because you're not reading something in the question which the examiner has given purposely to confuse you. Whenever you get stuck between 2 options, get back, revisit your question, read it like you used to read your textbook in school, essay finger laga ke word by word by word. So that is when you will realize that yes, I have missed out something and I can rule out whatever I was stuck between. Moving on, if I've taught you a topic, I will finish it off. So this is like 5-7 slides of rapid revision that I've squeezed into one slide for your revision. Light microscope, everything you have done. If I ask you that what is this microscope, even if you're sleeping, you will be able to tell me, ma'am, something is dark in the background. So this must be a dark field microscope. That will never be my question. My question is dark field, why and when will you use it? Can you see what have I highlighted? A spiral bacteria. Spiral bacteria means spirochete. So I will use it for anything. Whenever something is very, very patla, very, very thin, I might not be able to see it on light microscope. Then what will I do? I will use dark field microscope. So what is thin, ma'am? Any thin spiral bacteria like spirochete. Name one. Abhi ke liye I'm not writing. We have questions on this. Treponema pallidum, syphilis wala. That is used, how do you see it? Using dark field microscope. What else is very thin in a bacteria? Flagella. If you want to see flagella, you will use dark field. And if they will never give you this. They will say, oh, there is a microbiology intern. He wants to visualize a very thin structure in a bacteria. Which is the best microscope? He should use dark field microscope. Coming to this one, this is looking like a spaceship. It is closed from everywhere. Everywhere closed means you have tried to create a vacuum over here. Reason being, you are dealing with electrons. This is the electron microscope. Excellent. All of you are giving me some other answers also, which I am ignoring for now. Silver impregnation, because I have questions on them when we will move forward. Okay, this is simple, ma'am. It looks like a vacuum because I'm dealing with electrons. For electrons, I will have to keep it in vacuum. Now, quickly tell me, if I'm sending a sample, going back to path LRR, if I'm sending a sample for light microscope versus I'm sending a sample for electron microscope, this you will write with me. What is the fixative that I'm going to use? For light microscope, ma'am, you will put the biopsy in what? You will put the biopsy in 10% neutral buffered formalin. Even if you learn 10% formalin chalega. But for electron microscope, what is the fixative that you are going to use? 2 to 2.5% glutaraldehyde. 2 to 2.5% glutaraldehyde is going to be the fixative. Excellent. Now coming to the last one, which I had got answers. As soon as you will see this kind of shining green color, remember in the path LRR, I told you this immunofluorescence of anti-nuclear antibody, of kidney, so many immunofluorescence. So which microscope, ma'am, we are using? Which microscope? Fluorescent microscope. What is different? There are two parts different. Which special type of light is used? Excellent. UV light use hota hai. And what is the special type of mirror that is added inside this microscope for the functioning? It is the dichroic mirror. All answers are okay? Finish off. What is the principle? That the light that is going from here, initially it is of shorter wavelength, but the light that is going to finally reach my eyes is going to be of a longer wavelength. So I'll keep zooming in because I've tried to fit in everything in one slide. Reason being that when you will download this PDF, you will get everything in half a page. Matlab one slide is half a page. You will get everything in one flashcard which you can revise in one minute before the exam. So that is the principle. But how did the light get converted? What color did I add to the specimen? I have added some dyes, you know them. For TB, what is the dye? It is going to be auramine, rhodamine. I hope you selected auramine and rhodamine for Mycobacterium TB, because I'm not writing it, I've written it a million times. Why did I not write rhodanine? Rhodanine is for copper. N wala rhodanine is for copper. This is rhodamine, auramine for Mycobacterium TB. Very good. For malaria, excellent. I've got answers. Acridin orange is the fluorescent dye. And for fungus, I will teach you again in half an hour. It is going to be calcoflower white. For fungus, which is the fluorescent stain for fungus, it is fluorescent. That is calcofluor white. So all your microscope related important questions are on one page, and I can move on to the other question over here. So I've given you a little bit of hint. I have given you, examiner will not. But still, let's read. There is a 45-year-old male patient with fever and escherichia on his arm. Now, I'm not saying always. I'm just giving you one hint. Whenever they will write fever and Escherichia in the exam, either they are talking about Bacillus anthracis, that is their one favorite bacteria, or they are talking about एक और चीज होती है, which I will teach you in some time, that is scrub typhus. These two bacterias and their Escherichias are their favorite questions. Abhi ke liye, why did I think anthrax? Why didn't I think of scrub typhus? Because they have said this person is handling animal hide. Animal hide means animal skin. Maybe these people are working in the leather industry or whatsoever. So this is known as hide porter's disease. Animal skin, porter means coolie, the person who carries animal skin. So because of carrying this animal skin, he will start developing these eschers because the animal had anthrax, and now it has come to this person also. So anthrax, ma'am, for that they have said, how will you demonstrate the causative organism? I know you guys knew the answer. It is to do with Macfidian. If you read the options, what am I trying to teach you? Ma'am, India ink, quelling, Macfidian, latex agglutination. What are these tests for? These are all tests which are done for capsules. Now firstly, India ink I have ruled out because India ink is for a particular fungus. Which is that fungus? It is Cryptococcus. That I'm not talking about. Cryptococcus I will talk about in half an hour. Cryptococcus to causes meningitis. This is not a case of meningitis. Cryptococcus ke liye I do latex agglutination test, so that is also ruled out. Now I'm left with option that is Macfidian reaction, which is done for anthrax. What is so special? Anthrax has a capsule. That capsule is made up of polypeptide. So now please remember, every capsule that I study, capsule of Neisseria meningitidis, capsule of Streptococcus pneumoniae, so many capsules you will teach us today in 3.5 hours, ma'am. All the capsules will be made up of polysaccharide. All capsules are made up of polysaccharide. If I would have had to test polysaccharide capsule, I would have done a Quelang reaction. What is a Quelang reaction? I would have done antigen-antibody reaction if I was dealing with polysaccharide capsule. But the exception is that anthrax is the exception. It has a polypeptide capsule. For polypeptide capsule, we do the Macfidian reaction. What is Macfidian reaction, ma'am? You add a stain. What is the name of the stain in this reaction? Methylene blue. So remember, Macfidian reaction, I add methylene blue. The capsule will become purple, blue in color with methylene blue. That is Macfidian reaction done for polypeptide capsule. So imagine if this was a question of say Neisseria meningitidis or Streptococcus pneumoniae, usual capsules, I would have marked Quelang reaction. But this is a question to do with polypeptide capsule of anthrax, so I have marked Macfidian reaction. So final answer is settled. Okay with everyone? Capsule related questions are done. Moving on to the next question over here. I have to match the following. This, by the way, came in INI-CT recently. I'm also trying to cover, I'm not saying you have to do all INI exam questions, but at least two recent papers of 2025 you should be covering before going in for your exam, which means this November exam and the May INI, these two papers you should be doing for all 19 subjects. I've got you a question from there. They've told you that there is some parasite or bacteria and some organ of locomotion needs to be there. What do I know? See, match the following. You will not know all four options. Be very smart that what do I know? Let me apply that knowledge. I know Balantidium coli is always learnt as coli, so coli and coli will go together. Then I know that I have never read anything for Toxoplasma gondii. I have not read any motility, no twitching motility, no shooting star motility. It doesn't have any organ. So this is also ruled out. For Trichomonas vaginalis, do you remember twitching motility? Motility will always come with what? Motility will come with flagella. So what am I left with is the question, Neisseria has type 4 pili, which is something which I will teach you once again. And all of you have given me the correct combination. So I want you to revise the combination once more. And now I want you to tell me everything you wrote in rapid revision. Finish it off here now and wrap it up. Tumbling, your favorite motility. Tumbling, like falling. I always used to give you the example of your drunk friend falling left and right, tumbling left and right, and that drunk friend is Listeria, FMG's favorite bacteria to be asked for motility. Tumbling motility, and this tumbling motility is going to be present, remember, at a temperature at 22-25 degrees centigrade. It will have tumbling motility, whereas it will not be present at 37 degree. I always told you with the help of age that you can afford to get drunk in your 20s, but you can't afford to get drunk in your 30s because then your liver and your metabolism will not support you. So can I say Listeria is that organism which not just shows tumbling motility, but it is different for every temperature. It is also going to show me excellent differential motility. Don't forget this. This is the favorite thing that the examiner asks you: differential motility, tumbling motility. Meanwhile, I saw everyone had given me answers to the next. Darting. Darting means like a dart, very, very fast. If I put a star over here, remember, this is also known as shooting star motility. Like you can't see Tutta Tara, you can't see a shooting star, right? So that is by Vibrio and Campylobacter, both. Vibrio more common. Coming to the next, corkscrew. Like a screw, it is moving forward and backward. That bacteria looks like a screw also. The shape of that bacteria is a screw, and it moves also like a screw, and that is known as Treponema pallidum. That is going to be syphilis wala, right? Coming to T for T, twitching motility is shown by Trichomonas vaginalis, as I just told you, strawberry cervix one. Coming to falling leaf, girta hua leaf, we all know Giardia lamblia. Last class also I had a question. This class also I will have a question. So what am I left with? I'm left with swarming. What is swarming motility? Swarming motility is shown by, I've got you a picture over here. I hope you remember this photo. Concentric circles, ma'am, like this in circles it is moving. Swarming motility is shown by PVCs. Today I will have two questions on swarming motility. I'm telling you the first question right now as it is, mug it up, because if you mug it up properly here, you will answer it properly after 1 hour. What is PVCs? It is shown by most common Proteus, you know that. Next, which Vibrio? Remember, not Vibrio cholera, it is shown by Vibrio parahemolyticus. Next, coming to Clostridium tetani, tetanus everyone has heard of, and lastly Serratia. All of these are going to show you the swarming motility. And what is the next question, that I will come to in a while. Now some of you ask me, ma'am, all this we knew, but this is something new to us. Can Neisseria is a chota sa cocci, can that also show motility? Yes, it can show motility, and that is by type 4 pili. That I will come to in 5 minutes only. Moving on to the next question. I know you are very well versed with this question, but it is my responsibility to complete the syllabus, and hence I have put it over here. You have a 65-year-old blind man living in a rural area with respiratory infection, and despite treatment there is no improvement. Respiratory problem. Sepsis may the patient has gone, and they have very nicely told you that, oh, this is a case of anthrax. So you will realize, ma'am, anthrax I have read even before coming to anthrax. About anthrax, I studied it comes from animal skin, Hyde-Potter's disease. That question is done. Anthrax can also show pulmonary symptoms, pulmonary anthrax, and spores are leading to it. What is the phase of bacterial growth curve where spores are formed? As I said, I know you know it. It is just a formality that I'm doing, that we have to complete the syllabus. So this is the growth curve, which all of you know. First question will come, label the growth curve. So remember, what I'm showing on the x-axis is the time, and what I'm showing on the y-axis are the number of the bacteria. So first I realized the bacteria is not growing in number, it is the same number. What is this? Lag, which is pretty much what we have in our preparation most of the times. But on some days, ma'am, we get extremely motivated by looking at some motivational video or some Instagram reel, and then we start working a lot, and that is known as bacteria is dividing. That is known as log phase. But after that our motivation dies, and then again our GT scores, they hit a plateau. These days everyone must be in that plateau phase of GT scores. That is known as stationary, and after that our motivation dies off. So that is bacteria has also died off. That is death. Always remember, lag, log, stationary, and death. I'm sorry for being so relatable, but that's very important that you learn it this way. What questions will come? So remember, in the lag phase, is the number increasing? No, there is no change in the number. What is increasing is only the size. The bacteria is eating, becoming fat, and that is all that the bacteria is doing, because it is saying, I will see. You are thinking that, oh, from tomorrow I have to study a lot. That tomorrow I have to study a lot. So today let me just take all the break that I want. Let me watch a lot of Netflix, let me roam around a lot, let me go watch movies, because from tomorrow I'm going to work a lot. So bacteria is also prepping up. That is the lag phase. It is accumulating all metabolites and becoming fat. Maximum size, which phase? Lag phase. After that the number will start increasing. Now when the number will increase, automatically the size will go down. Kaam karna shuru kar diya na, it has started working, so it is having weight loss. It is increasing in number, that means the size is going to go down. And then comes the stationary phase. What is stationary phase? Stationary, we have always learned stationary, stat. So what all happens in the stationary phase? Spore formation, like in this question, will occur in stationary phase. toxin production will occur in the stationary phase, antibiotic production will occur in the stationary phase, and bacteriocin production will occur in the stationary phase. All productions will occur here. Spore formation, toxin, antibiotic, bacteriocin. ये भी सबको याद आ गया, everyone remembers it. Finally, of course, the cell count will go down because death will happen. No one will ask you a question on that. These are the most, so safest guess, maximum things are happening in the stationary phase. I think we are done with this question. Moving on to a question which I expect this time, because antibiotic resistance has been spoken about a lot in the news also, and as general awareness to the public, they're talking a lot about resistance, and in pharma it is important as well. 32-year-old patient with chronic skin infection is diagnosed with methicillin resistant Staph aureus. Usually when they talk about resistances, Staph aureus is their prototype favorite question that comes. Now the physician is concerned about the rapid spread of drug resistance in Staph aureus. Which of the following is the most common mode of drug resistance transfer? This is the only question where I've got a mixture. Most of you are correct that it is transduction. So which is the answer over here, and I take that correctly. But if I would have not written Staph aureus, I would have just asked you generally that which is the most common mode of drug resistance transfer. So the most common mode, if asked, it is going to be conjugation. Overall pucha, in all the bacteria, most common, how does one bacteria transfer resistance to another? It is conjugation. But in Staph aureus, if I will ask you, then your answer is transduction. So can I just, in like one line, can I just know the meanings of these three? What is transformation? I've got you three pictures. Maybe you can label it for me. This bacteria wants to give the DNA to this bacteria. In order to give the, let's say, antibiotic resistance, this antibiotic resistance has to go to this bacteria. Who is going to carry it? Which is this tadpole-like structure? I will write a short form. This is a bacteriophage. Remember the Zomato Swiggy story, the food delivery apps. They pick up the DNA from here and they will go and deliver it to another one. What is this known as? Perfect. This is known as transduction, transportation. So it is going to transfer the genetic material from one bacteria to another, and who is going to be the delivery partner? It is going to be bacteriophage. This is one way of how resistance can travel. What is this method? This is a bacteria. What did it do? It said, no, I don't have money to spend on these food delivery apps. I will just pick up any food which is for free. My friend is giving a party. I will go in that free ka party and I will eat food. So it has picked up any random DNA from the environment. This is known as transformation. Transformation is the free uptake of DNA from the environment. Free ka khana. Coming to the last one, if this DNA has to get traveled to the other one, it says I will only travel via a bridge, a contact. Contact has to happen. No food delivery apps or anything. I will go sit in a restaurant with my own hands. I will eat food. No one will order it to me. Contact is important. Then only the DNA will travel. That is contact wala conjugation. So transfer is going to occur via a bridge. And what is that known as? Conjugation tube. Remember, if it is through bacteriophage, transduction, free uptake hai, then that is transformation. If it is by contact, that is conjugation. This is the most common method of antibiotic resistance transfer. But in Staph aureus, this is the most common method, that is transduction. If they want, they will give you questions from image point of view rather than theory point of view. Everyone's understood this. Moving on to another, I told you, first 5 questions are going to be very, ma'am pata tha, these are going to come, but that is how it is, because if you don't do these questions, you will not revise the concepts. Find the incorrect combination of temperature mentioned. This one question I make you do in every LRR because this revises every different temperature that you have to know, and you have to know the incorrect. Some of you started marking D. Please read carefully. I've asked you what is the incorrect one that you had to pick up over here. So D to correct hai na. Autoclave is 121 degree for 15 minutes. What is wrong in this? Okay, now I started getting some answers of Holder's method of 72 is galat. So pehle to, if I noticed, all these are what? These are heating. I'm doing sterilization. I want to clean the scalpel, the scissors, the glass, test tubes, gloves, etc. in my lab, in my hospital. Now how do I do it? I've tried my best again to squeeze everything in one flashcard. All the different heating wala things are over here. Why have I made a division over here? Because yeah, this to everyone identified, na, hot air oven, it looks like an oven. This is dry heat. only heat is being applied, whereas everything on the other side is moist heat. Moist means there will be some vapors and some steam. So please remember, the first thing that I'm writing is going to be dry heat, hot air oven. In the hot air oven, what is the temperature? Perfect. 160 degrees centigrade is the temperature. For how many hours will you clean any apparatus? Let's say glass, test tube. 2 hours. Repeat with me. Hot air oven, 160 degrees for 2 hours. What all can I keep inside it? Number one, any test tube, any flask that you want to keep, any glass related thing. How will you close these test tubes? You usually put cotton inside them. So cotton also you can clean. Any glassware you can clean. Any cotton swab you can clean. And remember one song I always taught you: oily, greasy, liquidy, dusty, all these rhyming things. Anything oily, greasy, liquidy, dusty. Let's give you some examples. Any oil that you are using in your culture media you want to clean, hot air oven. Any kind of greasy material like wax, let's assume they say liquid paraffin wax has to be cleaned. Liquid paraffin wax, it is liquidy. Wax क्या होता है? Greasy. So ma'am, hot air oven. Dusty, dusty means dusting powder. Any dusting powder, maybe for the gloves, maybe for cleaning. How will you clean that? With hot air oven. So repeat with me, sing with me: oily, greasy, liquidy, dusty. They are by hot air oven. These are only having dry heat. Now what will I go to? I will go to moist heat. Once you're done with this, I will come back to the question. Question अपने आप हो जाएगा. Moist heat, I can see below 100, at 100, above 100. Okay, below 100, everyone remembers. How did we learn this? That below 100, low 100, we have two things. One is known as I for inspissation, P for pasteurization. I'm not going to write. Pasteurization is for milk. All the mother dairy, Amul milk that you consume, it is pasteurized. It is important that you have pasteurized milk, otherwise you will have bacterial infections. There are two methods. This is what we asked in the exam. This is what they asked us in the previous question. Holder method, common sense, hold for minutes. Flash method, quick, within seconds. Holder method is going to be 6330. Flash is 7220, means 63 degrees for 30 minutes hold and 72 degrees for 20 seconds hold. Flash, obviously na, jaldi hoga. Which is better? I saw someone write it already. Ma'am, flash is considered to be better. I'll put a star over here. What is being done in our day-to-day dairy farms, etc.? It is the flash method. Why is it better? It kills that one bacteria which holder method cannot. Let's write that also. छोटा करके यहाँ लिख लेते हैं. It kills a bacteria that is known as Coxiella. Coxiella, in some time I will teach you, it causes Q fever. Q fever, that is killed by the flash method, and that is why it is better. Moving on to, okay, pasteurization done. Now let's come to inspissation. Inspissation का एक song था, 80-20, 80-20, 80-20. What is 80-20? Because I know temperature has to be kept below 100 na? So this means 80 degrees for 20 to 30 minutes on day 1, then on day 2 once again, and then on day 3 once again. Every day it's going to be 80-20, 80-20, 80-20. Inspissation is done for 2 culture media. Which are the 2 culture media? I expect a question on this somehow. मतलब gut feeling, ऐसा कुछ नहीं है. I just feel something like this around it at least will be asked. Inspissation for 2 things. Number 1 is going to be LJ media, TB wala, and number 2 is going to be LSS media. LSS I will teach you for diphtheria. In a while we will study. So for LJ and LSS we will be using inspissation. What is inspissation? 80-20, 80-20, 80-20. Below 100 is done. At 100, so I don't think you have to learn. Obviously boiling of water is at 100 degrees, but is boiling of water like, okay, are you 100% safe from all the infections just by boiling water? No ma'am, because boiling does not kill the spores. It is good, it is effective, but it does not kill the spores. I need something at 100 degrees which will kill the spores, and for that we are going to use sterilization. Why? Boiling be 100, if someone asks you, common sense, everything is not रटने का ना, कुछ तो समझोगे भी माइक्रो में. That boiling is also at 100 and tyndalization is also at 100. Boiling doesn't kill spores, but tyndalization kills spores. Why? Because boiling is a one-time procedure, 15-20 minutes and done. Tyndalization is a 3-day procedure, means for 3 days you will treat that substance at 100 degrees for 20 minutes every day. 120, 120, 120. So remember, inspissation was 80-20, 80-20, 80-20. Tyndalization is 120, 120, 120. Remember that. Finally, coming to above 100, to pata hai, this pressure cooker thing. When you see a lamba sa long pressure cooker with a whistle on the top in a lab, that is an autoclave. How much above 100 degree? 100 degrees, थोड़ा सा ऊपर 121 degree 15 which means for 15 minutes. And what is the pressure? Because it's a pressure cooker, ma'am, you said it is going to blow that whistle. So how much pressure? 15 psi. But remember a twist in the story. If I want to kill prions, you know, prions are very, very resistant. They say almost impossible to kill. Then I can't keep 121 degree. Then I will have to increase the temperature to 134 degrees, and I can't do 15 minutes. I will have to do 1.5 hours. Yes, for prions. Then also it's not 100% that you will be able to kill them. They are that difficult to eradicate. So let's forget prions for a minute. When I'm doing 121 15 15, what all can I keep inside this? Most important things that they will ask you in the OT before you start any surgery. All your instruments have to be autoclaved. All the aprons that the surgeon, the interns, the sorry, intern to nahi pehenta, intern to is doing paperwork, all the surgeons, all the nursing staff, everyone who is wearing aprons, those are autoclaved. And all sutures, right? All sutures except any suture which is not kept in this is going to be catgut sutures, except catgut. Catgut you can't heat to 121 degree. Catgut will break, it will lose its elastic properties. I mean, it will totally be spoiled. For catgut you do radiation, right? For catgut you do radiation, but for all other sutures you're going to do autoclave. In fact, all culture media are also kept in autoclave. Blood agar, chocolate agar, ABCD agar, all culture media in autoclave. And then I want to write except LJ and LSS, which are going to be for inspisation. You must have understood itna, so you have also understood the examiner's psych by now, that he loves these exception wala things. All sutures by autoclave, but catgut sutures are going to be by radiation. All culture media by autoclave except LJ and LSS by inspisation. You know, these are potential questions. Now coming back, tyndalization 120 120 120 correct था. inspisation मैम 80 20 80 20. अब एग्जाम में यू सेड मैम ने कहा था 80 20, एग्जामिनर ने लिखा 80 30. दिस इज रॉन्ग. डोंट बी इन अ हरी, रीड. मे बी 20 का 25 30 minutes हो जाएगा, आई कैन एक्सेप्ट. बट हियर देव रिटन होल्डर्स मेथड फॉर 72 degree. टोटली रॉन्ग, बिकॉज होल्डर्स मेथड is 63 degree for 30 minutes. This is the incorrect, the grossly incorrect one which I have to mark. Autoclave 121 15 15 is also correct. So I think we are settled. Can we move forward to the next question? If I would have asked you something like this, what is the ideal agent of choice for sterilizing the shown instrument? I mean, I could have shown you any endoscope, laryngoscope, bronchoscope. I've just given you one picture, but any endoscope, laryngoscope, bronchoscope, कोई भी scope पूछा जा सकता है. The point of asking you a scope is that yes, all the scopes are going to be cleaned with Sidex, and Sidex comes by the name of, I mean, Sidex is the name, the chemical is 2% glutaraldehyde. So I realized glutaraldehyde has only 2 questions in the entire 19 subjects. If they ask me what is going to be the fixative for electron microscope, which I taught you some time back, it is 2 to 2.5% glutaraldehyde. And what is the market name of 2% glutaraldehyde? It is going to be Sidex, and Sidex I will be using for all the scopes, except, you know this, right? Arthroscope and ureteroscope. For that, what do we prefer? We prefer plasma sterilization, yes. And don't, these are all patient wala scopes na, which are going to go inside the body, laryngoscope, endoscope. Don't include your stethoscope in it, wo alag hai na. Stethoscope, just don't be in, usually these are like when we become blinded in the exam, that ma'am ne kaha tha scope Sidex, scope Sidex, aisa ratta laga ke gaya na, scope Sidex, and suddenly you're like stethoscope Sidex. Nahi, stethoscope is going to be cleaned with isopropyl alcohol, right? So don't be in such a blind mode in the exam. Open your eyes, be alert. Now you said all scopes are by Sidex, but arthroscope and ureteroscope are by plasma sterilization. Exception, examiner's favorite. He will always give you a question on plasma sterilization. He will always give you this white color ka dabba machine. This dabba box machine is nothing but a plasma sterilization. And sometimes on the machine what will be written, sometimes, not always, will be sterad. It means the same. Sterad is what? Sterad sterilization machine, right? And with sterilization, plasma sterilization. What is plasma? This is not the blood wala plasma. I'm sure you know that. This plasma is like fourth state of matter, solid, liquid, gas, and then fourth state of matter is plasma. How did you make plasma? Very good, most of you are right. It involves the utilization of H2O2. From H2O2 I am actually going to create plasma. So now you can understand, right, that this is going to be very efficacious. But why have we kept this white color dabba? I mean, it's closed, I can't see anything, because I made sure that to create this I have had a vacuum. Only then plasma will be created. So let me read some other questions also. If they ask me a question, all are true about sterad, see, sterad word will come, matlab plasma sterilization, except, let me start reading this and also understanding it. Number one, firstly, all are true except, I think you've got the answer. Chamber used for carrying out plasma sterilization uses ambient air as the medium. Are you using air or are you using vacuum? Ma'am, this is totally wrong. I've got my answer, because we are using vacuum. Not only are you using vacuum, you're also keeping the temperature very, very low. Reason being that if you want to make plasma, you can't make it at 100-degree temperature. You have to keep the temperature very low. You don't have to learn the temperature, it's less than 50 degree, but low temperature रखना है. So are you going to can be utilized for sterilization of products which are heat sensitive? Yes. If anything is heat sensitive, I can clean it in this machine, because in this machine the temperature is very, very low. So this is correct. Is this going to produce less toxic products than ETO? ETO क्या होता है? ETO is the short form for a gas called ethylene oxide. You know, if ever you ask me that, ma'am, what is better, plasma sterilization has more efficacy, or ETO, I'll always say ETO is even better, even more supreme if you want to clean something. But ETO is a gas. Gas will release some products which are toxic, which are maybe cancer causing. Toxic products honge. Plasma sterilization doesn't have any toxic products. So is it less toxic than ETO? That is also correct. Now finally, what is the control that we use for plasma sterilization? It is Bacillus stereothermophilus. Is this also the control for something else? Because the next question is on controls. This is the control for two things. Number one, Bacillus stereothermophilus. Thermo word is coming. So remember, this is always used in places where heat is something which I focus a lot on. Thermo. One, I focus on the heat a lot in autoclave. Second, I focus on the heat over here also. I have to make sure it is very, very low temperature. That is going to be plasma sterilization. So now if I've taught you this question, everyone, you're okay with plasma sterilization. Now quick 10-second recap. All scopes are going to be with Sidex, but arthroscope and ureteroscope are plasma sterilization. It looks like this white color dabba called sterad. Vacuum hoga, temperature will be very, very low, and the control is Bacillus stereothermophilus, because the next question is on controls. Please match with me. Either it will come as one liner or it will come as match the following. There is no rocket science that can come in this. These are the only two ways this question can come. So how do you match the control method? For hot air oven, we will always go for Bacillus atrophius or subtilis, whatever is written. That is the control. For autoclave, and I told you I'll write chota chota over here, plasma sterilization. What is it? It is Bacillus stereothermophilus. For membrane filtration, these days they will be so much obsessed with filters, right? Thanks to the AQI being so bad and air purifiers being used. Water pollution has always been there. Water purifiers are being used. So whether air purifier, water purifier, membrane filters will be used. Filter has a very small pore size. The bacteria which I'm using as a control has to be very, very small. And that small bacteria, in the exam you can get two. Either it is going to be Bacillus diminuta will tell me minute, chota bacteria, or Serratia, because that is also a very small bacteria. And coming to the last, that is ionizing radiation. For this, we will always be marking Bacillus pumilus. How did we learn? Pumilus is for what? Pumilus is for radiation. Pumilus is for radiation. So, kya sare ho gaye? If I have to, I've got you a screenshot from your rapid revision videos. Kaha ma'am? Hot air oven ho gaya, autoclave and plasma sterilization, radiation done, filtration done. एक बचा. What is the control for gas sterilization? Remember gas sterilization, abhi I told you ethylene oxide. So for gas sterilization, what is the control? G for G, GloBG. FMG students, wake up now, because this is the question that messed up everything for everyone 2 years ago, because everyone was so confident. GloBG gas, GloBG gas, ऐसा याद करके रट के बहुत अच्छे से with confidence they went. In the options they asked you what is the control for gas sterilization, and GloBG ढूंढते रहे, but it was not there in the options, which was such a bad thing to do for you guys. But examiner hai, he can do anything. He's entitled. No one is going to question him. So then what would I have marked? These were all the options given, ma'am. GloBG was not there. GloBG is the new name. हमने एज अ स्टूडेंट नया नाम पढ़ा. एग्जामिनर एंडेड अप गिविंग विद द 20-year-old name because he can do anything. The old name, which family did GloBG belong to? The same as hot air oven, subtilis family. So my advice for you is, if you ever find your matching answer in the exam, mark it. If you don't find your answer, कि मेरा answer तो है ही नहीं options में, what am I supposed to do then? Then the safest is Bacillus subtilis for anything that doesn't match your answer. Like over here, I couldn't find GloBG, so what did I mark? I marked subtilis. ऐसा कोई भी situation आएगा, safe answer, mark subtilis. All your controls are done. Can we move on to the next question, guys? Okay, which of the following constituents of the fungal cell wall are absent in cases of mucormycosis? Fungal cell wall photo they have given to you. They may give, they might not give, because options are given. My question as of now is, okay, B. Everyone is saying beta 1,3 glucan is not there. Just have a look at this once. I've moved on to fungus. I'm not talking about that bacteria, gram positive, gram negative. No, this is fungus wala cell wall. What are the main things? I notice fungus cell wall will always have chitin. I'm highlighting a few things. Any fungus, histoplasma, dimorphic fungus, superficial fungus, skin ka fungus, hair ka fungus, chitin will be present. Then I can see some beta 1,3, beta 1,6 ऐसा glucans written, and then I can see something called manoproteins written. तो मैम क्या क्या questions आने वाले हैं? Firstly, when I say that beta 1,3 D glucan, or you remember beta 1,3 glucan, all the fungi are going to have it. So if you come to me and you say that, oh, this is a nail sample, nail pe ma'am, I think there is a fungal infection, so this is a nail sample, can you do a test? I'll say, okay, if you're suspecting fungus, I will do beta 1,3 D glucan testing because all fungi will show it. But which are the fungi which do not show beta 1,3 D glucan in their wall? And answer is BMC. Some people learn it at Bangalore Medical College if you want to, otherwise BMC is also good enough. Blastomyces does not. Mucor, as they asked you in this question, does not show beta 1,3 D glucan. And Cryptococcus, which I'll teach you, meningitis wala, that also does not. So BMC mein there is no beta 1,3 D glucan, testing will come negative. Next, I also had something called mano, galactomannan or manoprotein. This is also almost present in all the fungus, but in the lab, which organism do you do it for? I do it for Aspergillus. In fact, do you know, I have started calling this test not galactomannan test. I call it Aspergillus galactomannan test because it is done only for Aspergillus in the lab, and especially not every Aspergillus. Invasive Aspergillus. Invasive means that Aspergillus will not be limited only to skin. It will invade into your blood vessels. It will go to every part of the body. That is why doing one test for Aspergillus separately is very, very important. Is this okay with everyone? All. Someone called BMC as bun muska chai. Excellent. Jaisa man kare, guys. Any mnemonic that sails your boat, you are free to add it. Beta 1,3 D glucan testing is done for all except BMC, not done for mucor, and that is why I've got the answer over here. Another very important expected question of the exam. Moving on to the next. There is a patient who presents with scaly skin, redness, and irritation and small blisters all over the skin. A very dermatology non-specific kind of a history given. Blisters, irritation, redness. Doctor has suspected a fungal infection, thank God, because we alone on blisters couldn't have suspected it. The skin scrapings are sent and they've asked you the culture media, so we know it is the SDA. You know, it's a very simple question, right? That they're asking you for fungus, what is the culture media? Subaurous dextrose agar, that is SDA. They might write the full form, you should know the full form. What beyond this? Level 2 question kya hoga? That what is the pH of subaurous dextrose agar? Anything that matches this subaurous dextrose agar, anything between 5 to 6, 5.6 or 5 to 6, around this the pH. So can I say the pH is slightly acidic? If this is how it's written in the paper, it is slightly acidic. Yes. Question 1 is done. Question 1 was it is for fungus. Question 2 was the pH is 5.6. Question 3, what all is there? Can you see what all is added? Cyclohexamide is is added, gentamicin is added. Why are you adding antifungals, antibiotics? Why are you adding this to the subaurus dextrose agar? Because common sense, do you want bacteria to grow? Do you want altu faltu fungus to grow? No. You want only the fungus of your choice to grow. Like if you are suspecting candida in a female, you want only candida and those kind of fungus to grow. You don't want the normal fungus to grow. So normal fungus will be stopped from growing. You don't want bacteria to grow like Staphylococcus aureus, Streptococcus. So antibiotics will be added. So some antifungal and antibiotic unnecessary चीजें हटाने के लिए you have added these things. These are the things asked you for SDA. Fungus था, answer is clear. What is this? What are these two? Chocolate agar, you know it looks brown in color. No question left. What is PTA, which I will teach you in a while? Potassium tellurite agar, I will teach you in half an hour. It is used for Corynebacterium diphtheriae. It is one of the best media, selective media for Corynebacterium diphtheria. Next, what is this triple N? This do you remember with the story also that I've taught you so many times. Karke, that there was a story of the, the very rich couple who has gone on a cruise. Remember Trypanosoma cruzi? So for Trypanosoma cruzi and for Leishmania, the Kala Azar one, Leishmania Kala Azar, you use triple N media. All this we will come to in 5-10 minutes. ये सब cover हो जाएगा. अभी के लिए you said SDA ना, so now what I'm gonna do in 30 seconds, all photos that are important of fungus you have to revise with me, and all these photos I have put up as a flashcard over here. So let's get, abhi you said SDA, this is how SDA looks like, this is how the fungus ka culture media looks like, subaurus dextrose agar, and now you can see, huh ma'am, some white growth is there, okay, fungus is there, and from this growth, if I pick it up, as from forceps I pick it up and I look at it under the microscope, blue color stain क्या use किया? LPCB. What is LPCB? Lactophenol cotton blue. Blue color is very obvious. It is shown over here. So can I say I picked up the culture from here and I saw it under the microscope, means morphology. For culture morphology, which stain will I use? Have I, like you, अभी इसमें क्या था question में? This patient had skin scrapings ना. Imagine if I took the skin. Have I directly put blue color on the skin? Have I taken the skin scraping and put blue color? No. I took the skin scraping. I first grew it on SDA. From SDA, I took the culture and I put the blue color. So I have not put it directly on the sample. What are the stains you can put directly on the sample? You took the skin and you started putting. So if you're putting a blackish color stain, it is gomori methylamine silver stain, because silver, I'll mark silver with black. Silver always gives a black color. If I want a pink color stain, you will say PAS will give a pink color to the fungus. If I want a fluorescent, this so you guys have only told me fluorescent is calco, flower white. So all these I am putting on the patient's skin, nail, hair. But ma'am, skin, nail and hair, they have keratin. Skin में keratin, nails में तो a lot of keratin, hair also have a lot of keratin. If keratin is there, how will you look at the fungus? You can't. So before you see any fungus, keratin hatao, remove the keratin. How do I remove the keratin? What is this? This is the question. I've got your screenshot from your Q bank also, that if you get a question like this, what is the primary purpose of using KOH preparation, potassium hydroxide? KOH क्यों use करा? Because you see na, KOH is like transparent. You are using KOH to, very good, to digest the keratin, remove the keratin. So KOH is for removing the keratin, so that keratin hata and then the fungus will be visible. Okay, very good. I saw some answers over here that, oh, this is the spaghetti and meatball appearance. You guys are going one ahead. I will come to this appearance in 5 minutes. Okay, let's move on to the next question that I have over here. Which one of the following options listed below is a fungal agent that affects the subcutaneous layer of the skin? You know, till now, dimorphic fungus has been quite the rage. Everyone's been asking you dimorphic fungus. I think this time they will venture into subcutaneous layer. Fungus affecting the subcutaneous layer. And you know that they've asked you which of the following is subcutaneous. Excellent. You are saying Sporothrix schenki, right? So what are the different? Let's start now. In exactly, I would say in 30 seconds, pura fungus ka chapter should be write down in 5 sentences. Firstly, which are the fungus which go to superficial? Superficial means only skin wala area. So these are all the tinea ones. Their name only tells you tinea capitis or derma related dermatophytes. These are all superficial skin wala cheezein. When I talk about subcutaneous are, abhi I'm not giving you questions, just overview, revise once, कि हाँ, what is the entire fungus का chapter. Mycetoma, you've heard of mycetoma foot, Madura foot, mycetoma foot, subcutaneous. Rhinosporidiosis, rhino means nose में होता है. Chromoblastomycosis, chromo, copper penny bodies wala, subcutaneous. And sporothrix, rose gardener's disease, that is also going to be subcutaneous. So remember, MRCS, these are the 4 things which are subcutaneous. All 4 will have one question abhi in the next 5 minutes. Then after this will come dimorphic. Dimorphic means they can have two morphologies, which I will teach you in a while. And then you will have opportunistic. Opportunistic means the patient will be HIV positive, CD4 count will be given, and then all the others which I've heard of, Candida, Aspergillus, Mucor, then Pneumocystis, Carinaica infection, Cryptococcus meningitis, all these happen in HIV positive. But ma'am, you didn't teach us dimorphic fungus. I've just written something and okay, very good. You've written it for me. That is why I wrote a short form. So abhi ke liye, why did I not write? Because that's the next question. For the time being, they ask you which of the following is subcutaneous. Subcutaneous mein MRCS, that is why Sporothrix schenki is the answer over here. So dimorphic mein kya kya aata is the next question. Which of the following organisms exists as yeast form at 37 degree and hyphal form at 25 degree? What do you mean by this? Yeast form looks chota chota gol gol like this. Hyphal is also known as mold, and it looks like these long threads like this. So we always learn it as yeast, heat, mold, cold, which means yeast form will exist at a higher temperature of 37 degrees heat, and mold form will exist at a lower temperature of 25 degrees. So remember, yeast at heat and mold and cold, very good. Body heat probably changes shape ke accordingly. The dimorphic fungus over here is going to be histoplasma. What is body heat probably changes shape? ये तो नहीं पूछेंगे ना exam में. They will ask you the name of the organisms. So yes, the heat is going to change the shape. Body heat probably changes shape. What is with B? It is blastomycosis. I'm going to show you one photo, one question of everything. Blastomycosis. What is H? That is histoplasma capsulatum. Answer over here. Probably we have Penicillium marnefi. P is also for paracoccidioidomycosis, and then you remove the para, so you get the coccidioidomycosis. And the last one is going to be for sporotrichosis. Now I want to ask you something. Sporothrix schenki has come in dimorphic fungus over here. Sporothrix schenki also came in subcutaneous. So which is that organism? They ask you which comes in both categories. मैंने highlight कर दिया. Which is the organism that comes in subcutaneous also and dimorphic also? This is a previous year question. I'll write PYQ over here, and that is Sporothrix schenki. Let's move on to the next question. So now you realize that you have done the entire thing. Pura fungus ka chapter in 10 seconds if you have to revise. First revise the classification. You will get an idea that what is affecting where. Now let's move on to a question which you were telling me a while ago, that ma'am, a 28-year-old man has come to the outpatient department with a rash in the upper arms, otherwise healthy, no allergies, medication. Hypopigmented scaly patches are present on the arms. Hypopigmented is buzzword number 1. Then they are saying that the culture was done. There are no results on regular SDA. What fungi cannot be grown on regular SDA? Tinea versicolor answer mila. So firstly, I hope you know Tinea versicolor, and if they would have written Malassezia furfur, the furfur, or many of you, as you know, just for fun call it furfur for some reason. So that's also chalega. Malassezia furfur and Tinea versicolor. Hypopigmented, less pigmentation. Yes, it shows that. Then I must have done what? I must have done that transparent mount, KOH mount. And on KOH mount, yes, these are all the ... that is the meatball, and the long threads, which is the spaghetti pasta. So spaghetti and meatball appearance is going to be seen over here. And when I do the culture media, of course I will use SDA because it's a fungus, but not regular SDA. I will have to add little bit of oil. Olive oil. Why? Because this organism loves fat. It says, I will grow only if you give me some source of fat, and if you give me oil, I will make anda fry. That is, it will look like fried egg appearance. Remember in patho we did so many fried eggs. We made a list now, oligodendroglioma, etc, etc. I'm adding microbiology fried eggs today. Fried egg appearance is seen with Malassezia furfur. So that's what they asked you. Which is the fungus which is difficult to isolate on regular SDA? Because I can't. I need to add some little bit of olive oil for adding the fried egg appearance, and that is what is important over here. So that is why tinea versicolor or Malassezia furfur. Okay, meanwhile I saw all the patho fried eggs coming in the comments, which is great. I'm not repeating them because we did it twice over in the path LRR, so I don't want to repeat things. Abhi ke liye Malassezia furfur is for microbiology. Moving on to the next question is a patient who made a self-diagnosis of athlete's foot, a very important derma question that comes, and began using a product advertised on TV, just an Indian patient as always. The patient did not show himself to a dermatologist. A skin scraping was sent and there was a slow growing colony which showed abundant microconidia. You know, this will be a question where you will have to wait and wait and wait to reach the buzzword. Starting with, did you see how much of story building happened, how much of your time they wasted where they were talking about a TV advertisement, he's not following the dermatology protocols. In the end, you saw the word abundant microconidia, and then they asked you, which dermatophyte are you picking up over here? Trichophyton. So now you'll have to just be patient for 30 seconds, because in 30 seconds I will make you revise the entire tinea things, because what we are talking about, I can see three things written over here: Trichophyton, Microsporum, Epidermophyton, and together they come under which family? They come under dermatophytes. But clinically, what do you call all of this? You call this teniasis. Patient to calls it ringworm infection. Patient ka to alag terminology. Teniasis is what you call it. So now over here, these are all the different derma tinea things that you have. Please, I've written them. I just want you to revise in 10 seconds these 6 pictures. If the tinea happens on the scalp where you wear a cap, what is that known as? Cap wali jagah pe tinea capitis. Okay, on the same scalp, if you start now seeing these flakes, SSI, you are seeing these white crusts, right, as the scales are stuck over there, these are known as the tinea favis, also known as scutula. So you can also learn it as scutula because it will show you scales and flakes. If on the scalp it looks like, if you touch it, it feels like a water balloon, as if there is fluid inside it, what is this known as? This is now known as carrion. In the exam question, it will come as boggy swelling. Touch karne pe it looks like water filled water balloon, boggy swelling. So scalp say three things. We have tinea capitis, then we have scutula, then we have carrion. Now coming to this is on the trunk. You can see umbilicus, abdomen, trunk. This is known as tinea corporis. Corporis means trunk. Now look at the next one. Over here I can see the tinea is actually making these concentric circles. This is known as tinea imbricata. How did we learn this? Imbric will show you concentric appearance. Imbricata will show you concentric appearance. And last one, to you know what is this? Nail infection. Nail means ungworm. So this is going to be tinea ungworm for nail bed. Common sense. So I don't think anything very difficult in this, but still it is asked. So now when you say tinea, these are all clinical terms. How does it come down to microbiology? You all know, many of you have started writing my Telegram channel's name because you know that mnemonic. You might feel that, oh, you have taught this so many times, ma'am, but that is because it comes, touch wood, it comes in every exam, and I want that thing to continue. We are not up here to put any jinx on this. I hope it comes in this exam also. The three TMEs are Trichophyton, Microsporum, Epidermophyton. First, differentiate them on the basis of the microconidia. Microconidia descending order means in Trichophyton these chota structures will be a lot. Microconidia are a lot. In Microsporum, hardly one, two chota but very few are seen. And in Epidermophyton, in the background, I don't see any. So the microconidia are in the descending order. Here they said most abundant microconidia are seen. That is why I marked Trichophyton. Now coming to the macroconidia, look at the big structures. If it looks like a pencil, that is going to be Trichophyton. If it looks like a spindle, it is going to be Microsporum. And if it looks like a club, it is Epidermophyton. So remember TME for Telegram, and then all of you wrote it as Preeti Sharma channel. So that is my Telegram channel, hai na? And which I always taunt you guys, that the channel on which everything other than academics keeps happening, selling of apps, scamming people, spamming messages, all of that. So right, and sometimes a lot of entertainment happens. So non-academic ज़्यादा चलता है वहाँ पे. TME and PSC. One sure short question on. You will be smiling in the exam because you will have something to do with TME, PSC, ऐसा कुछ होगा. Now the latest buzz around this question, hair perforation test. What is hair perforation test? You can see a hair, okay, यहाँ पर तो it's just a regular hair looking like normal hair. Over here I saw another hair, but in that hair I can see there are some wedge like perforations that are there, because now I want you to tell me which fungus can perforate the hair. Hair perforation test will be positive for which fungus? T mentagrophyte. T means ट्राइकोफाइटिन. ट्राइकोफाइटिन mentagrophyte, उसके नाम में है ना फाइट, वो हेयर को फाइट करके फाड़ देगा. इट इज गोइंग टू tear the hair, it is going to perforate the hair. So remember, mentagrophyte is going to fight and is going to perforate the hair. That is the hair perforation test positive. These days, if a question doesn't come on TME PSC, they want to add some variation, they will give you a question on hair perforation test. So this is also done. I move on to the next expected question. This time, if examiner makes the paper in a sane mind, there are some questions which are pretty much expected, which have been doing the buzz during this time in other exams also, like hair perforation test was one of them. This is the next one. This has come in every exam in this year, so FMG is the one that is next. A 45-year-old man comes with chronic painless nodule on his foot that has progressively enlarged over the past year, and upon examination the buzzword is draining sinuses with black grains. See, whenever they say there is a foot and then there are draining sinuses in that foot, you are dealing with obviously that mycetoma ya madura foot, what you call it. Now this can happen because of two reasons, and listen very carefully. Either that, I'll write madura foot also in front of it, either it can happen because of a bacteria. Bacteria कौन सा होता है? Actinomycetoma बोलोगे if it has occurred because of a bacteria, and eumycetoma बोलोगे if it has occurred because of a fungus. Repeating, actinomycetoma if it has occurred because of bacteria, and eumycetoma if it has occurred because of a fungus. Now over here, when I saw this could be fungus also, this could be bacteria also, but microscopic examination shows thick walled grains and hyphae. Hyphae to will always be shown by a fungus only, na. Hyphae is not a thing to be seen with bacteria. So now if I see actinomadura to bacteria, nocardia is also going to be a bacteria. Oh, the C and D unfortunately came out to be same options, but they are, I mean, they had to be something different. They are the same thing. Madurella mycetomatis, that of course happens to be fungus. Most of you answered C and D, which is right. That of course is a fungus, and that is going to be giving black grains is the next thing that you have to learn. Madurella mycetomatis is a fungus. Obviously, eumycetoma ki baat chal rahi hai, but what color grains does it form? It forms black color grains. Very, very important for you to know over here. Now if I ask you that chalo agar ye fungus hai, fine, chapter closed. If it would have been a bacteria, either it would have been actinomadura madure, or it would have been nocardia. Which out of these would have been positive for Zn stain, which I taught you as the first slide an hour ago? Zn stain, ma'am, modified Zn stain for nocardia, this would have been Zn stain positive, and actinomadura madure would have been Zn stain negative. Just asking you something which if I had to correlate this kind of a question. Perfect. Moving on to the next question. This is a classical. There are some things like you all know na by now that truck driver wala history will always be to do with a genital ulcer, unsafe sexual practices, syphilis. Truck driver, they always associate with that. Same way, South India, somehow they have associated with swimming. So whenever a question comes as a patient of 1 to 3 whatever age is from South India, you always have to make sure that swimming as a buzzword should pop up in your mind, even if it is not written. Now they say the patient is having everything to do with nose, ENT problems ho raha hai, sneezing, rhinorrhea, and there is also cough. There is polyps in the nose. Now you know those polyps with endospores, rhinosporidiosis they are talking about na, obviously. And what is true about the diagnosis? Most of you are saying fungal spherules on biopsies. Okay, so when I talk about Rhinosporidium seaberry, just read the word Rhinosporidium seaberry, everything will be done. Rhino will tell you that it is going to occur in the nose. So you can see in this picture very clearly over here that in the nose I have these polyps, right? So in the nose, rhino, seaberry, what kind of polyps? These are known as strawberry polyps. You can see the shape over here. Okay, sporidium. Sporidium means it shows sporangia. When I look at it under the microscope, I will notice these big structures which are sporangia, and I can see these small dots inside them. These are endospores. So this was written, na, the fungal spherules will be seen, or there will be spherules with endospores. Okay, so nose ho gaya, sporangia ho gaya, strawberry ho gaya, sea reminds me of the ocean, sea. There will always be a history of swimming, so mostly a patient will be mentioned from South India. So remember, nose, sporangia, South India, strawberry, rhinosporidiosis is done. So tell me, if it's considered as a fungus, because we are reading fungus chapter, is it something which is going to be cultured on SDA? No. Can it be cultured on SDA? No. This is said to be a non-cultivable organism. So yes, fungus is cultured on SDA, but this is not cultivable. Then they started saying, is this even a fungus? है भी ये fungus या नहीं? Because it is not growing on SDA. And now, yes, all of you are right. It is said to be an aquatic protozoa. We read it in the fungus chapter, but we mentioned that it is now being classified as an aquatic protozoa. Okay. Moving on to the next question. ये question आएगा, you will not read the question also because the answer will be shouting. The examiner is shouting the answer. फिर भी गलत करो, then that is your problem. You are at fault. You don't want to pass the exam when this comes over here. Coming to Dr. Anjali said a question, does nocardia cause Madura foot? Rarely it can. Yes, it can. Okay, but yeah, actinomadura will be more common. But can it, since you asked me, it can. Yes, copper penny bodies dikhega, ma'am. I will not read anything else and I will mark chromoblastomycosis. Perfect. But I have to see that there is someone who's working in the forest and is struck with a wooden stick. So this tells me that this is to do with trauma. Some history of trauma. Either the person is walking barefoot or the person has been struck with a wooden stick. So some trauma will be present. And what are these known as? Copper penny bodies. No one will ask you this dumb question. Is this a copper penny body? Obviously it is. It is the other names that they will ask you. Kya hai other names? You have to revise these. Medullary bodies, muriform bodies, sclerotic bodies. ये नाम लिखे होंगे. Medullary, muriform, sclerotic. These will be written in the exam, not copper penny bodies. And copper penny told you, acha, chromoblastomycosis. How does it occur? It usually occurs with history of trauma. So either there is a barefoot walking or some wooden stick. And let's assume person is a farmer, he's walking barefoot. So on his foot, you will see these cauliflower-like lesions. Cauliflower in derma are known as verruca, warts, verruca. That is why chromoblastomycosis, other name is what? It is verrucous dermatitis. What if examiner was smart and he didn't write chromo? He would have written verrucous dermatitis. It was your job that you can identify it in the exam. So now telling you, this is just the name of the disease. FMG exam में 2 years, I think 3-4 sessions ago, they asked you what is the organism for chromoblastomycosis, and then everyone was like, chromoblastomycosis organism nahi tha. No, it is the name of the disease. The fungus that causes it are all the bad names, and that is why they give you in the exam na. Something that gets worse in microbiology is where examiner says, हाँ ये वाला question पूछते हैं. So the name of the organisms are the toughest, but all FFFF names come here, like Fonsacia pedrosi, Fonsacia compacta, Exophylla, Phylophora, Cladophylophora. So anything that goes around the same FF wala ek tongue twister banega. All of these are organisms which are going to be for chromoblastomycosis. Yes, now let's go on to, because since I thought I'll take a break, so I thought that you should sit and read. Aram se baith ke question padho. This is pretty much how it's gonna be in the exam also for all of you. There is a 45-year-old male with history of AIDS coming to the clinic with persistent fever, weight loss, cough that has worsened. AIDS and this kind of a history is very common. Every AIDS question starts like this. Rural area, Southeast Asia, where he encounters bamboo rats, and I think I got my question, because with bamboo rats there is only one question that comes in the entire microbiology. Penicillium marnifi. Yes. So when I say Penicillium marnifi, rat ko jhadu se, remember jhadu se, so that this appearance over here must be the broom appearance. Jhadu se mar ke lal karna, so the color of the pigment had to be red color pigment. Yes, this is exactly what you had to mark because you thought it was Penicillium marnifi. Okay, so what am I talking about? What is Penicillium marnifi coming under? Dimorphic fungus. So remember you told me body heat probably changes shape. Now what I'll do in this one slide, we have to finish off everything. हमारे पास है 45 seconds का timer, which means all these photos you will now tell me. I've written it in the same order. Body heat probably changes shape. सिर्फ मुझे photos बताओ. After that you will have a test of 2 more questions. Number 1, when I say blastomycosis, you know blastomycosis looks like 8. So the fungus is going to show me this figure of 8 appearance. Common sense, why is this looking black in color? You must have used the silver stain. Gomori methenamine silver hoga. black color, always silver. Blastomycosis, figure of 8, nothing more to know over there. Coming to everyone's favorite, histoplasmosis. Remember, hi darling, see you in the cave. Do you remember that? Hi darling will tell you hi for which part of USA is it seen in. It is seen in Ohio. Hi darling, it is also known as the darling disease. See you in the cave, it is also known as the cave disease. Sounds so romantic, right? Hi darling, see you in the cave. It is not at all romantic. It is only in movies that this is shown to be romantic. Cave में actual problems क्या होगा? There will be bats, there will be bat droppings, there will be bird droppings. So basically why caves and all have been mentioned, because bat and bird dropping is something which is going to result in histoplasma travel. So please remember, that's another question that they ask you. So now I have understood, hi darling, see you in the cave. How does histoplasma look? There are two photos for histoplasma. Both have been asked in the FMG exam. तो बिल्कुल ध्यान से सुनो. There will be one photo and same picture आएगा. So you have to make sure you know how to identify. There will be a picture over here where you will just see multiple ऐसा random dot dot dot. When you see छोटा छोटा dot dot, that must be the छोटा वाला form. Means which form? That must be the yeast form of histoplasma. In the next photo, you will see these long threads, these golas with some projections on top. What are these known as? These are known as, I'll write them again for you. These are known as tuberculate macroconidia. FMG thrice this image has come. So this is an image you cannot afford to forget. Tuberculate macroconidia. Two photos of histoplasma can come. Zoom out करके देखो, because in the exam you can't zoom in na. So once you will see these dot dot wala, those are the yeast form. Then you will see these pictures like this. That is going to be the tuberculate macroconidia. Remember, histoplasma will be everything similar to TB. I'm not writing. TB का कौन सा necrosis होता है? Caseous necrosis. Histoplasmosis which necrosis? Same caseous necrosis. टीबी में क्या, वो कफ, स्प्यूटम, टीबी का हिस्ट्री. हिस्टोप्लाज्मा ऑल्सो सेम, टीबी का हिस्ट्री. एवरीथिंग सेम बट फोटोज ऑफ कोर्स आर डिफरेंट. Body heat probably. Paracoccidioidomycosis. This I don't need to write. What is this appearance that you see in paracoccidioidomycosis? The classical Mickey Mouse appearance can be seen over here. So I'll just write tick mark Mickey Mouse appearance. What is this next picture? Is this looking like वो ship का जो wheel दिखाते हैं, the pilot wheel? Either you can call it pilot or mariner wheel for the ship, right? So mariner wheel appearance or pilot wheel appearance is going to be seen. These two pictures as it is come for paracoccidio. Coming to Penicillium marnefi, how can we forget this? Marnefi, bamboo rat. मैम rat को मार मार के लाल करना है, right? Rat, the reservoir is going to be the rat. The reservoir is going to be the rat, and rat को झाड़ू से means the broom appearance, मार मार के लाल करना, red color. That is the question over here. This was the झाड़ू given over here, bamboo rat was given over here, red color pigment I had to select. Okay, coming to the next one, the coccidioidomycosis. Now listen to this photo very carefully. Are these looking like dabbas one behind the other? Yes, they are looking like boxes one behind the other. So this is known as barrel shaped arthrospores. See the same photo. I'm just adding one slide over here. When I say that in a fungus there are going to be like this small dabbas which will be seen one behind the other, you will say this is coccidioidomycosis fungus hai. If I would have said this is a bacteria, and in some time I will show you that photo, there will be these dabbas one behind the other. Do we know of a bacteria which looks like this bamboo stick appearance? Excellent. Bamboo stick appearance is seen by Bacillus anthracis, which we will study in half an hour. Very good. Excellent, guys. So this seems to be settled for us. Coming all the way back, यहाँ पर because it was a fungus, it is coccidioidomycosis, and you have to know barrel-shaped arthrospores. Finally, to last and everyone's favorite, the sporotrichosis. Sporotrichosis के सामने I have made a rose. You know what is it known as? Rose gardener's disease. Now students have become blinded कि rose लिखा ही लिखा होगा. Examiner is not dumb ना. He's not there to give you the answer like that. He will not always write a person is in the rose garden. Examiner will say the person is a farmer, the person is an agricultural worker. Or why rose prick, thorn prick can happen to you and me, a normal person also na. So someone who's just going shopping, decided to buy roses, maybe that kind of a history. So it doesn't have to be a rose gardener only. थोड़ा सा history will be, here and and there which you have to figure out. So there will be some trauma, and usually either on the foot or the hand. If the trauma has happened here, the lesion should be here, which I can see a red lesion here, but the lesion is also traveling. What is the spread? Is it traveling in lymphatics? Is it traveling in hematogenous? All of you are right, ma'am. This is the lymphocutaneous spread that is going to occur. Lymphatic channel में spread होता है patient का. So I know that. Next, what do I see? Rose Gardner disease में rose दिखेगा. What kind of a picture do I see? I see rosettes of conidia over here. What other photo can I see which I think must be hidden a little, but I guess we've made it visible. This other photo, yes, very good. Many of you are right. It's star दिख रहा है. Star मतलब which body? Star मतलब it's asteroid body. Center of the star is what? So now you have to zoom in and know. This is a star, which is very good. Everyone saw that. Center of the star is a gola, is a small circle called cigar body. Cigar is what? That's the fungus. That's the yeast fungus ka form. So this is actually the fungus, the cigar body, and that is the reaction around the fungus, which is known as asteroid body. See these pictures again. The cigar and the asteroid, the rosettes of conidia, which are very, very important. It looks like a rose, and this lymphatic spread. Because listen to these questions which I will be asking you now. Same question came in the FMG exam. After a traumatic event, a male patient presents with a lesion. Can you see how they are spreading? You must have seen this in your GTs also. Same photo aata hai na? Your task is to determine the organism responsible for it. And now you know there's a characteristic lymphatic spread that it is showing with a trauma history. I think it is sporothrix, which is very obvious over here. Let me look at the next question. See, same, but I didn't read the question also because I could see a rose being made over here. So characteristically rose lag raha hai. So I know answer over here is sporotrichosis, but you said, ma'am, sporotrichosis lymphatic spread se hota hai. Yes, there is a subcutaneous nodule that progresses along the lymphatic channels. Same thing has been written in the question. I'm not reading these questions entirely because I'm just trying to tell you that sometimes in fungus, now the image will speak for itself. Moving on to another picture, which could figure, this is from your Q bank. I got you the same. How could you correlate everything from first slide to last slide? So over here you have a 45-year-old patient coming with cough and fever for the past 1 month. There's a history of working in the construction industry and soil and bird dropping. So जरूरी नहीं है हर बार bird bad dropping ऐसा cave लिखा होगा. Anywhere a bird dropping could be given. Now there is a bronchoalveolar lavage. They've given you a picture. They've asked you that the urine antigen test for the causative agent is possible. What structures are observed? So can you notice ये वो dot 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 वाला photo आया. This means it must be the yeast form of histoplasma, yeast fungus. Fungus में क्या होता है? Right, first thing I told you, the fungal cell wall will have what? Whether it is histoplasma or blastomycosis, ये जानना ही नहीं था. यहाँ पे we just had to gather that it's a fungus. If it's a fungus, it will have chitin in the cell wall. See how they correlated a general concept with a disease. That is how level and layering of questions is done in the exam. So I think we are done with this as well, which brings us to the next easy wala. But this came in the last exam in FMG. Which of the following test is used to identify, or this test shown is used to identify a lot of candida written? Answer is our favorite Candida albicans. ये कौन सा test है? Germ tube test. Germ tube test is for 2 candidas. One is Candida albicans. One is uska double copycat doubliniensis. Whatever albicans will do, doubliniensis will say I will also do copycat double. So doubliniensis. कौन सा test? Germ tube test. Candida का photos, you want to do a 30-second recap. All pictures of Candida in one place. So we know gynae से start करते हैं. Candida कौन सा color का discharge? Curdy white discharge. If it is a discharge in gynae, you will next want to do a pap smear. Pap smear ka photos are also over here. I can see Candida shows you little tiny what chota buds, and then those chota buds, if I pull them and make them long, they will be known as pseudohyphae. This is a question for Candida they love to give. Candida identify karwana in the exam. In the question it will be written on microscopic examination. Pseudohyphae are seen. Pseudohyphae matlab Candida. Safest answer, don't think otherwise. Now when I look at it, pap smear, ma'am, curdy white discharge, pap smear, all the cells, line laga ke cells khade hain. This is known as the shish kebab appearance, which always ruins this. Whosoever likes kebabs, I know this ruins it forever for you. Curdy white discharge on Candida shows you shish kebab. Candida is a fungus. Which culture media? SDA culture media. What kind of colonies does it show you? Creamy, pasty, yeasty colonies. If you want to differentiate, see so many Candida, the albicans, glabrata, cruzi, etc. So ma'am, if you want to differentiate colorful agar, use karo, chrome agar. Do you have to know the different colors? You don't. You just have to know chrome agar is for Candida. Then the question that was given over here, the germ tube test or the Reynolds broad phenomena. You can see there is a fungus and a tube is coming out of it. So germ tube test or Reynolds broad phenomena for Candida. And if I grow Candida on a special media called corn meal agar, it is a little deficient culture media. Corn meal agar pe, it says I will start making spores. If you look at the spores carefully, there is one, this, I think this is the best picture. There is one outer line and then there is one inner line, double walled. So these are known as chlamydospores. So it makes chlamydospores on corn meal agar. Some of you in between were writing all things. Yeah, that's right. Candida tends to show us the curdy white discharge. It shows us the shish kebab effect. It shows creamy pasty yeasty colonies. It shows you chrome agar, or chrome agar is used, or it shows you chlamydospores on a corn meal agar. So safest to learn that everything surrounding this will sound the same. That is Candida. Over here, germ tube test, Candida albicans was the answer. Moving on to this. This also came 2 years ago, like roughly in, I don't remember the year, but 23-24 में question आया था. I think 24 actually, which was regarding Cryptococcus. Every year one question of Cryptococcus comes. Either it is to do with the India ink staining, or if they want to give you a tougher question, then this is it. Which of the following statements about Cryptococcus are going to be correct? This is the new pattern that has come up, where they are going to give you multiple statements and then you'll have to select A, B, C, B, C, D, etc. Many of you are saying 2, 3 and 4 are correct. This is 2, 3 and 4. This is what many of you have been saying, and then some of you gave me this. Let me read one by one. They are saying which of the following statement is correct. पहले तो is it a mold type of fungus? Mold मतलब ऐसे हाइफे बनाता है? बिल्कुल भी नहीं. Cryptococcus is said to be a yeast. Yeast मतलब it is going to be completely round like this. So it is गलत statement. Next, does it have a polypeptide capsule? The first thing I taught you today was all capsules are made up of polysaccharide. Only anthrax was polypeptide. तो ये वाला क्यों ठीक करा? Polypeptide capsule is not with Cryptococcus. Polypeptide was only with Bacillus anthracis. So this is also wrong. They've asked me correct statement. Okay. Exposure to bird droppings. Yes, Cryptococcus कैसे होता है? Pigeon droppings की वजह से होता है. So this is correct. Main Cryptococcus that I always talk about is Cryptococcus neoformans. So this is also correct. But your FMGE exam only had this question. Other than Cryptococcus neoformans, और कौन सा होता है? It is going to be Cryptococcus gattii, which has serotypes B and C. 3, 4 and 5 were the correct statements. तो अब दोबारा से सुनो. Understand with me that what are we talking about. There are 2 Cryptococcus जो हमें पढ़ना है. Many of you have started writing gattii, tree. Yes, if you go to the rapid revision videos, ऐसा नहीं है that I'm teaching you something altogether new. This is even in the RR videos. So if you skipped it, maybe just by going through it superficially, listen to it right now. Cryptococcus neoformans is the principal species. When I say that Cryptococcus and I don't write anything ahead of it, I mean neoformans only. But then there is another one called Cryptococcus gattii. For gattii, the best way is that you learn it like gattii only, because it will make your life a lot easier. Reason being that Cryptococcus gattii is most commonly seen in the tropical and the subtropical parts. Tropical and subtropical parts के पास दिखेगा, and it will be present in the soil around which? It will be present in the soil around the tree. Eucalyptus tree के आसपास का जो soil है, that is where Cryptococcus gattii will be formed. So easy ना? Tropical and subtropical areas. Gattii will be found along the eucalyptus tree. And lastly, it is seen in immunocompromised individuals also, and it is seen in immunocompetent individuals also. हो गया याद. ट्रॉपिकल, सबट्रॉपिकल, यूकलिप्टस ट्री, इम्यूनोकॉम्प्रोमाइज में भी दिखेगा, इम्यूनोकॉम्पिटेंट में भी दिखेगा. गैटी इज डन, बट द मोर कॉमन वन इज नियोफॉर्मेंस. नियोफॉर्मेंस इज सीन नॉट इन एनी ट्री और एनीवेयर, इट इज सीन एवरीवेयर वर्ल्ड वाइड. सिर्फ ट्रॉपिकल सब ट्रॉपिकल में नहीं, हर जगह दिखेगा. दिस इज सीन विद सॉइल विद पिजन ड्रॉपिंग्स, विच ब्रिंग्स मी टू अ वेरी इंपॉर्टेंट क्वेश्चन. If in the exam, maybe they will not write pigeon, they will write bird droppings. Bird droppings in simple layman term मतलब bird shit. Bird shit जाता है soil में, it mixes, and after that we end up inhaling that soil, right? So what are the 2 things with bird droppings that I have to watch out for? One is going to be this crypto, and right now I told you bird and bat droppings, histoplasma. So take home message is bird and bat droppings से histoplasma and cryptococcus, दो सोचना. But patient is very different. Cryptococcus so will go and cause meningitis. Histoplasma will more commonly cause TB जैसा lungs वाला symptomatology different, but bird dropping का sounds the same. Now Cryptococcus will always be seen in HIV positive, AIDS वाला patient, मतलब this is going to be seen in immunocompromised individuals. You've understood the differences. Now let's come to serotypes. When I say Cryptococcus, we say it is of 4 types, A, B, C, D. Out of them, the A, D wale are Cryptococcus neoformans and the B, C wale are going to be the Cryptococcus gattii. Come back to the question. Now you know gattii is going to be the B and C serotypes. Jo main wala hai, that is going to be the Cryptococcus neoformans, and jo main wala hai, that is going to be by bird droppings. So now you know 3, 4 and 5 were correct statements, but now ye to tough wala question tha. Let's get back to our easy wala baby questions, that whenever they say Cryptococcus neoformans, what disease do they say? Meningitis. Meningitis mein what will I take from the patient? I will take a CSF lumbar puncture wala sample we will take, and we will do something called the negative stain. Negative stain ka kya matlab hota hai? I'll show you the easy wala question which you have seen a lot. You will have an HIV positive immunocompromised individual, meningitis wala history hoga, headache, mental status altered, CSF puncture will be done, lumbar puncture, and they will say how will you to visualize the capsule, what is the appearance. Negative stain ka matlab kya hota hai? Negative means are you staining the fungus? No, negative means ulta. The yeast will not be stained, the fungus will not be stained, it is the background which is going to be stained. So dhyan se dekho, it is the background which is going to be stained. The fungus is to not having the color, that is a ulta na, you call it negative stain. Example number 1 is India ink, example number 2 is nigrosin stain. Easy wala question bhi dekh liya. That is if you did a CSF lumbar puncture. What if you got a biopsy? BX for biopsy, brain biopsy mila to Cryptococcus ke liye what is the stain? It is mucicarmin. This is Cryptococcus which you got over here. So CSF lumbar puncture negative stain, biopsy aaya mucicarmin, but what is the culture? Everywhere for fungus you said SDA, but they alag hai. Iske andar I can see some brown color coming. Everything about Cryptococcus is bird. It happens from bird droppings, and the name of the culture media is bird seed Niger agar. Niger of course tells me brown black color aega, which I can see bird droppings, bird agar, bird droppings, bird agar. That is how you learn it. Coming to the diagnostic test, ये सब तो culture media okay. Diagnostic test we always prefer nowadays. Pehle to it was latex agglutination test which was best. Nowadays we prefer lateral flow assay. This you've read in medicine also. It's cryptococcal meningitis, HIV positive patient में meningitis का case आएगा ही आएगा, which is very important. Coming to pharma भी ख़त्म करो, because last to last time से actually इनमें से कुछ भी नहीं आ रहा, pharma का treatment आ रहा है. Even in the recent INI-CET exam, the pharma treatment point of view was asked for cryptococcal meningitis. So many of you are saying liposomal amphotericin B, that is fine, but that's incomplete. You give liposomal amphotericin B with flucytosine and that is also incorrect. ऑप्शन सी में आंसर आएगा. लाइपोसोमल एम्फोटेरिसिन बी एंड फ्लूसाइटोसिन आपने इनिशियल ट्रीटमेंट पूछा, दैट इज करेक्ट, बट देन लेटर ऑन यू विल बी गिविंग समथिंग फॉर मेंटेनेंस एंड दैट इज गोइंग टू बी फ्लूकोनाजोल. सो नाउ द क्वेश्चन इन द recent INI-CET was liposomal amphotericin B and flucytosine was one option and these three was another option, and students ended up marking these three. But question mein pucha tha, what will you give for the initial treatment of cryptococcal meningitis? So initially to this is what we give, and then for maintenance we give fluconazole. Question ko dhyan se padhna. Overall treatment pucha, mark this. Initial treatment pucha, mark this. Now coming to what Shreya has asked, that other than the latest most thing which I will be adding in the upcoming rapid revision videos also, is that okay, latex agglutination test was a good test, then a better test came called the lateral flow assay. But if in the option the CSF antibodies, yes, that is what Dr. Shreya is asking, that CSF antibodies agar humne by ELISA detect kar liya, can that be considered an even better test? Yes. So this goes in the order that you study in medicine, that CSF antibodies by ELISA will be a better test. then वो नहीं हुआ तो lateral flow ऐसे mark करना, that is also not there in the options, then you mark latex agglutination. This is the order, depending, you have to see ना options में क्या लिखा है, then you will be marking the answer. This is the order in which you decide. Is that okay with everyone? Can we move forward to the next? Let's keep it a little simple. ये तो ऐसी just for time pass, because I know you are tired, so let's give you something which will give you confidence. 17-year-old girl presented to the emergency room with toothache on the left side of the face for 7 days with subsequent development of pain and swelling in the periorbital region with periorbital edema. Very classical head and neck history, more limited towards the eye. There is immunocompromised state mentioned in terms of immunity is down. Type 1 diabetes is there. And aseptate hyphae bola, so we know we are dealing with what? Perfect. So I don't think I have anything special to tell you. If they say that, if they say aseptate hyphae, if they say that there is aseptate hyphae, you will be talking about mucor. So I want you to differentiate aspergillus versus mucor in one sentence and finish off this question. Aspergillus के अंदर क्या होगा? There is going to be acute angle branching, and which kind of hyphae will be there? Septate hyphae. Mucor के अंदर क्या होगा? There is going to be aseptate hyphae, and what kind of branching will be there? 90-degree branching. So this is something which I didn't even get many pictures as such, because I am assuming कि 90-degree या obtuse, anything other than acute लिखा होगा, that will work. Dr. Vivek, obtuse भी चलेगा, 90-degree भी चलेगा. The concept is that aspergillus में there is going to be the acute angle branching and septate. So some of you said that ma'am, when I look back to the history, many of you said that there is black नहीं लिखा. हाँ, mucor में black fungus तो कभी उसका नाम था भी नहीं ना. Mucor का black fungus name was given by the media channels when this happened in COVID, and because patients were having black color lesions on the face, they started calling it black fungus. Doesn't mean it is black fungus. It's only a black color ester on the face. It has nothing to do with black color. तो black नहीं लिखेंगे, right? Because this is something which is made up. It is not in textbook. So mucor is not a black fungus. Okay, now coming back, so many of you answered A, and that is what just got me to A initially, but no, please be very sure. Aseptate hyphae hai, so aseptate hyphae is mucor. Can we move forward to the next question, which again, these two questions I got, ke theek hai, they will also relax, I will also relax. Drug of choice for Pneumocystis carinii and all questions associated with it. I think we've got the answer. Cotrimoxazole is going to be Pneumocystis carinii ka drug of choice. Okay. Now tell me, when would you mark pentamidine as the drug of choice? If I say that cotrimoxazole is not working, or there is a severe case of Pneumocystis carinii pneumonia, then I will be marking it. It is going to be पेंटामिडीन. ठीक है, तो क्या है ये पीसीपी एंड मेडिसिन में? तो आई थिंक मारवा सर विल ऑल्सो टीच यू दिस, द क्लासिकल क्रश्ड पिंग पोंग बॉल अपीयरेंस, जो सुन के सब पक चुके हैं. इट्स वेरी इंपॉर्टेंट. न्यूमोसिस्टिस कैरिनाई ऑलवेज, मोस्टली in fact, causes pneumonia, and that is Pneumocystis carinii pneumonia. Usually HIV positive patient, usually CD4 count less than 200. Pneumocystis carinii pneumonia होता है. This has a lot of plasma cells, that is why called plasma cell pneumonia. एक और PCP, lot of plasma cells. It shows you the crushed ping pong ball appearance. एक और PCP. Why is this crushed ping pong ball appearance looking black in color? Because it must be the Gomori methenamine silver stain, तभी it is coming black. Some are properly formed balls, कुछ are ऐसा crushed ping pong balls. So that is there. And then if I talk about what is Pneumocystis का drug of choice is going to be cotrimoxazole, and the answer over here. And severe cases में क्या होगा? Severe cases में it is going to be pentamidine. carinii की जगह some of you want to call it jirovecii. ठीक है, वो भी लिख लो, no problem. ठीक है, CD4 count also you are mentioning, that is clear. So I think this is a question जो as it is आएगा. Very very important for you to know, right? Can I move on to the next question, guys, which will tell you it's a sudden shift that has happened in your subject or subtopic, I would say. 34-year-old patient coming to the clinic with bloody diarrhea. We are back to diarrhea questions. Fever and abdominal pain after a recent history of travel, and there is entamoeba histolytica mentioned, and they are asking you what is the treatment regime. Also, how much time have we covered? So I'll give you an update also. 1.5 hours is done, and we are done with 50 slides. I have to make you go all the way till 120 approx. So now you know where you are and how much you are left with. with. Okay, so it's still, that's a good enough thing. 3.5 hour ke hisab se we are going at a good pace. We can also make it a little faster, right? Because now we have limited mental capacity left. We are done with general, we are done with fungus, which were the two which we had to do in most detail because questions bahut aate hain. Now we have parasite, bacteria and virus. Keep patience and keep your strength intact. We will reach there. The treatment for entamoeba histolytica is not just metronidazole. It is metronidazole followed by paromomycin, because metronidazole alone will only control the diarrhea part of it. How do you kill the parasite sitting in the lumen, which is said to be luminal amoebicide? So luminal amoeba kill karna hai. Luminal amoebicide is going to be paromomycin both. Always when you get these pharma questions, never be in a hurry to select the first drug that you think is the answer. Read all 4 options. And the most ghisa-pita question, which you know, what is the shape of the ulcer that you have with entamoeba histolytica, flask shaped ulcer? If it goes into the liver, what is it going to cause? It is going to cause the anchovy sauce appearance. So that is also settled. Okay, all this okay, nothing new in this. Can we move forward? There is a 32-year-old male presents to the physician. See, I told you a lot of diarrhea questions are way, with loose stools, fever and abdominal pain, and most of these diarrheas will start with some travel, trip, aisa kuch hoga. The patient is otherwise stable and general physical examination is normal. The stool examination shows a ciliated parasite. There is only one ciliated parasite that I have to worry about, and they've asked me what is true about it. Most of you are saying Balantidium coli is the causative organism. Yes, we remember Balantidium coli kaise yaad kiya tha? I've got you some screenshots which are from your rapid revision videos. I'm trying to create visual memory. There's no other way of doing microbiology. See the same thing again and again. When I say Balantidium coli, the word coli we had changed into celi. So I said, oh, this is a ciliated organism, and cilia will help in motility. So yes, this is going to be motile. This is a ciliated organism. It is going to show motility. So this is correct. Now this is B for Balantidium. B for everything will be big. This is said to be the largest protozoa, goes into the large intestine. Is it the smallest protozoa? No, the largest protozoa going into the large intestine. And B for binucleated. It has 2 nuclei. If you look very carefully, एक big वाला nucleus is what shape? Big wala is bean shape, kidney shape, and chota wala nucleus is just a dot. So there is a big wala nucleus which is going to be bean shape, and then there is a small nucleus that we have. The drug of choice is going to be doxycycline. Now let's see, organism does not show motility. I'll just quickly rule out. Organism does not show motility. Galat. Organism does show motility. Organism is smallest protozoa. Galat. It is the largest protozoa. Cyst is not the infective stage. Galat. Cyst is the infective stage. Is patient को diarrhea हो रहा है? Most of the diarrhea patients, and someone in between was asking me that can you mention, ma'am, all the different infective states? Always remember, cyst is said to be the infective stage for all these diarrhea causing organisms. So if I say what was the infective stage for entamoeba histolytica, it is going to be cyst. What is the infective stage for Balantidium coli? It is going to be the cyst. What is the infective stage for Giardia lamblia? In future I will teach you. It is cyst. One place it is going to be trophozoite, that I will tell you when the right time comes. Trichomonas में cyst होता ही नहीं. There is no cyst. So in trichomonas it is going to be trophozoite by default. But till I don't mention, just consider cyst, cyst, cyst. जहाँ change होगा I will let you know. Moving on to the next question. There are 2-3 questions which are back to back on the same lines. There's a 28-year-old female who comes to the physician with eye pain for 5 days. History of using contact lenses which she stores in tap water. Horrible mistake. After a complete evaluation, there is obviously patient has to have infection. We are using the storage solution. We are doing a culture media of it, and the probable pathogen that will be isolated out of it is going to be acanthamoeba. Yes, it is causing, basically they've mentioned retinitis, but it causes keratitis usually, or corneal abrasions, corneal ulcers. Keratitis is what it causes. That is associated with contact lens usage, and that is acanthamoeba. Now if I look at another question where I have a 26-year-old male from rural village and taking bath or swimming in the pond, now I will know that this person has started, after swimming he started having symptoms of meningitis, probably fever, headache, confusion, vomiting. There is a parasitic infection, causative organism that they are suspecting. They're asking you what is the media that you will be using for it. You are saying C. NNA, non-nutrient agar with E. coli. Okay, so this is settled. तो हम बात क्या कर रहे हैं? We are talking about Naegleria fowleri. Swimming से related वाला जो question था, that is Naegleria fowleri. Contact lens usage से related है, that is Acanthamoeba amoeba. Someone has already started asking me what time will the session end. I have no answer to that. The session will end when 120 slides will end. अभी तो हम 50s में चल रहे हैं, so that is how it is. 3.5 hours, so you have to sit. If it would have been a movie, let's say Dhurandhar, you would have been sitting. I'm not saying this is as interesting, but I'm just saying that exam होगा तो भी बैठना पड़ेगा, movie होगी तो भी बैठ ही जाओगे. So this means you still have the sitting capacity of 3.5 hours. It's not something you have never ever done in your life. You are going to do this so many times. So one moment you can sit for micro also, right? Let's get going. So two questions I got you for these two. So if a question comes related to, let's say there is, remember this story, I just give you a funny way of learning how to learn Naegleria. Whenever there will be a history of nale mein nahana, I mean, no one will say someone has gone to take bath in a gutter, but taking bath in dirty water, because dirty water is where this Naegleria is going to sit. So from that dirty water, how will Naegleria enter? It will enter through the naak, through the nose. Nose ke paas what is there? Cribriform plate. And from the cribriform plate, where will it go? It will go to the neural. And in the neural, what will it cause? Primary amoebic meningoencephalitis. So if there's a nale mein nahana, naak, okay, Puneet superstar, haan, theek hai. So okay, you can learn like that. Very good, excellent. See, so when I make you get relatable things, then so you can sit for 3.5 hours. So okay, this is how it is going to result in primary amoebic meningoencephalitis. So history of swimming will be very important. The spread is going to be via neural, so this is obvious. If I ask you the culture media, like you just told me, it is non-nutrient agar with E. coli. That is going to be the culture media. I'll put like this for both. Dono ka culture media, Naegleria and Acanthamoeba, same. So Nala Nahana story is fine. Now I come to Acanthamoeba. Acanthamoeba, firstly, why was it named so? Acantho means spikes. So if they want to give me pictures of acantho, they will give me a picture in which this is T for trophozoite. It has spikes like this. I can see the spikes over here, and they will always give me a history of either immunodeficiency, so either the patient will be HIV positive, or there is some usage of contact lens like in this patient. So yeah, to eyes ka history hoga like in this question, or it can also affect the brain, and in the brain it causes granulomatous amoebic encephalitis. So if they ask you which free living amoeba can cause granulomas in the brain, see, path micro correlation chala, so that is going to be acanthamoeba that you will see. So if it can go to the eyes also, then it can go to the brain also, so it can go to multiple areas. How is it spreading? It must be spreading through the blood. So Naegleria has neural spread and acanthamoeba has blood spread. Both of them are going to be cultured on the same culture media. Coming back, contact lens usage के साथ acanthamoeba, नाले में नहाना वाला neural history is Naegleria, and the culture media is going to be NNA, non-nutrient agar with E. coli. Treatment of acanthamoeba, yes, Dr. Akhil, I have not written for a reason, because it is a multimodality. You have to use antifungal, antibacterial, you have to use multiple drugs, and that is why they are not going to ask you the treatment protocol of acanthamoeba. Hence, I'm skipping on that. Okay. Moving on to the next question. As soon as I see this image, I know my answer. There is a string, there is a capsule. The person has been told to eat the capsule, swallow it, and the string has been kept over here. So obviously they are talking about a string test. The string test is going all the way to the intestine, so they are calling it the entero test or the E test. Entero test is done for what? It is done for diagnosing Giardia, your favorite. And where is the capsule going to go? Giardia stays where? Remember, Giardia is Dadaji stays in duodenum. So this will go and catch the parasite from the duodenum. Is this test for amoeba? No. Is this test for Echinococcus? No. All these are random statements. This is something which is option A. तो giardia के लिए entero test from the duodenum. If they ask you this question regarding the same, where you have a 25-year-old patient with fever, loose stools and nausea, and there's a history of foul smelling fatty stools. Whenever they will say fatty stools, they will always be foul smelling, frothy, fatty stools. ये वाला description होता है. And they will mostly be talking about giardia. So when they say the stool examination shows motile protozoa, giardia, गिरता हुआ leaf, falling leaf motility, motile protozoa. Which of the following statement is incorrect? Metronidazole, is that the treatment that you have for giardia? Yes. In fact, let me show you all these giardia photos. I've made a Dadaji photo, a handsome Dadaji over here, because this is an angry old man of the intestine, right? So we call him Dadaji. And Dadaji lives in which part of the intestine? This is going to be the duodenum. So I have written most commonly duodenum also. Now I've written the test which I've taught you. Which test? Entero test or string test, whatever will be there. Is string test done to obtain duodenal contents? That is also correct. I've told you everywhere what is going to be the infective form. Cyst is going to be the infective form everywhere. And what is the drug of choice? It is metronidazole. We can also give tinidazole 2 gram. That is also possible. So is that used for the treatment? That is correct. Now let's come to how does Dadaji look like? Why do you call him Dadaji? Because he looks like a man. Look at this, guys. This is trophozoite and this is cyst. Man, how many eyes? 2 eyes. So how many nuclei? There are going to be 2 nuclei. And Dadaji has a beard. So how many flagella? How many flagella are there? 4 flagella होता है? नहीं, यही तो गलत statement है. That is incorrect. There are not 4 flagella. There are 4 pairs of flagella, which means that there are total 8 flagella. So either examiner has to write 4 pairs or examiner has to write 8 flagella. One of the two. And look at this. Will I be able to count it in this picture? Yes. Will I be able to count those flagella in the exam? No. In the exam, I just have to do kya acha lag raha hai. It looks like that man with 2 eyes. This must be giardia. Flagella is very thin. Will you be able to see it? Count all 8 flagella on light microscope. The first slide you taught us, ma'am, flagella is very thin structure के लिए dark field microscope लगेगा. इस पे तो I can't count all 8, so that's why I can't see them, but I have to make an idea that this looks like a man. So how many nuclei are there in the trophozoite? 2. But how many nuclei are there in the cyst? There are going to be 4 nuclei that are present in the cyst, which is very, very important. And yes, in the duodenum, is it letting you absorb fat? It is not letting you absorb fat. That is why all the fat is going out in the stools. Steatorrhea, देखो fatty stools हो रहा था, malabsorption हो रहा है patient को. Excellent. So I think we are settled with this. This was the incorrect statement that you had. And कौन सा test करेंगे? Entero test or string test. Perfect. Moving on to the next one is a 25-year-old female coming with complaints of vaginal itching. I know all of you are very much excited. Imagine at a life where you should be excited about your own girlfriend. You are excited about Dadaji ki girlfriend is the next question coming up. Very sad life that has become. So there is a female who's coming with vaginal itching and discharge and pain during intercourse. She has had 3 different sexual partners over the past 6 years, and as a part of her workup and investigation, vaginal secretions have shown a flagellated organism with twitching motility. It couldn't get more direct. So it's trichomonas, twitching motility, flagella. Which of the following statement is true about this? Okay, so are men symptomatic and efficient transmitters? Men are usually asymptomatic. So this is obviously not. It is usually the females who end up showing symptoms like strawberry cervix, etc. Let me show you a picture. So this is the strawberry cervix, which I'm not writing, which is obvious. And what is the color of the discharge that these females usually come with? It is going to be a greenish discharge. Green discharge, strawberry cervix. Okay, now how does this look like? It said flagellated organism. Can you see Dadaji's girlfriend, as you're calling her? How many flagella does she have? So she has 4 anterior flagella and 1 long hair. Remember, that's how you made her fashionable hairstyle. I know you know the story. 1 posterior flagella. The total kitna flagella? Total 5. Dadaji had how many? 4 pairs of flagella. 8 flagella. Dadaji's girlfriend, as you call her, trichomonas. How many flagella? 4 plus 1, 5 flagella total. So now that is what is responsible for the twitching motility. Next, is metronidazole is contraindicated? Not at all. In fact, the drug of choice is going to be metronidazole. Dadaji ka bhi drug of choice metronidazole. Dadaji's girlfriend also metronidazole. But of course, it's a sexually transmitted disease, so partner treatment would be over here. Okay. Then the incubation period is 1 to 2 days. I'm not learning all incubation period. Itna time mere paas nahi hai. But it does not seem to be as short as 24 hours. It's not something that will get transmitted that quickly. Seems highly unlikely. But when I read the last statement, they've asked me what is true. They say there are regional mucosa showing petechial lesions, reddish color lesions. Yeah, that can be seen, and that is precisely why I'm seeing that strawberry cervix kind of an appearance. So यहाँ पर only correct option which comes to me is this. Yes, and perfect. The only question I was left with, which all of you have told me, कि पहले तो आता है what is the infective stage. अब now Everywhere I told you cyst, but यहाँ पर what is the infective stage? It is trophozoite. Reason being T for T क्या होता है? Trichomonas का कौन सा motility? Twitching motility, and which is the only form that exists? Trophozoite. Trichomonas only trophozoite. Cyst होता ही नहीं है. And what is the motility? Twitching motility. Now coming to the culture media. I know you are all aware of the fashionable. This girl is very fashionable, so she will love diamond. So there is going to be diamond culture media. But anything else, there is also a lash media which can be asked to you. Full form is a very lengthy name. Don't get into it. Keep your life simple. Micro में already बहुत कुछ है याद करने को. So where we can simplify it, let's simplify it. Diamond media, lash media are the two culture media that are important. Yes. Moving on to the next question that you have. This is also one of your favorites, guys. You have a 45-year-old patient from South America coming to you with fever and fatigue. Further history reveals bitten by an insect in the past, and investigations are suggestive of cardiomegaly. There is only one such history that can do the rounds, जहाँ पे there is an insect that will be bite mentioned and resulting in organomegaly from an insect bite. एक ही चीज़ हो सकती है. Perfect. Trypanosoma cruzi. Now there are two cruzis mentioned. How does cruzi transmit? It is going to be by the किसिंग बग. उससे पहले इज प्लाज्मोडियम थ्रू फीमेल एनाफिलीज मस्कीटो, ये तो सबको पता है, मलेरिया फीमेल एनाफिलीज मस्कीटो. देन क्रूजी होता है थ्रू द किसिंग बग, दैट ऑल्सो वी नो. ब्रूसी इज वॉट, आई राइट छोटा छोटा. स्लीपिंग सिकनेस थ्रू विच फ्लाई? स्लीपिंग सिकनेस थ्रू सी फ्लाई, दैट इज ऑल्सो करेक्ट ओवर हियर. क्रूजी और सैंड फ्लाई का कुछ नहीं है. सैंड फ्लाई अगर किसी के साथ आएगा दैट इज गोइंग टू बी लीशमेनिया. काला आजार इज समथिंग दैट विल गो विद सैंड फ्लाई. बट यहाँ पर बिकॉज दे आस्क्ड यू क्रूजी का करेक्ट इज किसिंग बग, एंड क्रूजी आई विल रिवाइज इन 30 seconds विदाउट द स्टोरी, बिकॉज आई थिंक स्टोरी यू गाइज नो. टुडे इज नॉट द डे फॉर स्टोरीज आप पढ़ चुके हो, आज रिविजन करेंगे. सो वॉट इज द स्टोरी दैट वी स्टडीड? ट्रपैनोसोमा क्रूजी causes which disease? It causes Chagas disease. Chagas disease is known as South American sleeping sickness. Please don't confuse this over here. There are two types of sleeping sickness that we study. When I say South American sleeping sickness, that is Chagas disease. The South American couple story we studied, that they are very rich, that their lifestyle is also very, very rich. So South American Chagas disease. How do you treat this? Mercedes-Benz benzonidazole is the drug of choice. Okay, what is the sign that travel to Rome? So Romanas sign. Romanas sign क्या होता है? Periorbital. One side periorbital swelling will be seen. Then what is that taunt that your friends are going to give to this kind of a lifestyle? That बड़े लोग बड़ी बातें story. So was what culture media? NNN culture media. बड़े लोग बड़ी बातें means all organs will be enlarged. Esophagus, mega esophagus. Colon, mega colon. Heart is going to be cardiomegaly like mentioned over here. So everything that I had put up in this story, everything fits in this question very, very well. And if इसके बाद question आया on pharma, it is going to be benzonidazole. Trypanosoma cruzi is South American. Kissing bug नहीं लिखा होगा तो kissing bug का दूसरा नाम, if I don't want to write kissing bug, they will write the tougher name, triatomine radiovid bug. Be ready for this also, because ये bugs, one कीड़ा मच्छर will always be asked either in PSM or in micro. One has to be asked. या तो वो typical anopheles QLEX पे रहेंगे in PSM that they do, or they will come to the other names of the radiovid bug over here. Yes. Okay, moving on to the next question that you have. I think something regarding this disease कुछ इसके बारे में आएगा in the exam. 20-year-old female from Africa presents with number 1 hepatosplenomegaly. There is pallor and there is lymphadenopathy. There is a high suspicion of Kala Azar, must have had massive splenomegaly. Remember last class I told you massive spleen. Leukemias में आया तो CML और hairy cell leukemia. Infection में आया तो काला आजार. We've made that table in the last LRR. Now what lab tests are useful? A typical question of today's pattern where you have multiple options, then you have further selection of those options. If you're thinking of Kala Azar, obviously the Kala Azar rapid test that you have is RK39 test. We had learnt it as rapid Kala Azar test, RK39 test, card test hota hai. Okay, so in Kala Azar I can notice that there is hepatosplenomegaly. You can see the child has a protuberant belly. The pigmentation of the skin is also, the color of the skin has become very dark, so Kala Azar. Now when I have ways of identifying, you can see कि अच्छा under the microscope you are seeing something called LD body. LD मतलब Leishmania donovani, that is the parasite. LD body दिखता है. तो what is LD body? LD body is a big cell, एक बड़ा सा cell, macrophage. Macrophage ने खा लिया, macrophage has eaten it. LD body is 1 dot or 2 dots. 2 dots. The bada wala dot is the nucleus of the parasite. Chota dot is the kinetoplast of the parasite. So this Leishmania donovani has two things. It has a nucleus, it has a kinetoplast. Together this is known as LD body. Where are you seeing it? Under the microscope. Where will you take the sample? Do you know the best sample that can be taken is from spleen? You will puncture the spleen, take blood out of it. Do you have the guts to do that to a person who's come to you with splenomegaly? Uske spleen mein needle dalo, take blood out of it. What if he bleeds to death and then the blame comes on me? Textbook says spleen is the best site, most sensitive site, but ma'am, complications. So what is preferable? Patient would not die, would be preferred, would be bone marrow aspirate. From there also I can get the blood and patient will not die or bleed to death because of it. If that is also not possible, then I can do a blood sample. So in short, I can do these three things for doing the diagnosis of Kala Azar. Please note, I will prefer a spleen aspirate. If that is not, ideally that is not done, I will do a bone marrow aspirate. If patient is saying nahi mujhe pain hoga, I'm not doing a bone marrow aspirate, then I do a blood. That is the protocol that you should be knowing for exam. But actually spleen hum practically करते नहीं हैं because of a high risk of bleeding. Yes, meanwhile many of you started telling me the treatment liposomal amphotericin B, which is very good, which you know. Perfect. My question to you was, this LD body that you're seeing, what form of the parasite is it? Is it amastigot form or is it promastigot form? And that is going to be amastigot form. If they want to ask you a very core microbiology question, they will ask you this. Kala Azar is also settled. We can move on to the next question that you have over here, which I think you've done multiple times, so I'll do it exactly in 1.5 minutes. A 36-year-old known case of HIV positive and the CD4 count is on the verge of dying, less than 50 chala gaya patient. There are complaints of diarrhea for which he took multiple stool examination. Acid fast oocysts. Acid fast means Zn stain positive, and they were measuring 4 to 6 microns. What is the proper care and prognosis of the same? So we have to see. Many of you are saying option D. Let's is the पहले तो सोचा क्या, HIV positive patient with diarrhea and the oocysts are mentioned. Are you thinking of something called as the coccidian parasites? Okay, coccidian. Some of you said Mycobacterium avium complex. See, I agree with you that there is Zn positive, so you thought of Mycobacteria, but avium complex के साथ straight away oocysts would not be mentioned. Mycobacteria is something which is a bacteria. The name only tells. Oocysts and all is something which is indicative of a parasite. So we are not in Mycobacteria chapter. Coming to coccidian parasites. So now if many of you said infection will be treated by anti-tubercular drugs. No, this is coccidian parasites. Okay, can it be treated? Why did many of you say D? Na? Anti-protozoal drugs such as nitazoxanide can be given and the infection is difficult to control. Okay, why did you think of this? Which coccidian parasites do you know of? To save time, I have written it. Whenever an HIV positive patient comes with diarrhea, there are 3 coccidian parasites you have to think of in the alphabetical order likhoge. Cryptosporidium, Cyclospora एंड आइसोस्पोरा. आजकल एग्जामिनर ने हमारा ये वाला यूट्यूब सेशन देख लिया है, सो ही स्टार्टेड गिविंग यू द न्यू नेम के ये लोग ना अल्फ़ाबेटिकल ऑर्डर में याद करके क्वेश्चन सॉल्व कर देते हैं. सो लेट मी जस्ट गिव इट टू देम इन अ वे दैट मे बी दे विल गेट कन्फ्यूज. दे स्टार्टेड गिविंग यू द न्यू नेम ऑफ आइसोस्पोरा. इट इज़ नोन एज सिस्टो आइसोस्पोरा. आई डोंट केयर एज लॉन्ग एज आइसोस्पोरा इज रिटन और सिस्टो आइसोस्पोरा इज रिटन, सेम चीज़ है. द न्यू नेम माइट बी देयर बट दैट इज ऑल्सो अल्फ़ाबेटिकल ओनली. पहले आएगा क्रिप्टोस्पोरिडियम, देन साइक्लोस्पोरा, देन सिस्टो isospora, still alphabetical. Examiner cannot beat our mnemonic. Okay, now after you've written this, size. Pehle you start cryptosporidium is 4 to 6 microns, then 4 and 6 ka double kara, so that is going to be cyclospora 8 to 12 microns. Then you just go 12 का टेबल जो जो आता है, जितना मैथ आता है, डबल ट्रिपल कर लो. सो दैट इज 24 to 36 microns. दिस इज द इंक्रीजिंग ऑर्डर एंड ओवर हियर सिंस दे मेंशन 4 to 6 microns, आई एम वेरी सर्टन दैट इट इज गोइंग टू बी क्रिप्टोस्पोरिडियम. एग्जाम में आई टेल यू व्हाट हैपन्स. एग्जाम में यू लर्न क्रिप्टो. अब एग्जाम में व्हेन यू रीड अ क्वेश्चन यू डोंट नो इट्स कम फ्रॉम फंगस और पैरासाइट और बैक्टीरिया, तो क्रिप्टोस्पोरिडियम भी सेम लग रहा होता है. and Cryptococcus meningitis भी same लग रहा होता है, but cryptococcal, and right now you might feel how dumb, but in the exam we are that dumb person doing such things, right? So cryptococcal, let's assume they gave you some crypto organism and they asked you the treatment. So imagine for Cryptosporidium the treatment you are saying is nitazoxanide, whereas for cryptococcal meningitis it was liposomal amphotericin B with flucytosine and fluconazole. So you see how you can, maybe what if all of these are in the options and you still mess up. एग्जाम में क्रिप्टो नहीं पढ़ के जाना, रीड द नेम. That was Cryptococcus. This is Cryptosporidium. So now coming to the shape, जो CC वाले हमने पढ़े, they are all round. That is going to be Cryptosporidium is round, Cyclospora is round, but this Isospora is going to be like this, long and oval. So Cryptosporidium is round, Cyclospora is round, but Isospora is going to be oval like this. All of them are going to be acid fast, not just acid fast, they are cold wala acid fast. Cold Zn stain का दूसरा नाम, it is the Kinyon stain. Why cold? Because the first slide of today's class was Zn stain class has asked mnemonic. Remember, you were heating. In this you don't heat. If you don't heat, it is cold Zn stain. All of them are acid fast, but Cyclospora is cyclical. Sometimes acid fast, sometimes not acid fast. Cyclical होता है Cyclospora. Coming to the treatment, Spora brothers का treatment same, that is cotrimoxazole. Spora brothers are going to be treated by the same thing, but cryptocurrency with Nitambani you remember, and that is why the drug of choice is nitazoxanide. Coming to the thing back, Cryptosporidium था, that is why you decided on nitazoxanide. Self dissolving नहीं होगा, cotrimoxazole नहीं देंगे, nitazoxanide देंगे, and that is the answer, which all of you were right. Okay, moving on to the next question that you have. I've changed the question of this topic this time because I thought कि पिछले वाले का answer you had just mugged up and you were not using your brain too much. A 40-year-old male patient presents to the emergency department with high fever and chills. High fever and chills आते ही always think of malaria as one of the questions. Usually in the exam, that is how it works. High fever with chills. There's a dark color urine and the patient has had a trip to a malaria endemic region. Okay, self-treated medication है, you can see the fever, pulse rate is increased, dark color urine, jaundice, मतलब the blood is breaking, hemolysis has happened. Yes, that is why the hemoglobin is down, urine को भी dark color बता दिया. So bilirubin has gone very high. Which kind of bilirubin has gone high? Unconjugated bilirubin, indirect bilirubin बढ़ा है, मतलब this is something to do with the hemolysis. What is that known as? Black water fever. Usually when we say things like Plasmodium vivax, Plasmodium ovale, these are the usual benign malarias. When I start thinking of Plasmodium falciparum and that goes to the brain, cerebral malaria, that is also known as malignant malaria, also it is known as at many times, and that is going to be involvement of the brain. Sepsis हो जाएगा तो septicemic malaria. Algid malaria क्या होता है? When there is going to be malaria with what? That is said to be algid malaria. There is a circulatory failure, या फिर in simple words you can say shock में चला गया patient. Circulatory collapse, circulatory failure या shock. That is what I call as algid malaria. But black water, urine is becoming black, means if there is an element of hemolysis that is present, that is what I call as black water fever, which is the answer, because यहाँ पे हर चीज़ बहुत evident था that there is hemolysis happening. So this is just, rather than giving you the typical questions of those banana shaped gametocytes, etc., they will give you the questions of this. But if they want to give you, now you know in today's class what I've done, कुछ चीज़ें हैं which I know that you are aware of. You all know banana shaped gametocytes are seen in malaria. Those photos you have seen a zillion times. So instead of repeating them again and again, I have added some 10 to 15 bonus slides जो कि photos ही है. It's nothing for me to explain to you, like these malaria slides, some card tests, some things at the end, and you will find it right at the end of the PDF. अभी नहीं भी पढ़ोगे चलेगा. 1 week before the exam, just go through those bonus slides because they will help you revise things which you might have missed being overconfident. So you will find all these pictures also, and they were there, similar bonus slides. I hope you found them in your path PDF also. So same way you will get the checklist and the bonus slides in micro PDF as well. Anyway, moving forward to the next one. ये question please ध्यान से पढ़ना and ध्यान से answer करना. Don't be in any hurry. ज़्यादा smart नहीं बनना, ठीक है? 45-year-old patient presents with liver imaging and reveals a cystic mass with an invasive infiltrative growth pattern. Going very slow on this, spreading into the surrounding tissues. The serology confirms the diagnosis. Which of the following species is most likely responsible for this presentation? I know why. See, I already gave you that word of caution जो exam में कोई आपको नहीं देगा. You will not have that external stimulus to guide you that, oh, don't go wrong, etc. But here I am, and I hope most of you didn't fall for the trap. Liver imaging and cystic mass, the first thing I think of is hydrated cyst ही होगा, and this is what is coming to my mind. This picture of hydrated cyst comes, but then I saw that hydrated cyst is caused by Echinococcus granulosus. Option B में Echinococcus multilocularis and so many others. बाकी दो तो मैंने सुने ही नहीं, तो let's not just get into it. Echinococcus multilocularis and Echinococcus granulosus both cause this cystic structure and hydrated cyst. But Echinococcus multilocularis has a more invasive and an infiltrative. It will go into the surrounding tissue. That is why the best answer over here was actually multilocularis and not Echinococcus. See, if I would have not written this, I would have said liver imaging with cystic mass. Ye wala photo, what is the species? Granulosus. I also agree. But if it is invasive, it is infiltrating into the surrounding organs or surrounding liver, then that is Echinococcus multilocularis. ऐसा दिखता है. The cyst is going to show multiple locules. That is why it is called multilocularis. That is also hydrated cyst, but the organism becomes different. Now moving on, that okay, if this is the hydrated cyst and whichever Echinococcus is causing it, if I look at this hydrated cyst under the microscope, what are the three layers that this is going to show you? And this is all written, you just have to look at it carefully. पहले तो बाहर वाला layer, I will write it on the side, otherwise the image will get covered. One is pericyst, बाहर, periphery, pericyst. Who makes the pericyst? I will make a human being over here. I make the pericyst, we make the pericyst, because this is what? These are all inflammatory cells. These are inflammatory cells, lymphocyte, eosinophils, etc. We are reacting, we are responding. Ke, oh, parasite aaya, we have to fight. So we have made this layer. Parasite has not made it. Parasite has made two layers, ectocyst, endocyst. What is the appearance of this ectocyst? It looks like a pink color paintbrush. किसी ने paint कर दिया ऐसे pink color का. So that is referred to as the paintbrush appearance. That is known as the ectocyst. FMGE का once upon a time 4 years ago was one of the most favorite buzzword question. Paintbrush appearance is seen in which layer or which parasite, ectocyst of hydrated cyst. And endocyst, the word only tells me that endo matlab this is something inside, and it is going to have the babies of the parasite. New parasites are coming in this cyst. So 3 layers. If I ask you what are the 3 layers? Peri, ecto, endo. But which are the ones made by human being? Peri is made by us. Ecto and endo is going to be made by the parasite. That is hydrated cyst. Most common Echinococcus granulosus. And what is the other name of Echinococcus granulosus? Because the definitive host is this, it is referred to as dog tapeworm. Hum to accidental host hai. Primary host is going to be the dog, and hence it is called as dog tapeworm. Moving on to the next question. This I had got you somewhere in path also. I'm just repeating it once. There are various parasitic infections that a medical student is studying, and that parasite has operculated eggs. Which of the following parasite is not associated with operculated eggs? So पहले तो you must be knowing कि operculated egg होता क्या है, which means that now in the next 1 minute I am going to revise all the eggs with you once. That is a must know na, because with one anda has to come in every paper. Firstly, most of you said which is not is अच्छा, many of you have marked Diphyllobothrium latum, आंसर मार्क कर दिया है. Shouldn't Diphyllobothrium latum तो shows operculated eggs na? What did I ask you? Which of the following does not show you operculated egg? How could you forget that schistosoma? After reading SS इतना पढ़ा और फिर गलत कर दिया, because by now you are tired, and that is what I'm training you for. 1.5 or 2 hours into the exam, you will be tired over there also. You can't afford to make such mistakes in the exam. यहाँ तो चल जाएगा, but in the exam that will cost you 1 mark, 2 marks or more, which is deadly for a person who's appearing for FMG. Ask people who got stuck on 149 what that 1 mark means. So I've scared you enough and woken you up. So please remember, not associated with operculated eggs is schistosoma mansoni. तो एक बार पहले तो operculated eggs दिखा दो. I've got you all eggs on one slide. You have to revise it with me. 1 minute timer start करते हैं, egg start करते हैं. I'm starting with this. Operculated egg कौन सा होता है? The egg which has a lid on top. Operculated eggs are seen in STD. So what is STD that you have in operculated eggs? Quickly fill in the blanks with me. Number 1 is going to be Spirometra. Number 2 is all the trematodes, and number 3 is Diphyllobothrium latum, which we had studied in path के वो B12 deficiency कराता है. है, that shows you operculated eggs. So now if I come back, what is dilatum shows you operculated egg. ये दोनों क्या है? Fasciola hepatica and Clonorchis. What are these? These are family members of trematodes. They also show you operculated eggs. What does not is schistosoma, because schistosoma, S for S, shows you spinous eggs. कौन से eggs, ma'am? These spinous eggs. Can you see one spine over here, one spine over here? So remember, which schistosoma? Schistosoma mansoni shows you lateral spine on the side. How did we learn it? Leta hua, sota hua, man. So lateral spine is seen in mansoni. Then schistosoma, hematobium. Hematobium shows you terminal spine. Hematobium shows you terminal spine. And then the spine which is gayab, rudimentary, that is known as japonicum. So remember, hematobium, terminal, mansoni, lateral, and japonicum. Okay, Japan spineless you are saying. Okay, so japonicum. तो ये भी हो गया. This is done. One section is over. I realize trematodes का तो सारा family done. Cystodes में क्या होता है? Cystodes में, this is the egg that I notice. This egg in the exam will be so difficult to identify because we won't be able to zoom in na. So first we should know what to see, then I'll be able to pick it up in the exam. Exam में, do you think in this egg you will be able to count that there are 6 hooklets? अभी नहीं count हो रहा zoom in होके, so how will I count it in the exam? So although yes, the cystode eggs are said to be hexacanth, exam में कुछ नहीं दिखेगा. How will I pick it up in the exam? This magnification will be given. इतना photo होगा. You will see one knob over here and one knob over here. These are polar knobs. These polar knobs are going to be present, and that will tell me that yeah, this is a case of cystodes. All cystodes are going to show you polar knobs. But फिर examiner के पास मन करेगा, let me ask you exception. Which is the cystode which does not show you any polar knobs, and that is known as H. diminuta. So can I say H. nana will show you polar knobs, but H. diminuta will not show you polar knobs? So half of the photos are done. Cystodes में cystodes 6 hooklets, cystodes 6 hooklets, hexacanth वो दिखेंगे नहीं. Polar knobs दिखेंगे, but H. diminuta will not show me polar knobs. Operculated eggs are seen in STDs, and spinous eggs are seen in all the schistosomas. So all cystode, trematode done. अब बचे ये last. Simplest way of learning. If I had to make you learn in one word ताकि आपका exam निकल जाए. When you see round वाला egg, it is going to be roundworm. Roundworm is Ascaris. When you see an egg which has multiple segments, O बहुत बन रहा है उसके अंदर, that is known as hookworm वाला egg called ankylostoma. Repeating, round वाला egg is going to be roundworm. O segmentation wala egg is going to be hookworm. Then this egg that looks like, some people call it dholak or some people call it whatever, drum, blue drum, जो भी बोलना चाहते हो, drum, dholak, barrel. Actually it is called a barrel shaped egg, that is Trichuris trichura. And then if you see an egg that is flat and convex, flat and convex, flat and convex, plano-convex egg, that is seen in Enterobius. ठीक है, so plano-convex, एक तरफ plain, एक तरफ convex. Repeating, round वाला roundworm, O वाला क्या बनेगा? Hookworm. Then the barrel, dholak, whatever, that is Trichuris trichura, and plano-convex egg is going to be Enterobius. All eggs are done. Last day you have to see this one slide before going for the exam. One of the andas will come definitely. Now if I just ask you questions which are a little around it. Let's see if you can answer this question. There is an 8-year-old child brought by her parents with complaints of passing urine in bed at night for a month. Also complains of itching around her perianal region. Whenever I see perianal pruritus, there is one particular parasite which will always come to my mind, and that is going to be Enterobius. They will say there is perianal pruritus. The NIH swab method is done, and which of the following is false about it? Acha, instead of Enterobius, many of you called it pinworm, or even if you want to, you didn't write it, but if you want to call it threadworm, I agree with you, because ये बहुत पतला सा worm होता है, pin, thread, it's very thin. Enterobius is the name. They have, see, this is NIH swab. So अगर if patient is saying I'm having itching around my anal region, you will take a swab and you will take a sample from the perianal perianal region. That is what is known as NIH swab. They have asked you what is false about it. Let's read. Is the sample collected from perianal region for microscopy? Yes. What will you see on microscopy? The plano-convex eggs. That is also egg present. Egg के अंदर क्या होगा? Egg के अंदर baby होगा. What is present inside the egg? Larva. The baby is present. That is also correct. What is not correct? A piece of cellophane tape is applied. इसमें क्या cellophane tape apply करते हैं? No, this is false. This is the answer over here, because cellophane tape is this. It's a separate method. See, if I want to collect the eggs, one way is that I take this NIH swab and I take a sample. Chota bacha of 5 months, 8 months will not let me take a swab from the perianal region. The bacha will keep moving, will start crying. So in babies, what I do, I stick a tape. And what is this method known as? This is known as the Scotch tape method. So the eggs will stick on this tape. I mean, a very brutal way that you stick a tape on the kid's perianal region, and then later on after a few hours or overnight you remove it, but that is what you have to do. So if you want to collect the eggs, there are two ways. Either you do a swab or you do a Scotch tape. Yahan par they had asked you about the swab method, so that is why we've had to answer accordingly. Okay with everyone? Moving on to a question that came in the recent exam also. 32-year-old individual presents to the clinic with complaints of persistent fatigue, shortness of breath, and itchy rash. So I realized that there is something to do with the lungs and there is something to do with itchy rash on the feet, so skin. Patient has a habit of walking barefoot. So जो भी organism है वो barefoot walking से it has entered. Laboratory investigation reports are awaited. What are the other clinical manifestations that you would see in this person? Let's read this. If they are talking everything to do either with lungs or to do, most of you are saying iron deficiency, ठीक है, but what are you thinking of? तो सबसे पहले हम बात करते हैं perianal pruritus. तो अभी हमने पढ़ा is enterobius, and over here there is no mention of intestine, perianal, तो ये तो नहीं हो सकता. When I talk about lymphatic filariasis, इसके अंदर तो there will always be elephantiasis वाला photo that is given. I'll quickly show you a picture of elephantiasis. ऐसा एक photo देंगे where they will show that the limb is swollen. That is also not written, ruled out. When I look at coconut cake rectum is what? I mean, it's not that the rectum is becoming anything to do with cake, but it just means if this is the rectum, you will see white color के coconut जैसा organism, which is the organism that goes and sticks on the rectum like this. It is Trichuris trichura. So always remember, Trichuris trichura has 3 questions with it. If they ask you how does the egg of Trichuris trichura look like, you know it. If they ask you how does the adult of Trichuris trichura, male female कैसे लगता है, it looks like a hunter. That is why Trichuris trichura is known as a whipworm. It will have a very thin handle, or you can say a thick handle like this, and it's going to look like this. It actually, the adult worm looks exactly like a hunter or a whip, so it is called a whipworm. And where is that adult going to go and stick? It is going to go and stick on the rectum, so it is going to result in coconut cake rectum. So much so that there are patients who have known to have rectal prolapse. इसके साथ हमने पूरा Trichuris trichura ही पढ़ लिया कि जो hunter है वो hunter कहाँ पे जाके hit करेगा, rectum पे hit करेगा, and over there rectal prolapse. That is how we had learnt it, rectal prolapse के ना कर. तो यहाँ पर तो ऐसा कुछ भी नहीं लिखा था, nothing of this. This is just walking barefoot. Yes, this is to do with hookworm. So please note, hookworm is something. What did I just teach you for hookworm? वो OO वाला egg. I'll write it over here. That is how the hookworm वाला egg is going to look like. Hookworm actually enters through what? It enters through the skin. Hookworm is going to have skin penetration. And now you will tell me, in this entire parasitology chapter, skin penetration is seen by which all parasites? Skin penetration is seen by which all parasites? सबसे पहले schistosoma was something जो हमेशा SSS follow करता है. So schistosoma is number 1. Next, hookworm you are saying ankylostoma. So ankylostoma, schistosoma, this is okay, and one thing is left. एक और बता दो. Schistosoma, skin. Ankylostoma या hookworm जो भी बोलना चाहते हो, that is also through the skin. That is why itching हो रहा था, and there was walking barefoot का history. Strongyloids, perfect. This is what I was waiting for. Strongyloids also enters through the skin, because last exam, पहले तो before I go on to strongyloids का question, ankylostoma समझ आ गया, it enters through the skin. Also, this question was ruling out other options. And hookworm क्या कराता है? Which other manifestation did it cause? It causes iron deficiency anemia. We know this. But now strongyloids पे FMG exam में क्या question आया था was this: identify the Helminth from the life cycle that has been shown. This life cycle was shown to all of you. I realized, and यहाँ पर थोड़ा लिखा नहीं है, but there will be some things which will be, you will have to look at the arrow. अब देखो arrow अगर ऐसे mouth की तरफ होता तो कुछ खाने पीने से हुआ. This is not the case. If the arrow would have been towards the nose, maybe through inhalation or swimming ka water, that is also not the case. They have randomly marked the arrow towards the skin. This is a parasite going through the skin. So now I'm left with three options. Either it is schistosoma. Schistosoma hota to fir ma'am, in the life cycle the eggs would have shown me the lateral spine, terminal spine and all that. It is not there. Next option is ankylostoma. Hookworm ka egg would have shown me that OO wala. That is also not seen over here. What am I left with? I am left with strongyloids. And remember, strongyloids shows you something called parthenogenesis. Very important concept which you have to know over here. What is parthenogenesis? Can you see? I don't want you to know the entire life cycle. Bilkul bhi nahi. I just want you to see that I can some places see male and female. Every worm will have male, female. But inside the human body, I can only see a female. Imagine a female alone without a male has given birth to a baby from egg, and from the egg the baby has come out, the larva. So can this female show asexual reproduction? Yes. Can she be a single parent? Yes. And that is parthenogenesis. So please remember that the female is capable of showing asexual reproduction. This is parthenogenesis, which is shown only by one parasite, that is strongyloids. So strongyloids is a strong female. She is a strong female. She can reproduce on her own. She says, I don't need a man in my life. I will show asexual reproduction. If a man comes, she can show sexual reproduction. But if a man is not there, she is very, very strong and she can show asexual reproduction also. Okay. Now, someone said entero, you said round egg. No, Dr. Vinish, I didn't say enterobius has a round egg. बिल्कुल भी नहीं, roundworm has a round egg. Enterobius का egg तो ऐसा था ना, plano-convex, one side plane, one side convex, one side plane, one side convex. That is what we had studied. ठीक है, so everyone has understood parthenogenesis, that is asexual reproduction. That is why on the basis of this strongyloids, ये आपका FMG exam का previous year question. Coming to the last question that you have is this. Based on the, अच्छा अभी लास्ट वाले में और भी ऑप्शंस आ रहे हैं. मैन कैन ऑल्सो, हाँ, आई एम नॉट सेइंग द मेल डज नॉट एग्जिस्ट, ये तो मैंने बोला ही नहीं. आई सेड दैट मेल वर्म एग्जिस्ट. सो इफ द मेल इज देयर इवन इनसाइड द ह्यूमन बॉडी, सेक्सुअल रिप्रोडक्शन कैन हैपन. बट इफ द मेल डाइज और इफ द मेल इज नॉट देयर, देन फीमेल विल स्टिल कंटिन्यू रिप्रोडक्शन. दैट इज व्हाट आई एम ट्राइंग टू टेल यू. Coming on to the next, based on the morphological pattern in the image, which parasite is most likely being represented over here? You know, ये कुछ parasite filaria की species में चल रहा है, and many of you said perfect, this is going to be okay. Many of you said loa चल रहा है. Why loa? Because if I see this is the head end, पहले तो before that, is this having a sheathed filaria? Yes. Okay, why did you all mark loa as my only question over here? So अगर ये sheathed filaria है, and you had to look at the nuclei, you had to look at the nuclei at the end. Do you see nuclei coming right till the end? मुझे तो खाली दिख रहा है. लोआ होता तो there would have been nuclei in a line right till the end. Why did all of you in a line एक दूसरे के पीछे लग के सबने लोआ mark करा? Is my only worry over here that why did you not mark this as Escherichia bancrofti, which is the answer over here, guys. So please wake up. डोंट फील कि अच्छा यहाँ तक लाइन बना दिखा तो लोआ एंड तो पूरा खाली है ना. सो वेन एवर यू सी अ शीथ्ड फाइलेरिया, थिंक ऑफ LBW. If it would have been loa, which all of you were marking, look at the photo here. The nuclei would have been present in a line right till the very end. Line का end तक होता तो loa. If there are two nuclei at the end, so that would have been a case of Brugia malai, two nuclei. And if there are no nuclei at the end, like in this case, whoosh, gayab, nuclei gayab, no nuclei, that is known as Escherichia bancrofti. Why did all of you mark loa to that? Please don't make such errors. Abhi agar neend aa rahi hai aur agar abhi you are exhausted, तो एग्जाम में क्या होगा, बिकॉज राइट नाउ तो आई एम द वन हु इज गिविंग यू दोज बजवर्ड्स, हेल्पिंग यू, टेलिंग यू कि अच्छा अभी तो यू आर स्टिल नॉट इन दैट स्ट्रेसफुल मोड. एग्जाम में तो यू आर ऑल ऑन योर ओन एंड इट्स जस्ट बिन व्हाट, इट्स जस्ट बिन 2 hours and 15 minutes. तो एग्जाम में तो इससे ज़्यादा ही बैठना है ना. सो यू कांट अफोर्ड टू say कि I was tired and hence I got that question wrong. That is not acceptable only. This is a case of Escherichia bancrofti. You've done the others. जो भी होगा, it will always result in elephantiasis because that is how filariasis presents. So that is elephantiasis which I am not writing. And this is a urine sample. Why is this urine sample looking white? So many people call it milky urine also because lymphatics have come into the urine. Chyluria has happened. Why? Because जो filaria होता है वो कहाँ जाके obstruction कराता है? लिम्फैटिक ऑब्स्ट्रक्शन कराता है. तो लिम्फैटिक्स पे 2 क्वेश्चंस जो बहुत आते हैं, विच इज़ द पैरासाइट विच कॉजेज लिम्फैटिक ऑब्स्ट्रक्शन? फाइलेरिया. विच वॉज दैट फंगस विच वॉज स्प्रेडिंग थ्रू द लिम्फैटिक्स? रिमेंबर रोज गार्डनर वाला डिजीज, फंगस थ्रू द लिम्फैटिक्स, स्पोरोथ्रिक्स शेंकाई, दैट गोज थ्रू द लिम्फैटिक्स. ये 2 लिम्फैटिक्स के क्वेश्चंस विल बी आस्क्ड टू यू. Okay, so now we are 2 hours and 15 or 20 minutes into the session. We have thought of 3.5 hours. And what are we getting into? Now we are getting into your favorite, that is bacteriology. Now, bacteriology mein you will have to be all the more patient. So my plan is that in roughly 1 hour, no, today only it will be completed, Dr. Shashank. I know it's going to be a little bit of a torture, or rather more of a torture, but I don't want to split it into 2 sessions because now you have less than 1 month left. I don't want that हम इसको 2 sessions बनाए, 2 बार आप PDF के लिए इधर उधर भागो. You have so much of hassle in life, so you should go on ahead. I don't have plans of giving any break today, and if I am not taking a break then you will also not take a break. तो आपको पढ़ना ही पड़ेगा. You don't have an option, and you know you will feel a lot कि चलो अभी छोड़ो, I will take my own break, let ma'am continue, I will continue my part 2 tomorrow. कल हम 2x पे देख लेंगे. Trust me, that will not come. I'm not scaring you, but I'm telling you the reality कि वो कल तो आएगा ही नहीं. I take it in writing. I have seen so many batches ना, तो I know वो कल नहीं आएगा. You will take this PDF, download it, keep it in some folder, and it will just go keep getting lost. After 2 weeks, you will be again asking for the PDF. So that day will never come. So it is a torture, or if it is your liking, I don't know, but you have to sit through it. Consider this like a podcast, like a movie, a boring movie, but देखना है. Flop movie होता है तो भी बैठ के देख के आते हो ना, तो देखना तो पड़ेगा. Take microbiology as that. I'm starting with bacteriology. I'm telling you it's going to be torturous, but if I'm sitting through the torture, you have to sit through the torture too. I'm not giving you an option. I'm saying कि बैठना पड़ेगा. I am not just letting you go anywhere. Okay, now let's start. 28-year-old woman comes to, or 28-year-old man comes to the OPD with complaints of red area on the skin that is swollen and painful. Skin, suddenly diarrhea se shift होके a lot of skin things will come up now. The skin problem that occurred following an injury while he was scuba diving. बीच में I told you ना, middle stem examiner wastes your time in giving you this random information. Okay, cellulitis has been suspected and there is fever also, and they are confused between staph versus strepto. So what is the test? Sometimes when you read the last sentence, that is what gives you that अच्छा broadly question में क्या पूछा गया है. Retrograde approach, that is what they call it. So to differentiate staph from strepto, what test are you going to do? Very good, catalase test. I've always told you that there are a million organisms which are catalase positive. You don't have to learn it. You are close to the exam, so you are going to mainly learn the main one. कैटेलेस को हमने करा था cats need space. तो सबसे पहले catalase test is identified by the word bubbles. When you see bubbles, this means catalase test is positive. When you don't see bubbles, it is negative. Space क्या है? All the bacteria. I know space being made काफ़ी है, but हमें space याद करके जाना है. Now exam में space याद आएगा, catalase याद आएगा, मैम S से क्या है, P से क्या है. That is going to be the biggest challenge ना in the exam with mnemonics. When you are making mnemonics or reading mnemonics, try to make groups in it ताकि exam में कुछ याद आए. First 3 bacteria, if you notice, they all make some or the other color. Staph aureus, AU, which color pigment do they make? They make a golden color pigment. Serratia makes what color pigment? Red color pigment. Pseudomonas, I think everyone knows, makes a blue-green color pigment. So I realize that all these pigment wali things, that is staph, serratia, pseudomonas, they are all catalase positive. Now I notice all the fungal species that I just studied, Aspergillus, Candida, Cryptococcus, these are also going to be catalase positive. And lastly, E. coli and Enterobacter, these are also catalase positive. Is this okay with everyone? Yes, पहले सारे pigment वाले, then सारे fungus, then सारे E. coli, Enterobacter, these are all catalase positive, that is, they make bubbles. How to differentiate? So Staphylococcus is catalase positive, Streptococcus is catalase negative. How will you differentiate between the two? You will do the catalase test. Okay with everyone? अगर बैक्टीरिया पूछा रेड कलर पिगमेंट सिरेशिया, फंगस झाड़ू से मार मार के रेड करना, बैम्बू रैट, which fungus produces a red color pigment? That was Penicillium marnefi, that was red fungus pigment. This is red bacteria wala pigment. Moving on to the next question, which I think is everyone's favorite, Staphylococcus aureus ka food poisoning. Usually 6 hours ka incubation period, either less than 6 hours or 6-7 hours, that is given. The mechanism of action, how does it cause vomiting? It causes vomiting by vagal stimulation. So when I talk Staphylococcus aureus, one food poisoning question always comes. Usually वो ये वाला question होता है, where a 25-year-old patient has fever and vomiting and after having pastries from a restaurant. So they assume that pastry has to be something that has dairy product, either a cheese pastry, I mean a cheesecake, or something to do with pineapple cream pastry. So some dairy milk product was used in that pastry. Now they will always say within 6 hours the incubation period is mentioned. You will always think of Staph aureus first. Please note, whenever they will write a history of food poisoning and the incubation period will be within 6 hours, you know which two bacteria to think of. सबसे पहले सोचोगे Staph aureus and the answer will be to do with something milk. Delhi का patient हुआ तो Delhi में मोमो के साथ that mayonnaise which is made up of milk, और pastry party हो रहा है कुछ milk product का, या फिर meat, milk and meat within 6 hours Staph aureus. Chinese fried rice लिखा, so that is going to be Bacillus cereus. So many times people ask me, ma'am, what if he was having non-vegetarian Chinese fried rice? And I don't have answer to such questions of yours. Because then just by looking at the food item, I am not guessing, अच्छा ये खाया तो ये bacteria. That is why microbiology as a branch came, right? That I'm just guessing. If I want to confirm, then for Staph aureus, I am going to do these tests, and for Bacillus cereus, I will do different tests. So I will confirm. Abhi I'm just doing a rough estimate. Before I come to that, they are saying that this food poisoning, which enterotoxin cannot be responsible for it. Entero ka to matlab hi hai that ma'am it will cause food poisoning. So please note, all enterotoxins that we have for Staphylococcus aureus are going to cause food poisoning. All of them will cause food poisoning except, very good, जो F वाला है वही food poisoning नहीं कर रहा था, except enterotoxin F, because F is made for more fatal things. And what is that fatal things? It causes toxic shock syndrome. It is known as toxic shock syndrome toxin. So this will come with the history that there is a female in her menstruation, she was using tampons, so there's a retained tampon that was there. So please note, all enterotoxins cause food poisoning, but enterotoxin F females में कुछ fatal सी disease कराता है, that is toxic shock syndrome. So अभी इसका आंसर तो मुझे मिल गया. Right now I know this is Staph aureus वाला food poisoning. Staph aureus के क्या क्या चीज़ें लिखी हैं यहाँ पे? What is the shape of Staph aureus? I'm not writing, it is obvious. Staph aureus looks like bunch of grapes. Staph aureus का कौन सा वाला bubbles वाला test? Right now we studied catalase positive, we know that. Staph aureus, if I write aureus AU, what color pigment does it produce? Right now you told me it produces golden color pigment. And if I ask you what is the culture media for Staph aureus, we had always studied this famous samosa of yours, right? And that was Staphylococcus aureus uses a culture media called, jaldi bata do, mannitol salt agar. Mannitol salt agar, because it is going to show you mannitol fermentation. That is why I used mannitol salt agar. Repeating once again, bunch of grapes, catalase positive, golden pigment, mannitol salt agar. ये है पूरा Staph aureus का spectrum. So if you have a patient with this pastry, dairy, you will do these tests. If a person comes to you saying Chinese fried rice khaya, then within 6 hours I started having food poisoning, now over here what are you going to do? Yes, what are the culture media? You know that famous, that Roomba Roomba story, कितनी बार सुना है? Maipa Pemba. And now I've seen on Instagram, whenever that meme of Roomba Roomba is going on, randomly under Reels, people have been tagging me. You know, the non-medicos would never understand why you're tagging me under those Roomba Roomba Reels. But yeah, that keeps coming, that keeps getting refreshed in my Reels also, time and again, thanks to all of you. So Bacillus cereus के लिए, what is going to be the culture media? It is going to be Maipa Pemba. Coming back, Staph aureus का जो food poisoning था, vomiting वाला food poisoning, is because of what? It is because of vagomimetic action. It is because of vagal stimulation. Someone said cyclic AMP, galat. ये cyclic AMP, GMP, अभी I'll come to that. Give me 30 minutes and we will do all of this. But Staph aureus का, it is to do with vagal stimulation. Moving on to the next question. Read this very carefully. Which of the following features or tests would be characteristic of the organism in a patient with meningitis? CSF sample was examined using gram staining and it shows gram positive diplococci. Pehle to you can let me know the answer. What will you select out of these? Okay, most of you are saying D. तो ऑर्गेनिज्म कौन सा बनाया? मेनिंजाइटिस के लिए ये डिप्लोकोकाई के साथ देर आर टू ऑर्गेनिजम्स. बोथ द ऑर्गेनिजम्स कॉज मेनिंजाइटिस, बोथ द ऑर्गेनिजम्स कॉज आर डिप्लोकोकाई. लिसन टू दीज ऑर्गेनिजम्स केयरफुली. एक है स्ट्रेप्टोकोकस निमोनिए, वो भी ऐसा दिखता है, डिप्लोकोकस, इट हैज़ अ कैप्सूल. Neisseria meningitis, that is also Diplococcus, that also has a capsule. Meningitis obviously causes meningitis. Pneumonia causes pneumonia and it can also cause meningitis. तो मैम इन दोनों में से यहाँ पर why was this not meningitis guys? Why were all of you so like sure कि अच्छा staph पढ़ा तो streptococcus पढ़ेंगे, ऐसा सोचा? But be careful. All the cocci are gram positive. So Staphylococcus gram positive, Streptococcus gram positive, and over here they had written gram positive. Except 3 cocci which are gram negative. कौन से? One is going to be Velonella, the next is going to be Neisseria, and the last one is going to be Moraxella. These are what? These are going to be gram negative. तो meningitis क्या होता है? Gram negative. यहाँ पे लिखा था gram positive diplococci, hence I selected this to be Streptococcus pneumoniae. अभी हमने पढ़ा था Staphylococcus is catalase positive and Streptococcus is catalase negative. So that is why I selected catalase negative, and it is optochin sensitive. So what are we trying to read over here? Now this will take me, I think, पूरे जो features of bacteria that I'm trying to teach you, this is the one that is going to take 2-3 minutes. Rest everything happens very quickly as we go along. When I get a history like this, I've got you another one of these pictures. You will have an 85-year-old man. You can see this is the typical वो pneumonia वाली history, sputum, shortness of breath, fever, etc. Now there is Streptococcus pneumoniae that they have mentioned over here, and they have asked you which of the following statement is true regarding pneumococcus. Let's read. Is the virulence due to a polysaccharide capsule? Yes, most of you are saying yes, because I told you that all the capsules are made up of polysaccharide, तो मुझे तो ये correct लग रहा है. Okay, capsule is protein in nature? बिल्कुल भी नहीं, it is polysaccharide in nature. Antibiotics against capsule are not protective, not at all. Capsule is polysaccharide, it is an antigen. Antigen matlab when it enters into my body, antibodies will be formed. So this is galat. Last, resistance to penicillin has not been reported. ऐसा तो हो ही नहीं सकता. Penicillin resistance is the most common thing reported everywhere. So the only correct statement I told you was to do with polysaccharide capsule. Can you all tell me, in Streptococcus, which is the family that we are talking about? Alpha hemolytic. ध्यान से सुनना. Alpha, beta, gamma. 3 स्ट्रेप्टोकोकस होते हैं, अल्फा, बीटा एंड गामा. दिस इज अल्फा हिमोलिटिक. व्हेन आई से अल्फा हिमोलिटिक, दो चीज़ें आएंगी, स्ट्रेप्टोकोकस विरिडेंस एंड स्ट्रेप्टोकोकस निमोनिया, वीपी. डू यू रिमेंबर? निमोनिया सेज आई विल से yes, yes, yes to everything. If you ask me 3 questions of bio, I will say yes. Will pneumonia show you bile solubility? Yes. Will it show you inulin fermentation? Yes. Will it show you optochin sensitivity? Yes. It says yes to everything. एंड वॉट आर द टाइप ऑफ कॉलोनीज दैट इट शोज? जैसे कैरम कॉइन्स होते हैं ना, बिल्कुल कैरम कॉइन की तरह. कैरम कॉइन कॉलोनीज, इफ यू डोंट वांट टू कॉल देम कैरम कॉइन, के ऐसे कौन लिखेगा मेडिकल टर्म में? देन व्हाट इज द अदर नेम? अच्छा, कैरम खेलेगा, यस. तो ड्रॉट्समैन कॉलोनीज. ड्रॉट्समैन विल बी समथिंग विच एग्जामिनर विल राइट, अगर उसे ऐसा कैजुअल कैरम कॉइन नहीं लिखना. सो ड्रॉट्समैन कॉलोनीज व्हाट इज गोइंग टू बी सीन इन इट. नाउ कमिंग बैक, येस 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 टू एवरीथिंग. मज़े कर रहा है, चिल कर रहा है, कैरम खेल रहा है. कमिंग बैक, आई सॉ catalase negative and biopositive, bile solubility, inulin fermentation, and optochin sensitivity. That is why option D was the answer that I selected. Versus iska jo other member hai family ka, viridins, it says no to everything. Bile solubility, no. Inulin fermentation, no. Optochin sensitivity, no. And viridins, if you remember, infective endocarditis mein aap padhte ho. This is the bacteria that causes infective endocarditis. Yes, okay with everyone. तो ये हमने पढ़ा alpha hemolytic. But then you said, ma'am, streptococcus can be alpha hemolytic. These two I've understood. Beta hemolytic and gamma hemolytic. So if I ask you that a patient presented with complaints of sore throat, cough, hoarseness and redness of eyes तो ठीक है, sore throat आते ही, especially in our country, sore throat, as soon as that comes, Streptococcus pyogenes you have to think of. Streptococcus throat is what? Streptococcus pyogenes ka sore throat. Pharyngitis is there, pyogenes is mentioned. Now they are saying the C carbohydrate in Streptococcus pyogenes is responsible for which classification? Landsfield classification. This is what I was trying to teach you. Streptococcus is of three types: alpha, beta and gamma. Alpha we have studied, agreed. Streptococcus viridans, Streptococcus pneumoniae we have studied. Beta hemolysis is classified on the basis of Landsfield classification. See, beta hemolytic Streptococcus. There are many groups. Landsfield classification क्या कहता है? Group A, Group B, Group C, D, etc. I just have to learn Group A and Group B. Group A beta hemolytic Streptococcus is known as Streptococcus pyogenes. Group B beta hemolytic Streptococcus is known as Streptococcus agalacti. दोनों का एक एक question. Streptococcus pyogenes in the kidney, remember, was causing cola color urine. I taught you everything about this in the last class, PSGN. In the heart, you study it so much in that revised Jones criteria. Rheumatic heart disease में ma'am we study the Streptococcus pyogenes. So that is all group A beta hemolytic Streptococcus. The grouping was done on which classification? Landsfield classification. Group B में क्या आता है? Streptococcus agalacti. What is agalacti? Gala time in the camp. Which test is going to be positive? Camp test is positive, and that is precisely the next question that I have got for you. Identify the test. Test is camp, cat, sat, mat. Cat, sat, mat, it will come in half an hour. कहीं तो आएगा. अभी के लिए what is this? This is the camp test. Now examiner will not give you these labelings. These labelings I have given you. Examiner आपको सिर्फ इतना photo देगा. What is this photo? An examiner will say just यहाँ पर that okay, I have added Staphylococcus aureus over here. बस this photo will be there. This will not be labeled. This will not be labeled. You should know what is happening. Listen to me very carefully. This is red color, मतलब blood agar. You all know this. What they have put in the center is Staphylococcus aureus. This I have added. This is not from the patient. Staphylococcus aureus I have added. This is the sample that I have added from the patient. For now, let's assume the patient was having some meningitis with Streptococcus agalacti. Assumption. CSF sample I have added over here. On adding that CSF sample, I saw that there is one arrowhead formed. So I realized the arrowhead will only form if Streptococcus agalacti was there. If some other bacteria would have been there, the arrow would not have formed. So if arrowhead is noted, this means Streptococcus agalacti is positive. That is known as the camp test. Camp test is for Streptococcus agalacti, which you had to mark over here. Cat, sat, mat answers you have given. I will also give you the answer in half an hour, so don't be afraid. Now, alpha hemolysis का table हो गया, beta hemolysis की बात हो गई. Gamma hemolysis में what comes? It is Enterococcus. Not many questions are coming on Enterococcus, so right now we will take a skip on that. Moving on to the next question, which comes possibly, I think, in every exam. You are also pretty much sick of it by now, but it is important. There is a doctor who sent the patient sample suspected of having Neisseria infection to the laboratory. Which of the following is used to differentiate Neisseria gonorrhea and Neisseria meningitis? Which sugar fermentation or test will you use to differentiate? तो इस पे 3 question. No, I will not ask you nonsense like ये meningitis कराता है. This causes gonorrhea, which is a sexually transmitted disease. This is obvious. Tell me the microbiology part of it. You are saying maltose fermentation से differentiate करते हैं. So let's get down to business right away. When I talk about Neisseria meningitis, the way you write meningitis, the shape is clear. It looks like a lens with a capsule, right? When you write Neisseria gonorrhoeae, simple GG, so it looks like a kidney shaped organism. That is also obvious. Coming to fermentation, Neisseria meningitidis has both M as well as G, so maltose as well as glucose. Remember, maltose as well as glucose both are going to be fermented. Gonorrhea only has G, तो मतलब maltose fermentation नहीं होगा, only glucose fermentation होगा. Many of you marked this. Glucose fermentation though is happening in both. How will you differentiate? Both of them are showing glucose fermentation. The only one which is showing maltose fermentation is Neisseria meningitidis. So to differentiate, you will have to do maltose fermentation testing. Meningitis will show it and gonorrhea will not show it. बाकी सब दोनों का सेम चलता है. If I ask you what is the transport media and the culture media, दोनों का you will notice transport media and culture media is the same. Transport media is the Ames and Stewart media. How did I learn it? Neisseria का transport media is A-mice media. Nice का A-mice. Easy way of learning. Nice का transport media A-mice. And both of them are grown on the same culture media, that is modified Thayer-Martin media. So that is also okay with everyone, I hope. Yes, rest is the same. Fermentation and shape is where you are going to differentiate. Moving on to the next question, which I think is very easy, just for you to wake up once again. 12-year-old boy presented with tonsillar pseudomembrane formation. Pseudomembrane aate hi with the sore throat. There's only one bacteria coming to my mind. Pseudomembrane word comes. I am thinking of this pseudomembrane and the classic photo of Corynebacterium diphtheria, but that's not where it ends. They say enlarged lymph nodes. Maybe they are talking about this bull's neck, pseudomembrane bull's neck. Yes, Corynebacterium diphtheria. They've asked you what is the shape. The classical shape is the cuneiform, also Chinese letter. You can see now that they are forming these random letters like VL, Chinese letters. If I look at the others, can you quickly tell me comma shape kaun sa hota hai? Comma shape is Vibrio. Someone said my favorite question. Yeah, it is your favorite question. It is examiner's favorite question also. Aega hi aega. Something around Corynebacterium will come. So I will spend instead of 1-2 minutes on this bacteria, because when I know something is gonna come, you have to study. Okay, Vibrio is comma shape. What is this boxcar? Or you want to call it bamboo stick, it means the same. What are these? We've studied this right now some time back. It is Bacillus anthracis. Perfect. And what is Chinese letter or cuneiform? That is going to be Corynebacterium diphtheria. But Corynebacterium diphtheria में और आगे चलते हैं. Now the same child जिसको अभी fever and lymphadenopathy and oral examination पे वो pseudomembrane था, what will you do for the early diagnosis of this pathogen? Same child. Now they ask you, acha, what will you do for diagnosis? Nutrient agar, blood agar, Loeffler serum slope or LJ media? Loeffler serum slope is used for diphtheria. So what I'm going to do, I am going to, and LJ media, so you all know, na, is used for TB. It might sound like a very dumb question, ma'am. We are 2.5 hours into class. Itne dumb question mat pucho. But the last INICT exam had this one-liner question, that LJ media is used for the diagnosis of, or for the diagnosis of TB, which culture media will you use? Sometimes they can get really dumb in the paper, because when they get dumb, you get dumber, which means they'll give you something so basic that you will overthink it and then you will end up marking something very random. So be very basic in the exam to start with, okay? So yes, such a question can come. LJ media is for TB. Coming back, for diphtheria, we have Loeffler serum slope. And now let's come to this table. All of you have seen this in rapid revision and in other LRR sessions earlier. तो ये तो एक बार करना ही है, 1 minute लगा के revise. 1 to 2 questions will come out of this table. You can't miss this. So Chinese letter cuneiform appearance देख लिया. What are these round granules which come in every photo, every subject test they come in? The volutin granules or the Babes Ernst granules, they are on 2 poles, so they are known as bipolar granules. What do these contain? In granules में क्या है? Energy source है. Energy source मतलब they contain polymetaphosphate. Previous year question. Polymetaphosphate, energy source है. इनका मतलब ATP, ADP you can say. That is what it contains. What is this stain that has been shown over here? This is the famous Albert stain. They will ask you the next question. What are the 3 chemicals which are added in the Albert stain? You've seen this PYQ. This is TIM. What is TIM that we have? सबसे पहला क्या डलता है? Toluidine blue. next iodine, and next malachite green. What if I forget in the exam the full form of TIM? I will open my eyes and I will see what are the colors that I'm seeing over here. I'm seeing something bluish purple over here. So if I'm seeing something bluish purple over here, this has to be toluidine blue. I'm seeing something green over here, so this has to be malachite green, and in between I will add iodine. So toluidine blue, iodine, and malachite green, that is going to be the Albert stain. But what are the other stains for volutin granules? Jaldi se revise karo. What is P? P for Ponder stain, L for Loeffler methylene blue, A for Albert stain, and N for Neisseria stain. All of these are stains for volutin granules. Now let's come to the culture media. Do culture media, enriched culture media and selective culture media. Be very cautious. If you want to do jaldi se diagnosis, jaldi se report do ma'am, quick, early diagnosis, give me a report in 6 hours, 8 hours. Do an enriched culture media, which is known as Loeffler serum slope. But if you want to do the best culture media diagnosis, then do a selective media, which is potassium tellurite agar, because Loeffler serum slope will give you a report in 6 to 8 hours, whereas potassium tellurite agar will take 48 hours. Question में क्या पूछा था? What will you use for the early diagnosis? Loeffler serum slope, because within 6 to 8 hours I'll get the report. But if they would have asked me what will you use as the best culture media for the diagnosis, answer would have been potassium tellurite agar. Moving on to the last two. If you want to know about the toxin, diphtheria का कौन सा toxin? Diphtheria toxin, common sense. What test will you do for toxigenicity? LX gel precipitation test. This is the photo of the LX gel precipitation test. Exam में क्या आएगा? इसके अंदर एक ही question आएगा. This is the only picture they have. So they can't mess up with me over here. They have to give me this picture. They will mention that on this filter paper, they have added an antitoxin of diphtheria. Antitoxin they have added. Now they are asking me, this is patient 1, this is patient 2, this is patient 3. They want to know which patient has diphtheria toxin and which does not. The patient in whom you will see these lines, line kab banega? When the toxin is there, then the reaction will occur. This means diphtheria toxin is present. In this also I could see the lines forming. This means this patient also has diphtheria toxin. That is why the reaction occurred. Over here I don't see any lines forming. This means the diphtheria toxin is not present. As easy. If you see the lines, toxin present. If you don't see the lines, toxin not present. This is LX gel precipitation test. This is done to know the diphtheria toxin. But if they ask you what is the test for susceptibility, I ask you, have you been vaccinated with DPT in your childhood? You will say, yeah, my parents told me. पक्का थोड़ी ना है. How do, maybe they are not doctors, they are not aware of what DPT is, whether you were vaccinated or not. How do I want to check, are you susceptible or are you immune? Which kind of a skin test can be done? For susceptibility, we do the Schick test. This is how it's going to look like. It's a skin test. Injection लगता है, just like the skin tests are done. So for susceptibility, you are going to do the Schick test. These are all the questions. Every word over here is a PYQ. ये PYQ slide है, not just 1 or 2 lines. PYQ slide है. That is why I spent 2-3 minutes on this. Every word as it is आप पढ़ के जाओगे for the exam. Moving on to the next question that you have over here is a patient with complaints of watery diarrhea, stomach pain since consumed meat for lunch. Physician sent his sample for testing to confirm it is capsulated, non-motile, and has subterminal spore arrangement. They've come to an organism which has spores. Remember slide 3rd or 4th? Sporulation occurs in which phase of the growth curve? Sporulation occurs in the stationary phase of the growth curve. Yeah, then I hope you've not forgotten the past things. The most likely causative organism, all of you are saying, is Clostridium perfringens. But I know that Clostridium perfringens very commonly causes gas gangrene. This is not a case of gas gangrene. Means other than gas gangrene, it can cause something else. And yes, that is going to be enteritis. It can cause food poisoning. It can cause, if many of you expect perfringens का question है तो gas gangrene आएगा. But they can give you the other clinical symptomatology of it. So before I get on to it, Clostridium perfringens को पहले क्या बोलते थे? Clostridium welchi. So don't feel कि कुछ नया दे दिया. It's the same thing. Clostridium perfringens, Clostridium welchi. Usually it causes gas gangrene, for which they will always say, oh, there is a history of trauma, road traffic accident हुआ, there's crushing injury, he was working on a construction site, some very heavy metal object fell. कुछ trauma, crushing, कुछ तो major severe trauma होगा. After that, this kind of a gas gangrene will be there, Clostridium perfringens. If not this, then there is going to be something called as necrotizing enteritis hepatitis, which means something to do with food poisoning like you had in this patient. But now, why did I think of perfringens in one go? Because of this subterminal spore arrangement. Overall, when I show you the different spores, you must have seen these pictures in your rapid revision also. So one very quick revision. When I say which is the most common location of the spore, it is subterminal. Let me find, यहाँ पर कहीं subterminal है. This is subterminal. See, right before the end, subterminal. This is also subterminal. This is also subterminal. This is the most common location of the spores, and most commonly it is seen with Clostridium perfringens. When do you see that the spore has come right at the end? Terminal कहाँ आ गया? TE. Terminal spore is seen in Clostridium tetani and Clostridium tertium. Okay with everyone, Clostridium tetani and Clostridium tertium, TE. और सेंट्रल स्पोर किस में है? सेंट्रल सेंटर में, जैसे यहाँ पे दिख रहा है, इट इज़ राइट इन द सेंटर, स्प्लिटिंग द बैक्टीरिया इनटू बाइफिड कर दिया, 2 parts. So Clostridium bifermentans. I hope the stores you can easily learn, the spores you can easily learn, that is not a problem. ठीक है, यहाँ सब टर्मिनल था तो हमने perfringens करा. अब layer 2, if they have to do the diagnosis, whether it's a case of food poisoning or it's a case of gangrene, many of you wrote senior NTR. Just revise, because senior NTR, it is a mnemonic which I don't know, has been on since ages. इसी से याद कर रहे हैं सब लोग इसको शुरू से ना. So we have to know what this is, what every word means. Number 1, what is the test it shows? It shows a stormy clot formation, as you can see over here. Next test का नाम क्या है? It is the Nagler's reaction, where you can see that what is the culture media that is used over here. It is a culture media to do with egg yolk. And what do you see over here? There is a lot of opacification. Perfect. Next, NT, we see two zones of hemolysis, double zone of hemolysis called target hemolysis. Look at this. If this photo would have come, I would have thought ये तो camp test है. Camp test, gala time in camp, I would have thought of Streptococcus agalacti. But I think this is, with this kind of a history, this same picture is now not camp test. It is now known as reverse camp test. Reverse camp test is used for the diagnosis of Clostridium perfringens. Repeating once again, if they mention camp test, remember gala time in camp, that is Streptococcus agalacti. If they mention reverse camp test, it is going to be Clostridium perfringens. Bacha last, that is the R for कौन सा? Culture media. Remember this very carefully. RCMB पढ़ के चले जाते हो, but in the exam they will write full form. Robertson's cooked meat broth. They have taken meat samples and they have created a soup out of it, broth out of it. When do they use this Robertson's cooked meat broth? When they want to test anything which does not need oxygen. Anaerobic media. Anaerobic media जब चाहिए होगा, any kind of Clostridium, Clostridium perfringens, Clostridium tetanus, any Clostridium which requires anaerobic media, you will grow it under Robertson's cooked meat broth. Repeating, senior NTR सिर्फ इतना रिवाइज करें. Stormy clot formation, Nagler, target hemolysis, reverse camp test, and Robertson's cooked meat broth is what is noted. And yes, that is the entire. Perfect. Most of you have got this right. So coming back, इसमें subterminal spore formation था and Clostridium perfringens was the answer. Moving on to the next question. Okay, and I hope you get this right, which I think you will because you've read this. I've like top 10 bacteria में भी आपने पढ़ा ही पढ़ा है. नहीं पढ़ा तो you should know, you have to. 25-year-old male patient presented with the OPD with shortness of breath, fever and chills. So a respi and fever history. Wool industry. Wool मतलब animal से related कुछ पढ़ना है हमें. The patient sample has been sent for sputum culture and penicillin agar was the buzzword given. String of pearls appearance. Yes, we know it is Bacillus anthracis. Finally, we come to Bacillus anthracis. What did we study? Which kind of a capsule? Polysaccharide या polypeptide capsule? I'll just write polypeptide and put a tick mark because हमने ये पढ़ लिया. अब कुछ extra पढ़ते हैं. That what are the different photos that they will show me? This also I have studied, that they will be present as these dabbas one behind the other. So that is known as the bamboo stick or the boxcar appearance. I know this. Next, on a nutrient agar, they will show me this kind of a appearance, medusa head. Please, I say this so many times and I know you will make this mistake. You are too used to seeing this picture. Photo तो यही आएगा exam में, but over here I was nice to you that I showed you what a medusa head means. examiner is not going to give you this hint. Examiner ये photo हटाएगा. Examiner will only give you this kind of a picture. You'll have to correlate animal history है, animal handler है, and now I have this kind of a medusa head appearance. Get used to seeing only this much of a photo. No hint will be given for medusa head in the exam. Coming to the third, look at this pearl string. String of pearls appearance is seen on which agar? String of pearls appearance, penicillin agar, which was written in the question. Coming to the last, what is this, guys? The gelatin stab. Gelatin pay, I can see the inverted fir tree appearance. Ulta tree, because gelatin gets me two questions. Either I will get to see an ulta tree is seen, inverted fir tree is seen as Bacillus anthracis, or I will get to see a seedha wala tree, a straight tree, and that is known as Clostridium tetani. Clostridium tetani shows a straight tree, and Bacillus anthracis is going to show me inverted fir tree. And coming to the last class, वो अपना फेवरेट क्रिसमस ट्री पॉलिप इज सीन इन प्यूट्स जेगस सिंड्रोम, तो वो ट्री वाले क्वेश्चंस तो आर फॉर एवर फेमस ना. सेम विद दिस फर ट्री एंड इन्वर्टेड फर ट्री क्वेश्चन इज ऑल्सो फेमस. मूविंग ऑन टू द नेक्स्ट क्वेश्चन दैट वी हैव ओवर हियर. There is a hospitalized patient who developed severe diarrhea and pseudomembranous colitis. Fixed. Pseudomembrane agar tonsil hai, Corynebacterium, diphtheria, we've done that. This is a pseudomembrane forming in the intestine. Pseudomembranous colitis. This is the disease given. Patient is having diarrhea. It is because of what? You know Clostridium difficile ka toxin A and B. You can see that membrane forming over here. Pseudomembranous enterocolitis is formed by Clostridium difficile. There is a classical history. I have not written that. Bata do. Kab hoga? When will someone have this infection or this disease? There is a prolonged usage of any particular drug. Prolonged usage of antibiotics. So very commonly they will say patient has been admitted for pneumonia, for meningitis, for some ABCD disease. He was having antibiotics since 1 month, 1.5 months. Now suddenly he has started having severe watery diarrhea, maybe little blood tinged, but initially watery. So from that, an antibiotic usage, diarrhea means the intestine getting affected, means he's infected with Clostridium difficile. You will see that pseudomembrane, तभी नाम रखा ना, pseudomembranous enterocolitis. And what will you see on microscopy? ऐसा लगेगा volcano burst हुआ है. There is lava eruption that has happened from the intestine. Like in this picture also, you can see that there is a lava eruption. And how does this happen? Clostridium difficile has how many toxins? Toxin A and B that have resulted in all in this. That is the volcano eruption as well as the pseudomembrane. Treatment, very good. Everyone has started writing कि मैम इसके अंदर we give vancomycin, and there is a new drug also which we all know, fidaxomycin, which you've studied in pharma. I've written it for completion as you mentioned. Okay with everyone? Moving on to the next question that you have over here is, on the last day of your MBBS course, the whole class was sent to microbiome lab. The worst last day someone can have. For a Viva exam, even worse, and all the questions were asked from gram-positive organisms. Last day of MBBS, हमें second prof में नहीं याद रहता. How will we remember on last day? But anyway, there is a culture plate. This seems doable for me. Swarming growth है, and swarming growth में this is a question again. This question is there in every LRR if you see, because this is a question which only if someone has seen this question earlier, that person will not fall for the trap. कोई अगर पहली बार देखेगा तो I have never seen any student who has not fallen for this question, because you see swarming and then you say PVCs. How easy. P से Proteus, answer Proteus. तो मैम 3 hours के बाद आप टाइम पास कर रहे हो. No, you forgot that. Okay, PVCs तो we have studied, but I think you forgot something. All of these are gram negative. The only gram positive one that we are talking about over here is Clostridium tetani. And this was a question where they particularly asked you that which out of these gram positive organisms will show you this swarming phenomena. So it is not Proteus. So it's very important that you revise your gram positive, gram negative, because see, एक तो हमने कर लिया, all cocci are gram positive except venom, that is done. All bacilli are gram negative. That is why I said all bacilli are gram negative except McDonald's. And McDonald's, do you remember? Clostridium came in McDonald's, which is gram positive, which was asked over here, and hence your answer was Clostridium tetani. So anyone who sees this the second time will always know, okay, yeah, this was the trick of solving the question. But whenever you see it the first time, like many of you say, PVC is Proteus swarming. So this means you are overconfident. And this is always to break that overconfidence of yours. Anyway, micro mein confidence hi nahi aata. Overconfidence is a very far-fetched dream. But anyway, whenever you feel that you've just killed it now, and micro, I know it at, like I can do it in my sleep also. That is where God will give you a reality check and you will know that, oh, there's a long way to go in microbiology. So McDonald's, a quick revision. All bacilli are gram negative, but McDonald's always has to be positive. So Mycobacterium, all are TB ones. Anthrax, bamboo stick appearance wala. All Clostridium, tetani, perfringens, etc. All diphtheria related things we have studied. Nocardia and actinomyces ho gaya. And Listeria, the tumbling motility wala, our differential motility which we've studied, all of these are going to be gram positive. McDonald's is always positive. Okay with everyone? Moving on to the next question that you have over here. Which media is used for urine processing samples and will help you differentiate lactose fermentation from non-lactose fermentation? Okay, I can see two. Blood agar, chocolate agar to nahi. McConkey and Cled are the two culture media. If I have to see this is McConkey agar, this is Cled agar. Both are to differentiate lactose versus non-lactose, but McConkey agar gives you a pink color, as you can see over here on lactose fermentation. Cled agar is going to give you a yellow color, and they asked you which of the following gives you a yellow color. जिन लोगों ने McConkey लिखा उन्होंने question ही पूरा नहीं पढ़ा. Because if they would have said on lactose fermentation they produce a pink color, I would have marked McConkey. They said yellow color, so I ended up marking Cled. Guys, stop your AAA जो इतना बहुत overconfidence में चले गए हो. So come back to reality. See, I told you, I'll give you one or two questions. I will get you back to baseline कि अभी micro has a long way to go ना. तो हमें आता है. It's not that this is something totally new. It's just that you have started picking up buzzwords to the extent कि आप कुछ पढ़ना ही नहीं चाह रहे हो. You don't have to go into that zone because that zone will come in your paper 1 when you will be approaching that 130th wala question, close to 150 ka clock in kar rahe hoge na, you will get into that कि अरे खत्म करो इसको. And when you get into that mode is when you have started making mistakes. That's why I say start sitting for 3.5 hours, because you have to be alert at 6 p.m. and you have to be alert at 9 p.m. also, like the way you are sitting with me at 10 p.m. also same. वो अभी don't feel कि वो I had to work on it 1 year back, मैम अब तो time निकल गया. This is the time. No one sits like 4 hours from day one. वो sitting आपको last के 1 महीने में लगानी है ना. So this is something you have to do now. This is the time to work on it. That is why I'm torturing you with lengthy sessions. So McConkey, of course, I'm not repeating this plant. We've done it. इस पे I'm not expecting a question also. But the color, McConkey gives you pink color, Cled gives you yellow color. Both of them are for lactose fermentation. But which is better if someone asks you? The Cled media is said to be better. The question that will come is that what are the two lactose fermenters? Which two bacteria are fermenters of lactose? It is going to be E. coli and Klebsiella. These are the two which are fermenters of lactose. तो E. coli पे क्या question आता है? हमेशा ये वाला question आता है. That please identify the organism depicted below which is responsible for attachment and effacement lesions. Attachment and effacement, सारे E. coli, all E. colis are written over here. Which E. coli shows attachment and effacement lesion? हाँ चलो, now your overconfidence is back. I've given you easy question. EPEC. पहले तो what is this? This is intestine. This must be the villi of the intestine, and this is E. coli. E. coli has come. It has come and gotten attached. इसे बोलते हैं attachment and effacement lesion, and this is shown by EPEC. These are the different E. colis. One word and one question. खत्म हो जाएगा. When I say enteropathogenic E. coli, it causes P for P. Which kind of diarrhea does it cause? Pediatric or infantile diarrhea. And peds, बच्चों से attachment occurs. So which lesions will occur? बच्चों वाला diarrhea, peds के साथ attachment, effacement lesion. Next, enterotoxigenic E. coli. T for T. Which diarrhea does it cause? Everyone keep answering. Traveler's diarrhea. We know this. Okay. Enteroinvasive E. coli. Invade करेगा, blood loss होगा. Blood loss in the diarrhea means it will cause dysentery. Enterohemorrhagic E. coli. Hemorrhagic means bleeding. Some syndrome it will cause which causes hemorrhage. What is that syndrome known as? It is Hemolytic uremic syndrome. So see, hemorrhagic will cause hemolytic uremic syndrome. Can you tell me what will it cause? Hemolytic anemia. ये तो क्या ही है, common sense. Uremia means it will cause involvement of kidney failure, uremia. That makes sense. And third thing, what is the third thing? Platelet count is going to go down in hemolytic uremic syndrome. Thrombocytopenia. Yes, perfect. So if they give you a triad in the exam, patient is having blood in the urine, hemolytic anemia ho raha hai, blood is breaking, uremic symptoms are seen, platelet count is going down, which is the bacteria? So you will say, oh, it is EHEC and a particular strain. No one wrote that. O157H7. कौन सा वाला strain causes it? It is O157H7. I think yeah, in previous LRRs I've shown you questions, but वो question abhi I've removed to make the PDF crisp and concise. But the same question comes. Hemolytic anemia hoga, uremia hoga, thrombocytopenia hoga. They will ask you which strain of EHEC causes it. O157H7. Coming to the last, enteroaggregative E. coli. Aggregate matlab you will see these bacteria tend to aggregate. Like bricks hota hai na, bricks on a wall. So this is referred to as the stacked, excellent, the stacked brick appearance. All of them come together. Enteroaggregative E. coli. And what diarrhea do they cause? Persistent diarrhea. Definition you've told me, excellent. Diarrhea lasting for more than 14 days is persistent diarrhea. Very good. So now all of you are like, जब पता होता है कि अरे जल्दी सेशन खत्म करवाना है तो जल्दी आंसर देना पड़ेगा, which is so nice. Okay, now coming to someone also said, what does H and all this stand for? Okay, so do you, I mean, this you will get more information on if you've read it in so much of detail, but O and H are antigens, na? So O is the antigen present in cell wall and H is the antigen which is present in the flagella. So these are antigens of E. coli based on which the typing of this has done, okay? Coming on to the next question. This has been a question which somehow for most students, I don't know how the math works, but it comes of course, but it usually comes amongst the first 10 to 20 questions of your FMG paper 1. मतलब एग्जाम में जाते ही पहले 10 या 20 क्वेश्चन में से ये वाला एक फोटो यूजुअली दिख जाता है and it gives you that push for the exam कि कुछ तो मुझे आता है. 30-year-old male patient presented to the hospital again with diarrhea, vomiting, nausea and leg cramps and culture के लिए भेजा. The image has been shown to you over here. You have to identify the media. Many of you are writing बी. अच्छा ठीक है, करेक्ट. ए जिन्होंने लिखा गलत. दिस इज TCBS फॉर विब्रियो. व्हाट इज द नेम ऑफ दिस कल्चर मीडिया? इट इज TCBS. TCBS मतलब यू आर ट्राइंग टू टेस्ट फॉर sucrose fermentation. Vibrio cholera is going to be sucrose fermenter, and sucrose fermenter has given what color? Sucrose fermenter has given a yellow color. Only Vibrio cholera. If they ask you any other Vibrio like Vibrio parahemolyticus, Vibrio कोई और, are they sucrose fermenters? नहीं. Sucrose fermentation के लिए only Vibrio cholera. And rice water stools होगा ना, it's not just watery, but they couldn't have written rice water stool because then it would have become so obvious. They will not make it very obvious. Rice water stools होता है. So now when I look at it under the thing microscope, you told me sometime back कि ma'am it looks like a comma, and you only told me sometime back बहुत fast जाता है, shooting star or darting motility. Now I'll add something. Do you know all these shooting stars or these commas, as if, just imagine the diarrhea is just like water. Rice water is what? Pani jaisa na, just like water, and all these vibrio are swimming in that water. That is why it is known as fish in stream appearance. Like fish are swimming in the stream of water. So stream of water is the watery diarrhea, fish is the vibrio. So basically this is the watery diarrhea, and chota chota vibrio like fish are swimming. Remember fish in stream appearance, because after some time I will ask you what is school of fish appearance. तभी मैंने इतना डिटेल में ये समझाया. This watery diarrhea is like a stream of water and fish is swimming in it. That is Vibrio cholera. So Vibrio के लिए what are you doing? You are doing the TCBS media. Very good. Can you also tell me that what is the mechanism of action for this Vibrio? What is the mechanism for causing watery diarrhea in this Vibrio cholera? कौन सा toxin? How is it working? Perfect. Zona occludens you are saying. So now listen to me for 30 seconds ताकि Vibrio खत्म हो जाए. Now if I talk about Vibrio, Vibrio, you've always, many students learn it as Codzot. That is how it's written in the textbooks. Codzot करके first aid में भी ऐसे लिखा है. Cot means there is a cholera toxin. Zot means there is a zona occludens toxin. What does cholera toxin do? Cholera toxin has two parts, fragment A and B. So if this is cholera toxin, this is going to be fragment A, this is going to be fragment B. Common sense tells me A is going to be for mechanism of action, B is going to be for binding. So B is going to come and bind to which part of the intestine? B is going to come and bind to GM1 ganglioside, and A is going to do the action. Which action? Cyclic AMP. Cyclic AMP की वजह से the patient is going to have that lot of rice water stools that you know. So simple. A से cyclic AMP, B से binding to GM1 ganglioside. So cholera toxin is done. But what does ZOT do? Zona occludens toxin. This is one cell of intestine. Now the bacteria wants to go to the next, then to the next, then to the next. Cell to cell to cell, how will it travel? It will travel via the ZOT, zona occludens toxin. So this is going to help in its travel from cell to cell. यहाँ पर zona occludens was written and that was the answer. Is this okay? Cod ZOT पढ़ लो, आखिरी दिन का काम खत्म. Moving on to what you were answering in the chat some time back. The following are true about chancroid. You were telling me something about chancroid. So the following are true about chancroid. Let me know. There is the school of fish appearance. It bleeds on touch. It is painful. It shows you the groove sign. Yes, let me know. Okay, all of you are saying A, B and C. मतलब C option. ठीक है. So when I say chancroid, what is coming to your mind? Croid cry, croid cry. Croid means Duke cry, crying with a lot of pain. So what kind of an ulcer is it? It's a painful genital ulcer which will bleed on touch, and इसका दिखता है school of fish appearance. Listen very carefully. Hemophilus ducrei, actually you know how it looks like. It looks like a safety pin appearance. देखने में तो it is like a safety pin. So I'll draw it properly. It is actually going to look like a safety pin like this. But there are so many safety pins, like school में morning assembly, you remember in the school they used to tell us एक line में लग जाओ. So that is known as the school of fish appearance. School of fish means like a school line. Please don't be confused. Fish in stream appearance, ऐसा watery diarrhea में fish आ रहा है. What is that? That is a case of Vibrio cholera. Whereas school of fish appearance is going to be seen by Hemophilus ducrei, crying with pain. So painful ulcer which will bleed. It will show the school of fish appearance. Hence ABC is correct. Please note, groove sign is not seen. Groove sign कौन से? Tell me this from dermatology. Groove sign is seen with lymphogranuloma venereum. It is not seen with Hemophilus ducrei. So we have to revise once the genital ulcers na. And that is a 34-year-old male, your favorite HIV positive truck driver has come. You know what we are talking about over here. Okay, but let me read carefully, because you said HIV positive truck driver matlab wo syphilis. But now let me read. There is a small painless nodule with sexual history 15 days back. Later the nodules burst, created open fleshy oozing lesions, becoming a beefy red ulcer in the genital region. What can be the diagnosis? हमने हमेशा सोचा था ट्रक ड्राइवर को तो सिफिलिस ही होगा, जो कि यूजुअली होता है. बट ओवर हियर आई डोंट सी सिफिलिस इन द ऑप्शंस ना. सो देन आई हैव टू फिगर आउट व्हाट कैन बी डन. नाउ इफ आई लुक केयरफुली, Hemophilus ducrei, crying with pain. So this is very painful. यहाँ पे लिखा है painless. Ducrei is ruled out. HSV2 is also painful. This is also ruled out. Painless में दो बचे. या तो there is Klebsiella granulomatis, which makes sense because when I talk about a beefy red ulcer, okay, many of you are saying A only, perfect. And Chlamydia trachomatis, ये तो eyes में trachoma कराता है, but can it cause something else? Chlamydia trachomatis of the variety L1, L2, L3 can cause lymphogranuloma venereum. That is also going to be painless. But उसमें क्या difference आता है? अब पूरा एक बार सुनो. Painful होता तो two things, Hemophilus ducrei and HSV2. यहाँ तो painful नहीं था, तो this is ruled out. Painless आया तो I have three things. Either it can be syphilis, Syphilis is everything syphy-less. Everything is painless. The genital ulcer is also painless. Lymph node hoga, that will also be painless. Syphilis is everything painless. And I have told you what will you do for the diagnosis of syphilis, which microscopy will be done. We've studied this earlier. Dark field microscopy करेंगे. I expected truck driver में ये आएगा, but ये नहीं था. What else can be painless? Lymphogranuloma venereum and Klebsiella granulomatis. These can be painless, but L for L, lymphogranuloma venereum में ulcer तो painless है, but the lymph node is very very painful. Very good. That is known as buboes, and that was not written in this question. So I will not think of lymphogranuloma venereum. Buboes word ही नहीं था. Then I'm left with Klebsiella granulomatis, which can show an ulcer, genital ulcer, which is a painless genital ulcer, and that usually has a beefy red color, and that is what I marked over here, Klebsiella granulomatis, which I think many of you know as donovenosis also. Yes, donovenosis जिन्होंने लिखा, that is also correct. So you guys get the point for that. Repeating, Ducrey and HSV2 are painful. Everything else is painless. अगर सब कुछ less आया तो syphilis. If the lymph node comes out to be painful, it is LGV. And if beefy red color is mentioned, then I will think of Klebsiella. Okay, can we move to the next question over here, which is again expected? In September, a patient from Uttarakhand presented with fever and muscle pain, and the patient is initially treated with IV ceftriaxone, which is a good enough antibiotic but proved ineffective. Subsequently, patient observed skin lesions, especially eschers that are noticed, very small eschers. And what is your diagnosis? Escher aate hi, the third thing that I will think of is going to be scrub typhus. एक एस्चर हमने remember, second thing, remember I told you एस्चर आएगा, go back 2 hours in time. I told you if an eschar will come and there will be a history of some kind of an animal handling, always think of Bacillus anthrax. And then I told you that if an eschar comes and that comes with some kind of a rocky mountain terrain, some kind of hiking, tripping, and some insect se related aega, then always think of scrub typhus, which is the answer over here. So can you just tell me a simple question? Scrub typhus is caused by which organism? And which is the machhar keeda that bites? Just 2 questions which will get you through. This word you can never ever forget. Orientia susugamushi. This bacteria is so classical. So Orientia susugamushi causes scrub typhus, and it is by the bite of what? It is by the bite of mite. Mite का भी actually it's not the adult वाला mite, it is the baby of the mite which is transmitting it. Baby को क्या कहते हैं? Baby is known as shiggers. जो छोटा बेबी ऑफ द माइट वो आके बाइट करता है. दैट इज वाई द नेम ऑफ स्क्रब टाइफस, इट इज ऑल्सो नोन एज शिगरोसिस. वाई इज इट कॉल्ड शिगरोसिस? बिकॉज शिगर्स आर द लार्वा, द छोटा बेबीज ऑफ द माइट विच आर गोइंग टू कम एंड ट्रांसमिट दिस इन्फेक्शन. दैट इज वाई स्क्रब टाइफस इज नोन एज शिगरोसिस. 3 क्वेश्चन हो गए. शिगरोसिस बिकॉज ऑफ माइट एंड शिगर्स कमिंग एंड कॉजिंग दिस टू अस. सेकेंड क्वेश्चन इज द बैक्टीरिया ओरिएंशिया सुसुगामुशी. नंबर 3, it will always cause these eschers. But do you know something? That eschers is going to usually be missed. It is seen in hidden and moist parts of the body. यहाँ पर तो it was very obvious and they've shown it on the hand. Usually it is not the case. It is either seen in the axilla or it is seen in the groin. So patient will miss it. Patient will not know for 10-12 days that axilla में एक छोटा सा eschar बन रहा है. He will not see it. In the groin there is a small eschar. He might miss it. That is why this disease progresses and is not caught at a very early stage. Okay, someone said louse tick wali diseases. Okay, you guys, I think I've studied this. If you want, I'll take a 30-second. I mean, I am not extending. You are extending the class by 30 seconds more. And you know there's a mnemonic which makes no sense, but everyone learns it. That is let, fen, tria, PSM. I had added it as a bonus slide, but if you want, we will revise it in 30 seconds. What is let, fen, tria, PSM? मतलब कुछ नहीं बनता इस mnemonic का, but same followed in PSM, same followed over here. Let, that what is with louse? Louse से क्या transmit होता है? It is let, मतलब epidemic typhus transmit होता है. Then coming to fen, what is transmitted with flea? N matlab endemic typhus is transmitted with flea. Coming to tria, what is with tick? With tick, we have three things: Rocky Mountain spotted fever and anything that has tick in it. Indian tick typhus, African tick typhus, koi aur bana diya, Australia tick typhus. Anything tick will come with tick. Coming to the last one, that is mite. And with mite, I have two things: rickettsial pox and scrub typhus, which is caused by Orientia susu gamushi, which I was teaching you. Repeating once again, louse से क्या होगा? Epidemic typhus. Flea से क्या होगा? Endemic typhus. Tick से Rocky Mountain spotted fever, Indian tick, and African, Australian, any tick typhus. And PSM में mite से is going to be rickettsial pox and scrub typhus. Let Fen Tria PSM, one bonus slide also you have finished on your own, so that is very, very good. Moving on to the next one. I think this is something which you must have seen a lot in pediatrics, but we must do it here also because it has a microbiology twist to it. Which means we have switched our organ. I mean, there's some hope at the end of the tunnel that you're getting. कि मैम कितना टाइम हो गया अभी? 3 hours 20 minutes हो गए, आपने 3.5 hours कहा था. So now I've come into a negotiation phase where I'm going to buy, instead of not just 10 minutes into finishing class, I will take 20-25 minutes. I'm asking for only 10 minutes more, but that will finish off all the things that I wanted to do, and I don't want to leave anything because after this there is no other part 2. जब इतना बैठे हो तो then I will want you to sit a little more. 3-year-old, and thank you so much. I mean, all this thank you I will say right at the end. I don't want to say thank you right now because I don't want any kind of overconfidence. I've seen you guys in overconfidence are the worst people. You just make everything drop down real bad. So I don't want to give you overconfidence, but you've done a great deal by sitting for this long. It's not that easy to sit with a subject like microbiology for so long. Everyone gets irritated after a while, but trust me, you've done a great job. 3-year-old boy coming to the emergency department by his parents, or brought by his parents, with complaints of fever and again diarrhea and vomiting. Temperature दिख गया, pulse rate increase चल रहा है, stool examination shows double stranded RNA. Anyway, छोटे बच्चे में either ways I was thinking of rotavirus. Rotavirus belongs to which family is what I was wanting to know. So rotavirus belongs to Reovirus, Reoviridae family. That is okay. तो बच्चे का सोच के तो anyway rotavirus I had to think, but that is more commonly seen in infants. Over here my main buzzword was the double stranded RNA virus. तो ध्यान से सुनो, I will come to that. Rotavirus actually causes this diarrhea by which virulence factor? And answer to this, NSP4. Perfect. तो rotavirus के पहले दो questions. It is the most common cause of diarrhea in children. I think you have read this a lot. That is why there are vaccines that are given to children. Which is the main enterotoxin by which it occurs? NSP4 is the reason why diarrhea occurs. Now coming to the next question, why is it that RNA virus तो है ये, double stranded is something you have emphasized so much on? Because please note, usually जो DNA viruses होते हैं, they are double stranded, and RNA viruses are usually single stranded. DNA viruses are what? They are double stranded, like हम लोगों में भी DNA is double stranded, and RNA viruses are single stranded. But now I will come to exceptions. Can you fill in the blanks without MCQs? Fill in कर दोगे? All DNA viruses are double stranded except, and I've got you a hint and a photo on the side, except parvovirus. Remember Paro from Devdas, always left alone. Parvovirus is the only single stranded DNA virus. All DNA viruses double stranded, parvovirus only single stranded. All RNA viruses are single stranded, but which is the double stranded RNA virus? Diarrhea wala. Double stranded RNA virus is the diarrhea wala virus, and that diarrhea wala virus is of course everyone's favorite. Rotavirus ya Reoviridae family, whatever they will write, it means the same, but it doesn't end over here. Why it doesn't end? Because usually RNA viruses are single stranded. ये तो पता है. How many copies do you see? If it's a single strand, ma'am, there is one copy. So not only is it single stranded, but it is also going to have only one copy. Can you all tell me that is there any virus in which there are two copies? Except any virus in which there are two copies? Excellent. Retrovirus. HIV wala, we will write it as Red 2 virus from today. HIV wala is going to have two copies na, so it is going to have Red 2 virus has two copies. Abhi bhi story nahi khatam hua. It is one strand. It is one copy and it is one line. Have I broken it into parts like this? Have I made the virus like this? No, ma'am, you have made the virus as just one copy, one strand, and you have made it completely unsegmented, एक segment. But then comes the most important, which are the viruses which are going to have segments? If you know this, you will answer the next question easily. Segmented किस किस में चलेगा? Segmented, excellent. What are the names? Bira. Bira is for those who love drinking beer, which you should not be drinking. Bira would resonate with you a lot. And that is what are these? Ma'am, alcohol consume karoge to segments, tutoge, giroge, all that. So all the viruses are going to be broken into segments. कौन से viruses आते हैं इसमें? It is known as, either you learn it as Bira or you learn it as Bora. It's the same thing. Bunya virus, number one. Next, if you learn it as Bira, then that is influenza virus. Influenza comes under which virus? It comes under orthomyxovirus. So same cheese. Okay. The next is this diarrhea wala, Rio ya rotavirus. Okay. And last one is arena virus. These are the ones which are broken into segments. So jaldi se tell me the answer to 4 statements. Fill in the blanks karo. All the DNA viruses are double-stranded except Paro, who is left alone. Parvovirus is single-strand. Question 1. Question 2. All the RNA viruses are single-stranded except diarrhea wala, which is double-stranded. All RNA viruses have one copy except red 2 virus, which has 2 copies. All RNA viruses have a single segment, unsegmented, except for Bira, Bora, which are segmented. ये अगर पढ़ा, coming back, double strand diarrhea वाला RNA virus, rotavirus with NSP4, I think we have done. And now you will answer the next question. ये वाला concept I'm letting you forget for a while. Something around this I will come to in 10 minutes towards the end, and I will check whether you remember this Bira, Bora concept or not. Let's take a test of yours and finish off the rest for 10 minutes. The association of HHV8 expected. Human herpes virus 8 is observed in all of the following conditions except. So HHV8, human herpes virus 8, क्या क्या कराता है? Number 1, it causes Kaposi sarcoma, so that is correct. Next, it causes primary effusion lymphoma, lymphomas कराता है, so that is also correct. Next, it causes a Castleman disease, that is also correct. तो क्या नहीं कराता? What does it not cause is adult T cell leukemia lymphomas. That is caused by which virus? Excellent, it is caused by HTLV1. The name tells me, right? T cell leukemia virus. It will cause T cell leukemia in the patient. So this is the answer. Rest, HHV8 causes Kaposi. Now the next question that came on Kaposi sarcoma. What is Kaposi sarcoma? It's a blood vessel tumor. Most common location. I'm asking you all skin questions. Kaposi sarcoma is a blood vessel tumor. So the most common location is going to be on the skin. It's a vascular tumor and it is usually seen in HIV positive individual when the CD4 count, controversial. I don't know why I'm going into this controversy, but since it's your exam question, I am just taking a controversy on my head and answering this. This was a question that came in the FMG exam only, that Kaposi sarcoma, I till date actually don't know question kaise aaya tha, because every student gave me a different version of it. So today I will tell you what you should be doing when you get a question in the exam. Kaposi sarcoma can occur at which CD4 count? और Kaposi sarcoma typically occurs at which CD4 count? ये दो अलग क्वेश्चन बने, ध्यान से सुनो. Kaposi sarcoma can occur. So anytime then the CD4 count falls less than 500, कभी भी हो सकता है. Kaposi sarcoma can occur at any count below 500, CD4 count less than 500. But typically occurs at a CD4 count less than, typically occurs at a CD4 count less than 200. ध्यान से दोबारा सुनो. Can occur, तो मैम 500 के नीचे तो कभी भी हो सकता है. It can occur at any CD4 count less than 500. But typically पूछा, it typically or classically occurs at a CD4 count of less than what? Then your answer is less than 200. दोनों में difference समझ आ गया? This is how, and if the exam had typical in the question, then answer would have been CD4 less than 200. Okay, coming to the next question over here that you have is this. Which of the following, I think another expected one, which of the following underlying factor is responsible for inducing aplastic crisis in individuals with hereditary spherocytosis? Now, hereditary spherocytosis is a hemolytic anemia. Instead of this, they would have written sickle cell anemia, thalassemia, any kind of hemolytic anemia, and bone marrow completely shuts down. Yes, that is parvovirus B19. Always remember, for parvovirus B19, there are 3 questions that they will give you. Full name, parvovirus B19. ये तो कर लिया ना, पारो, single stranded, the only single stranded DNA, ये तो पता है. Clinically क्या पूछेंगे? Yes, the slapped cheek appearance. That is why slapped cheek, 5 ungliयां, 5 fingers, known as the 5th disease, but the technical name, red color rash because of an infection, erythema infectiosum, that is the actual name. So this is one thing that it causes. Not just face, it causes the rash on the hands and the feet. So gloves and socks syndrome it is known as. And it can go and cause complete bone marrow shutdown, that is aplastic crisis it can cause, like in this question over here. Please read carefully. If they would have said hand, foot, and instead of cheek, they would have said lesions around the mouth. Please don't confuse. Hand, foot, mouth disease pucha, that is caused by Coxsackie virus. Coxsackie A also, B also, but Coxsackie A more commonly. Remember, if it is hand, foot, and mouth, then it is Coxsackie. If it is hand, foot, and slapped cheek appearance, then it is going to be parvovirus. Very important. Hand, foot, dekh ke don't give an answer. Okay, and instead of hand and foot over here, they will say gloves and socks. So that is also something you watch out for. Is that okay with everyone? Coming to the next question. Pulse exam coming up on 24th. Something like this will be there in it. There's a 14-year-old boy presented with complaints of fever, sore throat, and malaise. On throat examination, there is a reddened enlarged tonsil and the pharynx is inflamed. Splenomegaly noted. What is the best test for confirmation? Now over here I realize कि क्या क्या लिखा है. If I do RT-PCR is usually done for RNA viruses. Over here, what am I thinking? When I say there's a chota school going bacha with sore throat, fever, pharynx, spleen, I am thinking of that kissing disease, infectious mononucleosis, which is caused by Epstein-Barr virus, which is a DNA virus. Why will I do RT-PCR? Coelocytic cells are seen with human papilloma virus, वो तो cervical cancer and all, off track, इसमें नहीं, out. Then Zank smear is done for herpes viruses like herpes simplex, herpes zoster. This is not herpes. So the only test that is coming to my mind is going to be the IgM heterophile antibodies. Right? So please note that what does it mean? When I say Epstein-Barr virus, let me draw this. This is Epstein-Barr virus. I will say 3 sentences and I will finish all the questions of EBV that have been asked till date. Epstein-Barr virus enters into our body and attacks which cells? Question number 1, it attacks the B cells. Question number 2, it enters the B cell via which receptor? Via the CD21CR2 receptor it is going to enter. Question 2 bhi ho gaya. After entering the B cell, what are the 2 genes that it makes? It makes LMP1 gene and EBNA2 gene. See, one by one I'm finishing all questions. EBV comes to which cells? B cells. Through which receptor? CD21CR2. Causes which 2 genes it forms? 1 and 2. LMP1, EBNA2. After forming these 2 genes, if they say what is the disease that it causes? Infectious mononucleosis. Okay, so now if I ask you that what is the other name of infectious mononucleosis, you will say this is glandular fever. Can you see the patient is having both? Fever dikha, everyone could see patient has fever. Yes. Glandular means glands are enlarged, tonsils are enlarged. Then I can see the spleen is enlarged. Sometimes they will write salivary glands are enlarged. Sometimes they will say the tonsil and the lymph nodes are enlarged. So glandular fever, this is one thing that it is going to cause. Other than that, it can cause what? It can cause cancers. Excellent. Cancers, you will answer. Cancers are of 2 types. Either the cancer is always a lymphoma category. Lymphoma, so it causes everything. Hodgkin's lymphoma also, non-Hodgkin's lymphoma, and I think I've taught you last time. Hodgkin's lymphoma, remember in Path LRR we did EBV association, and non-Hodgkin's में especially that starry sky wala Burkitt's lymphoma I told you is to do with EBV. This we've done. When I talk about cancers, I am also talking about carcinoma, which is the most common carcinoma that EBV causes. And please don't say nasopharyngeal carcinoma because that is the second most common. Most common is not nasopharyngeal. Most common is gastric cancer that EBV can cause. That is the update. Most common gastric cancer. Second is nasopharyngeal cancer. Lymphoma में दोनों Hodgkin non-Hodgkin हो गया. But मैम ये सब पूछा नहीं था. They asked you what is the test for confirmation. So EBV के लिए you are going to do, number one, you will look at it under the microscope. What is this cell that EBV will show under the microscope? Downy cell. How did I identify downy cell? Look at the cytoplasm. It looks like a skirt. Ballerina skirt appearance. FMG का तो favorite most. Ballerina skirt appearance is seen in which virus? It is seen in EBV. Very, very important. उसे बोलते हैं downy cell. And this is the answer. How will you find? See, someone gets infection, what will he make? He will make antibodies. What are those antibodies known as? Those are known as the heterophile antibodies. They are IgM type of heterophile antibody. How do you test for antibodies? That is known as the Paul-Bunel test. Whenever you want to test for antibodies, I will write it over here. Antibody testing ko kya bolte hai? Serology. When I say na, I am doing the serology for this patient, means I am trying to find his antibodies. Serology can be done by, number one, the Paul-Bunel test, which is a type of an agglutination reaction. Paul-Bunel test ho chuka hai purana. Nowadays, what is done? Nowadays, we are doing the monospot test. That is also a type of an agglutination test. So now what I'm going to do, because if I keep telling you everything, I know you will never go back and read. Because you will give a pulse test on 24th, I am clearly and openly telling you that there is going to be a question on Paul-Bunel reaction, which will say this is a heterophile agglutination test. अब ये आपका काम है that you go back to the notes and you read what is the meaning of heterophile agglutination, which RBCs are being used. Because if you will read, then you will answer that correctly. If I will tell you, I know you will listen and forget. कुछ होता है called heterophile. You will just read the meaning of heterophile antibodies and then go and give that test, because that way you will read and then you will never forget. So in LRR also I can give you homework, and I have done that today. Okay, coming on to the next. If I ask you this question, I think this is just spotter because it's a virus and it's in derma, so you are settled with it. जल्दी से बता दो, if you get these umbilicated lesions and you see the classical HP bodies, तो क्या सोचोगे? अच्छा, sheep, everyone is answering. Thank you for answering, but I still want everyone else to read, because सब पढ़ोगे फिर pulse test में जाके Paul-Bunel test answer करोगे, you will remember it till your exam. Otherwise you got the answer right. Molluscum contagiosum. Molluscum contagiosum is actually which kind of a virus? It is a kind of a pox virus. Okay, perfect. So HP bodies, Henderson Patterson bodies, और इसमें कुछ आता नहीं, I have nothing more to tell you. They will always say there's an umbilicated lesion. Umbilicated means in the center there is a depression, and you will see HP bodies. Molluscum contagiosum. What kind of a virus? I just wanted to answer that. That is a pox virus. Nothing else that is needed. Moving on to this question over here, which is your favorite. Hepatitis B virus. These are the different reports you can get. And now you will one by one tell me. Same rapid revision wala table I have got you, so that you don't get confused. Visual memory is the most important. Ma'am, whenever I'm doing the blood testing of hepatitis B, how many tests can I do? I can do total of 5 tests. If I talk about antigens, I can do surface antigen in the blood. I can test for HBe antigen in the blood. Guys, can I test for HBc antigen in the blood? No, because core antigen does not come in the blood. तो इसको लिखते ही नहीं, इसको हटा देते हैं. Core antigen will never come in the blood ना. So I will just remove it like this so that you don't get confused. Core antigen will be out. It is totally out. तो but antibodies तो सबका आएगा. We will have surface antigen antibodies. I will have anti-HBe antibodies, but I will also have anti-HBc antibody. Antibody to will come for all, but antigen will only come for 2. This means I have total of 5 tests that I am going to do in the blood, right? Now, which is the first thing that becomes positive whenever someone has hepatitis? The first marker is surface antigen. So whenever they say surface antigen is positive, hepatitis has started. Okay, when they say E, एक word में समझो. E tells me what? E is for E, that is infectivity. When I say HBe antigen is present, like over here HBe present, I'll say ma'am, patient is very, very infective right now. Infectivity is very high. In these cases, there is no infectivity. So E will tell me about infectivity. Okay, now if I start reading this, common sense tells me IgM antibody tells me acute inflammation. IgG antibody tells me chronic inflammation. हमारे basics settle हैं. Now let's start. And I know meanwhile everyone was like, मैम ये तो logic था, हमने जिस तरीके से याद कर लिया था was SEMA, and if you want to learn it this way, SEMA and SEGSI. What does that mean? SEMA and SEGSI means that if the surface antigen is positive and the E antigen is positive and IgM type of anti-HBC is positive, then this becomes a case of acute hepatitis. Repeating, surface antigen positive, E antigen positive, IgM type of anti-HBC positive, it becomes a case of acute hepatitis. Versus कुछ नहीं करा, सब same, surface antigen positive, E antigen positive. Instead of IgM, if I make it IgG, now it will become a case of chronic hepatitis. So I think the IgM IgG concept is pretty obvious to you. Now tell me, are these high infectivity or low infectivity? E antigen agar positive hai dono mein, so what are these going to be? These are of course going to be high infectivity, which is important for you to know. Look at the third situation. Antigen negative. Antigen negative. All antigens are negative. Antibody positive, antibody positive, antibody positive. All antibodies are positive. Patient is in what? Excellent. Antigen chala gaya, all antibodies are there. Patient is in recovery. Common sense. If instead of all antibodies, everything is negative, only anti-HBS, only the surface antibodies positive, very good. Immunity or vaccination, and that also more than 10, equal to more than 10 titer should be there. Like if you ever want to know that you were vaccinated for hepatitis B, are you immune or are you not immune, get your anti-HBS titer done and it should be more than 10 to know that yes, you are immune, which you will get before your internship, before your residency. If you are not immune, you will get a booster dose of hepatitis also. Coming to the last, if everything is negative and only HBC ka antigen to can't come, HBC ka antibody is present, that is indicative of that gray zone. Very good. That is indicative of window period. So these are all the different things that can be asked to you in the exam for hepatitis. Very, very important. Please, this table ko bhi again one slide, you read it again and again before the exam. Now let's see if you were listening to me sometime back. Which organism is indicated by provided form of replication amongst the following options? Hepatitis, influenza, HIV or herpes. Which virus do you think is this? If you want, I can zoom in a little for you, but the word of the virus is not written. Most of you have started answering B. B on the basis of influenza. तो कैसे पता लगा? Because I saw the virus and I realized that ma'am had always said single strand, one copy. I can segments nahi hote, and over here I can notice 1, 2, 3, 4, 5, 6, 7. Maybe you could not count in the exam, but itna to you could see na that oh, there are so many segments coming out. Now I had studied that oh, as per the Bira Bora mnemonic, these were the segmented ones. So obviously, which is the virus that is fitting into it? It is going to be the influenza virus. And now notice very carefully, it exactly has how many segments I have drawn? It has 8 segments and it has 2 molecules on its surface. One is known as HA, one is known as NA. I removed those, but examiner लिख के देगा. Examiner इसके ऊपर लिखेगा HA and he will write NA. Why? Because influenza na, it has to go to your respiratory tract. Influenza is what? Respiratory infection. How will it enter into your respiratory cells? By HA, hemagglutinin. After entering your respiratory cells, how will it come out of the cells for the release? Neuraminidase. Remember, HA is for the entry into the cells, NA is for the release or the exit from the cells. And how many segments of RNA will it have? It will have 8 segments. Abhi winter season hai, influenza ka kuch to aayega. This is something which they like to ask. Moving on to the next question that you have. This is just for time pass. I have given kuch, I know, very bad time for time pass, but just for completion you can say I have given. 32-year-old lady brings her 2-year-old unimmunized child to a child specialist. So very pediatrics question. High grade fever, cough, runny nose, watery eyes. Can I reread it? Cough, coryza, conjunctivitis. Then there is a rash which started from behind the ears. Kitna classical history chal raha of measles. So this is measles ka history. I think, as I said, very time pass question. But that table which I have, which will take exactly 30 seconds, तो इसका measles, mumps and rubella वाला table जल्दी से first tell me incubation period line से बता दो. MMR, measles, mumps, rubella का incubation period is 10 19, 14. Repeating, it is 10 days, 19 days and 14 days. By the way, today's bonus slides have one slide जिसके अंदर I think I've picked up 15 important organisms जिनका incubation period I have written. उन 15 का incubation period पढ़ जाना. You can't learn everything, but those 15 you should be knowing. I've kept it in the bonus slides. Remember 10, 19, 14. ये हो गया. MMR is a vaccine in pediatrics. Tell me their strains. For measles, what do we use? We use the Edmonston-Zagreb strain. अब सब pediatrics चल रहा है. Mumps के लिए कौन सा strain use होता है? Gerillin strain. And rubella, R for R, it is RA27/3 strain, which everyone has written, which is right. Measles की history में क्या आएगा? Fever and 3 C's. What is 3 C's? I just told you, cough, coryza, conjunctivitis. Cough was written, coryza is running nose, that was written, conjunctivitis, red, watery eyes written. After fever and 3 C's, then buccal mucosa पे क्या दिखेगा? Coplic spots. And after that, what will you see? You will see the rash. Where is the rash starting? First it is starting behind the ears. After that it is going dhire dhire dhire, it is going down to the rest of the body. Is that okay? Coming to mumps. Mumps में cute सा बच्चा, cute cheeks. वो cheeks नहीं है. Those are actually the bilateral parotids that are enlarged. Bilateral parotitis. When the testis is involved, that is unilateral. Testicular is unilateral orchitis, but parotid gland is bilateral parotitis. Coming to rubella. Rubella is usually a part of torch infections, na, mother to child. So remember, rubella बच्चा is प्यार में अंधा बहरा बच्चा, deaf and blind in love. So what is प्यार में अंधा बहरा बच्चा? प्यार tells you patent ductus arteriosus. अंधा बहरा बच्चा means cataract and sensory neural hearing loss. So that is a part of rubella. Just a very quick recap of entire pediatrics. Okay. Meanwhile, coming to, तो इसमें तो measles था. I mean, I don't have anything more to teach you in this. If at all I ask you from pathology point of view, measles में which giant cell would be seen? I think you all know it. I had given you in the bonus slides of last path PDF. Warthin, Finkelde giant cells are seen in measles. Moving on to the next expected question. False about Ebola virus. You know ये Ebola Nipah कुछ तो आएगा. Ebola virus का what is false? Does Ebola virus belong to the family of filovirus? Yes. Remember, Ebola is actually Filoviridae family. ये तो correct है. Is it going to be bats which are acting as a reservoir? That is also correct. Can Ebola go from human to human? Yes. Patient secretions, correct. So what is false? Is it transmitted by a mosquito? No. Ebola has nothing to do with Machhar Kida. That is false. Ebola, as you can see in this picture, it is coming from bats. Either the bat is coming in contact with the human one way, or the bat is coming in contact with some animal, and that animal can sometimes come in contact with human, rarely, or human to human, but primarily it is going to be bats. Remember, if bat is written, you will think of Ebola, but if fruit bat is written, you will think of Nipah. Do we know this? Last to last FMG exam, this was the very first question that came in most of the sets. They asked you, अगर bat से related आएगा तो Ebola करना, but अगर ये fruit bat वाला story आएगा, which is the one that you will think of Nipah. Nipah virus has a mortality of almost 60 to 70%, reason being that this straight away goes and attacks the brain. That is encephalitis. Bat, Ebola, fruit bat, Nipah. Nipah से patient जाएगा, 60 to 70% mortality is damn high. This patient is going to die because of encephalitis. Yes, yeah, Nipah had a 2018 में outbreak हुआ था, especially in Kerala. Okay, so those who are asking me, ma'am, कितना slides रहता है? So, congratulations, you've reached the last, the disease that matches the life cycle of Japanese encephalitis. Japanese encephalitis का actual question आएगा PSM में, because PSM has that new vaccine which I think I have also told you many a times, the Genvac vaccine, which uses the Kolar strain. And Kolar strain के बाद, it is what kind of a vaccine? It is a kind of a killed vaccine. Primarily the question has to come on Japanese encephalitis and the new vaccine. But if examiner just wants to test your knowledge, he will ask you the life cycle, and this I've got you. फोटो से देख के बता दो, हम लोग तो एक्सीडेंटल होस्ट हैं, कभी कभी इन्वॉल्व होंगे. वी आर द एक्सीडेंटल होस्ट. Actually, the life cycle is happening between this machhar. Which machhar? Culex. This means Culex is going to be the vector. Ideally, the life cycle is between culex and bird, culex and bird. That's the natural life cycle. Which bird are we talking about? Natural reservoir कौन है? The ardid bird. So it's between culex, bird, culex, bird. By chance, if it goes to the pig, this machar says, now I want to go and infect the pig. So pig and culex, pig and culex, pig is the amplifier. So over here, the amplification is going to occur in the pigs. And by chance, फिर हम पर आ गया, तो we become the accidental host, which is the answer over here. Genvac vaccine, I think I have told you, that is Japanese encephalitis का vaccine. Either a life cycle will come or vaccine will come, और कुछ इसके अंदर बनता नहीं है. Now what you will be left with are few bonus slides like I told you, जिसके अंदर ये आपको कुछ incubation periods मिलेंगे. You will get some inclusion bodies, you will get some extra thing कि अच्छा बाकी वाले भी जो पढ़ लो, PSM का येलो फीवर में क्या होता है थोड़ा देख लेना. All these 4, 5 and one more you will get will be this, which will be to do with all these are ये viruses का shapes. Just 5, 6 bonus slides. ऐसा भी कुछ नहीं है that you will have to study a lot on your own. I have done most of that torture thing for you. So now what you are left with, एक homework कर लेना, Paul Bunnell test पढ़ लेना before you give the pulse exam. Second, study this PDF well before your exam, but don't be कि अब से कुछ भी नहीं पढ़ेंगे, सिर्फ ये पढ़ेंगे. No, till wherever you can hang on to your rapid revision videos and notes is the best. When you feel it is just not doable now, नहीं हो रहा, it's slipping out of my hands, then you do LRR. There are no more crash course sessions that I'm gonna take, so don't wait for anything else. Path, micro, both are done, so this becomes your go-to thing whenever you don't feel like studying anything. Totally give up situation जब आ जाएगी, pick up the 19 PDFs of these 19 subjects and just keep reading them over and over again, because rather than not studying, it's better that you study something. Thank you for the patience. I know we are almost into 4 hours of the session, but you guys have been extremely cooperative. Very rarely have you asked me for a break, and very nicely and politely I have refused it on your face, but you have still been so nice to stay ahead. Yeah, Dr. Divyanshu, I think that controversy remains. Beta 7 is what is the latest update. I mean, I can't attach links over here because even if you Google it out, all the high-end journals have already included Beta 7 for sickle cell anemia. Why you must be saying it's not confirmed is because it's not come into the textbooks, but please understand it takes certain processing for it something to be published in a textbook. It doesn't come the next day. It comes in journals faster than it comes in textbooks, and it has been confirmed. I think yes. Right. Anything else that you feel? I didn't want to clutter everything into LRR. कुछ भी अगर ऐसा हो जो आपको personally as a doubt नहीं समझ आ रहा, you can always put it up on the Telegram group. Sometimes in between I do close the Telegram group thanks to those unnecessary bots which are very irritating. But time and again I do open it for the doubts, the genuine doubts to trickle in. And you can write it on the Telegram group and I'll reply to you either as a voice note or as a text message. So I don't want to put everything into LRR because then it becomes another rapid revision and it's pretty useless, right? So anything you feel, if you can reach me on Telegram, well and good. If you can't, if you feel that nahi mujhe mil raha, nahi Telegram access mil raha, then put it in the comments under this video about your doubt. Just put a thing that ma'am, I've sent you a message on Telegram or whatever, and I will get back to you, right? Fine. So just doing PYQs and LRR is good strategy now. अभी नहीं, I think Jan 1st से ऐसा कर लेना. अभी एक हफ्ता और कोशिश करो that you can do something which is closer to your rapid revision. Maybe in the last 2 weeks I would say हाँ, you're not left with much of an option. उसमें कर ही नहीं सकते उससे ज़्यादा. But right now still last 1 week try to hold on to your rapid revision videos. Someone said stay hydrated. Yeah, that I truly need right now. 4 hours of talking non-stop. That to microbiology, it's not just boring for you, it's boring for us also as teachers sometimes to teach such topics which are very core, cramming up, but and to keep you guys, in the class also is quite a challenge, because we also know that it's boring. We know what we are teaching is a very dry topic, and sometimes we know that, oh, these people must be getting so tortured beyond limits, but we don't have an option when an exam comes up, right? Okay. Yeah, thank you so much. Good night, everyone. Don't sleep right now. Try to study a little, maybe revise, scan through this PDF once as you get it in 10 minutes. If not, study whatever you had planned to. And yeah, just consistency. Keep going. Every day you'll feel like giving up. Every day you'll feel you're lagging and you're forgetting things, but that's a positive sign. Trust me on that. Just keep going, because that cycle of forget, revise is what is going to actually sail your boat on the D-Day. So keep going. Pulse exam de dena. Pulse exam ka ek video solution dalega of all 19 subjects. Do go through that on a 2x speed so that you know where you've made your mistakes. That will be another thing that will help you know what are your points that you have to focus on in the last 2 weeks, right? Okay. Thank you. Okay. See you guys soon. Okay. Study well, guys. Thank you.